Hey, Sean, thanks for having us on this afternoon. Hey, Lloydminster and surrounding area. Isn't this awesome, Landon? We're on a radiothon.
We are on a radiothon. Everybody's got together. Husky Energy, I heard, donated $50,000 to this cause. Huge. Yeah, it's a great cause, our health foundation. We need the health foundation in Lloyd more than I think we've ever needed them. Jordan Pollard was just before. We miss you, girl. It's been a while through this whole COVID thing. We got a couple songs to play for you guys. Yeah, thanks, Sean, for asking us to do this. This is really cool. What songs are we doing there, Shoot?
We're going to do Headed for a Good Time, and then we're going to break into your song, where it all started.
All right. Let's do this.
Speck on your map, hey, what's wrong with that? We love where we are. There's not much around, it's barely a town, but a lot goes down at dark. It's Friday night, let's run off the rails, baby, heads or tails. We can get a buzz on right in the middle of a whole bunch of neon lights. Or maybe take a back road down by the river, wind up wherever you like. Either way, girl, I'm okay, 'cause you're here by my side. So let's just set the wheels for wherever they go. We're alright, we're headed for a good time. We can hit up your friends, hang out with them, or keep it just me and you. Whatever it takes, we're gonna make a memory to hold on to. Smile at the moon while sipping on shine, start blurring lines. We can get a buzz on right in the middle of a whole bunch of neon lights. Or maybe take a back road down by the river, wind up wherever you like. Either way, girl, I'm okay, 'cause you're here by my side. So let's just set the wheels roll wherever they go. We're alright, we're headed for a good time. Sometimes it seems like life ain't fair, but every time you turn around, girl, you know I'll be there. Like an angel sent from above, you come around and I feel love. So I wrote this song to show you what you mean to me. If you wanna jump in my truck and crank the tunes up, baby, that's fine with me. If you wanna sit in the moonlight, watch a starfly, or spend the night on the beach. The way you make me feel inside, yeah, girl, this can't be wrong. So sit down in that chair and sing along, 'cause this is your song. Your heart, your smile, and your eyes make me feel like I've been hypnotized. I love the taste of your kiss, the way you walk, and that's not it. So I'm gonna sing a song for the rest of my life. If you wanna jump in my truck and crank the tunes up, baby, that's fine with me. If you wanna sit in the moonlight, watch a starfly, or spend the night on the beach. The way you make me feel inside, yeah, girl, this can't be wrong. So sit down in that chair and sing along, 'cause this is your song. This is your song. The way you make me feel inside, you know this can't be wrong. So grab yourself a nice cold beer while I finish singing your song. If you wanna jump in my truck and crank the tunes up, baby, that's fine with me. If you wanna sit in the moonlight, watch a starfly, or spend the night on the beach. The way you make me feel inside, yeah, girl, this can't be wrong. So sit down in that chair and sing along. If you wanna jump in my truck and crank the tunes up, baby, that's fine with me. If you wanna sit in the moonlight, watch a starfly, or spend the night on the beach, yeah. The way you make me feel inside, yeah, girl, this can't be wrong. So sit down in that chair and sing along, 'cause 'cause this is your song. This is your song. Thanks, Sean. Good luck, Mikey Dub. Keep it up. 12 hours, that's insane.
Thank you, Lloydminster.
Well, thanks to the Dirt Rich. You know, it's funny, all the things that was like my own little concert here, eh? I'm joined now by MLA Colleen Young. How cool was that?
Awesome. It was really cool.
Now, there you
Go
can
look at
see,
it.
he's
I
filling
know.
up on a banana right now. I told all the listeners, viewers, in the dark, we had to switch over live streams. And I said
Yeah.
he was going to run the entire time. And when we come back off of Dirt Rich, he's eating a banana. So we're not so sure, Mikey.
Well, no, that's a good thing, Mikey. They should have brought you boxes of Chiquita bananas because that potassium is what will keep your muscles working, right, throughout this radiothon.
Well, here's where we sit right now. Coming off halftime, we're sitting at $140,000 in.
That's amazing.
And Mike is at 62 kilometers ran. We're breaking that down. 93,000 steps he's taken. He says it's just another day in the office. I don't know what office that is. That ain't my office. And that is, he's up to 118.50 per kilometer he runs. So that's roughly, now he's raised $7,300 that way.
Wow. So no, you blew that Fitbit right off the wrist, right? Already.
Well, how's Colleen doing today?
I'm doing really good. I'm fine.
I've said this multiple times through the day. We send out, text, email, phone call, whatever it is. What about the Health Foundation, what we're doing here today? Spoke to you and you're like, absolutely, I'll come sit down and carve 5 minutes out of my busy day for you guys.
There's nothing more important than healthcare for any community in this province, and no different for Lloydminster. I think having a well run and up-to-date hospital is extremely important to every citizen in many communities across Saskatchewan, but no different here in Lloydminster. So
yeah, I agree, and I'm sure you'd probably mirror what I'm saying in that no matter what stage of life you're at, you hope you never need the hospital or continuing care, and that you live this healthy life and whatever. But then, I just had kids. You've had kids. And
absolutely.
the hospital is there, and they do
Yeah.
an amazing job. And they just are such exceptional at what they do and making our day-to-day lives go off seamlessly when we need them.
I think it's really important for people to know that there is a place where when they are needed, whether it's from birth to death, that they have the health care and the people working in those facilities that are necessary in order to provide them the services that are required. So and kudos to our health care people that have been working throughout this pandemic to support their community and make sure everyone stays safe.
Yeah, absolutely. Now, I've been asking for stories from things that have affected or impacted your family, friends, that kind of thing, doctors, nurse stories, hospital, having kids, continuing care, just to kind of tie a personal feel to it. Is there anything you could share, or maybe a happy story or a story you've seen maybe in the last year that you would like to share with the viewers?
Well, there's lots of many happy stories when you have friends that are like yourself that are having children in our community and adding to our population, and that's always a blessing and a wonderful thing to be able to share with our community. But I think also, some of the stories that I've heard about, our seniors and older people who have received some excellent and wonderful care from our physicians, our specialists, our nurses, our healthcare aides, our LPNs, and everybody that works within our hospital. And I think that's what's really important and which drives people to donate today and ensure that we do have the facility that is necessary in order to serve everyone.
Does it surprise you in our current state of 2020 where, it's been tough on businesses, been tough on families, been tough on individuals, and yet here we sit and we start this thing up and it just like a bullet out of the gun, we are off and rolling, and it is unbelievable how responsive the community is here of donating and supporting. And does that surprise you?
It does and it doesn't. Knowing the economy the way it is now in our province, and particularly in our oil and gas sector, And the sponsors that have normally supported things, whether it's from a hockey team to a basketball team to anything that goes on in our community, I know that they always come through, and it's even more surprising in this economy right now to see this. I mean, look at the, your first initial one early this morning.
Yeah, Husky with 50,000.
But it doesn't surprise me. Next to the hospital, we have a helipad that STARS can access now, to provide excellent health care for people. And that's because of people and organizations in the industries like Husky who stepped up, but not just them. Our agriculture sector, everybody has, contributed.
And this year it's been cool. I keep bringing up the 118.50. People, even the 50 cents helps, right? Especially when the guy runs, 62 kilometers, right? That all adds up. It all adds up today.
Yeah.
Before I let you go, I've been getting everybody to give Mikey Dubs some encouraging words because that man is in an isolated room. He's not around a whole lot of people. And so he's listening to this as we go. So if you want to pass him along, it's a little bit delayed, but he will eventually get it. There he is. See, he's waving. So if you can give him some words of encouragement, Colleen.
I keep going, Mikey. You're doing an awesome job. Keep eating those bananas, as you know, in healthcare, potassium, potassium, potassium for the muscles and lots of fluids. But thank you for what you're doing in order to support healthcare in our community and contribute to the ongoing needs of our citizens. So thanks, Mikey. Have a great afternoon.
Awesome. Thanks, Colleen, for hopping in. I really appreciate this.
No problem.
Now, we're going to flip to Senior Respiratory Therapist, Tony Reddex. Now joined by Registered Respiratory Therapist, Tony Reddex. I got it right, Tony. Hey, it's a little bit of word mumble jumble, but I got it right. Thank you for joining us.
Absolutely. Yeah, my pleasure, Sean. Good to be with you. You bet.
Now, I got to know, Ottawa Senators fan? What you got? We're matching here. What you got?
Oh, very good. No, I did my schooling in Ottawa, and I actually worked one year at the then Corral Center. And as we were discussing, it was the year Curtis Joseph went after the referee in the corner to that one playoff game. So, yeah, it was quite an experience, and not only working at the Corral Center, but living in Ottawa, tremendous city. Met some fine people there, and obviously, my career was basically born there. So, really enjoyed my time in Ottawa.
Where are you originally from, Tony?
So I'm from outside of London, Ontario, small town called Tempsford, population about 2,500, surrounded by fields, dairy cow country. Again, born and raised there, and I try to get back there every fall, and I miss it.
Do I dare ask what brought you to Lloydminster then?
Simply employment. We had been working in the Maritimes for maybe 5 or 6 years, and just some circumstances came up where we ended up moving back home. And again, I ended up having to look for work, and I was fortunate that the then Prairie North Health region was looking for a full-time respiratory therapist. So obviously applied for the job, and I suppose the rest is history.
Fair. You mentioned that you and your girlfriend are both frontline workers.
Yeah.
Currently, we're living through something that nobody's ever experienced.
Sure.
How has it changed your guys' lives over the last, what are we going on, 9-10 months now? Like it's been a good chunk of time here. How has things changed for you two in particular?
Well, obviously it's nice having someone whom is in the field, kind of experiencing the same, emotions, anxieties, feelings towards the situation, and being able to kind of express, those feelings with somebody you love. It's definitely an asset. Granted, we have a very good team at the hospital, and it's something that, we often, kind of discuss those feelings. So, but yeah, with Linda being here, it's obviously been fantastic. And yeah.
Well, how has, for us common folk, how has work changed Like, what's maybe a couple of the things you can paint a picture for the listeners and the viewers on how things have changed by pre-COVID, after COVID for you
Sure.
folks going to work at the hospital?
Yeah. Well, I know from our end, in January when the COVID-19 kind of first presented itself, at least, in North America, we engaged the staff and the physicians with mechanical ventilator training, also airway management. As time went on with what was happening in New York and other cities, we were preparing ourselves as much as possible and transitioning that way in case, we did see a mass influx of patients. And, where we are not a tertiary care hospital, we do not maintain mechanically ventilated patients at our facility, but we were we're preparing for that a prospect in which you might have, mass patients where, we hear now that Saskatoon, Edmonton, their ICUs are filling up with, critically ill patients, mechanically ventilated patients. And again, the prospect that we may be having to maintain those patients. So staff preparedness was kind of the biggest thing from the outset. Certainly, if you've been in the hospital, visitor restrictions, those are the first, couple of things that come to mind that were, very significant.
One of the long-term outcomes of today is a professional development fund exclusively for respiratory therapists in the Lloydminster Hospital. Why is that so important to your group? Like, what?
Sure.
Can we talk maybe a little bit about what that means to the respiratory therapists?
Well, I think the first thing that kind of crossed our minds, we're a very small department. We're two full-time staff and one casual. We were overwhelmed and obviously thrilled finding out that the foundation was prepared to set aside some funds for us for professional development. What it means, Sean, is basically our ability to attend conferences, seminars, potentially throughout North America, and obviously gaining knowledge within our field, and then applying that into into our practices, every day at the hospital. All in all, enhancing patient care and again educating staff, and again further enhancing patient care that way. So it's extremely important, and again we're all extremely excited.
I've been getting asked a lot today and leading up to this, what the public can do to help, specifically the healthcare workers, the frontline workers, and if there's anything they can do to help. They want to do it, but what would you say to that? How can they help?
Yeah, for sure. I think the best thing folks can do really is donate to the Radiothon. The fact that we currently have visitors restrictions and folks' inability to enter the hospital, by far that would be the best way to contribute. And I mean, on top of that, if you happen to know of any health professionals in your area, friends, family, neighbors, what have you, just, sending your thoughts and prayers, that'd be fantastic. And obviously, doing everyone a favor by, the three things: social distancing, masking, and washing your hands. Okay. Absolutely the best things that we can do for ourselves.
Well, before I let you go, we got Mikey Dubs running for 12 straight hours today. He is a little bit crazy at times, and I applaud him for what he's doing because I couldn't do it.
Sure.
I don't know about you, Tony.
No.
Do you want to run for 12 hours on a treadmill?
12 minutes, maybe.
Well, here's the big thing. Every step he goes earns a little bit more money because people have been donating per kilometer. So whether that's $1 or $10 or what have you,
right.
And it all adds up at the end, right?
Yeah.
So could you give Mikey the thumbs up and say, "Go, Mikey, go"? We're counting on you.
Absolutely, Mikey. All the best. Keep at it, and go, Mikey, go. We're rooting for you, and good for you. Thank you very much.
Well, that was Tony. We are now joined by Dr. Joan Wheat-Hosak, orthopedic surgeon here in Lloydminster. So first off, Joan, thanks for hopping in here.
My pleasure.
And you got a little Angus with you.
I do, yeah. Angus is just 7 months old. He's been keeping me away from work a little bit this year, but I can't stay away entirely. I just came from the office.
Now do me a favor, because my math is slowly getting shoddy as we go along. 7 months ago would have been the beginning of COVID. So
yeah, kind of. It was May 15th was his birthday, so
Okay.
yeah, just right at the start of things.
How was having a baby in the middle of all this?
It was interesting. So he was a little bit late, which actually turned out to be a significant advantage because I got COVID. I caught it from a patient at the end of April, kind of the last on-call stuff I was doing. And my husband got it from me, and that was about at 38 weeks. So luckily we were able to be home and isolate, and we were both pretty well. We didn't have significant symptoms. My husband had a bit of shortness of breath and a bit of a cough, and I mostly just kind of had a runny nose.
But what a stress in the middle of pregnancy.
Yeah, so that was
especially
a bit.
Almost at full term.
Yeah, and really, I wouldn't have actually even any other year have thought twice about the symptoms I had, but I knew I had a positive patient, and I knew I was going to be a patient myself shortly at the hospital,
Yeah.
so that's what prompted me to get tested. So we were positive, but we were able to do our 2 weeks before Angus came along, which was awesome. That we were kind of past the danger zone when he was born. But it was certainly a little bit different. We were
He's already got the lean. He might become a future podcaster, right?
Maybe so. I'm sure he'll have stuff to say. So yeah, it was a bit different, but the team at the hospital was well prepared for COVID patients, and they treated us as if we were COVID positive because we were just so freshly passed, and everything went smoothly.
Could we talk maybe about how before and after COVID, no COVID, or COVID, or no COVID to COVID,
Yeah.
how things have changed specifically for your job?
Sure. So we slowed right down at the start. We were seeing fewer elective referrals and really just doing the trauma, the broken things. But that doesn't mean those go away. They just sort of pile up and wait for things to settle down. So we started back up again in the summertime, accepting new referrals and seeing patients again, and kind of got back into the full swing of things. But everything is just slower. So the turnaround time in the operating rooms so that the teams can clean properly and use proper PPE just makes things slower. So our wait lists in orthopedics are always long, and they are everywhere in Canada. COVID hasn't helped that.
Yeah, no, for sure. Is there, to the general public, is there something that's maybe a misconception on our part on how things have changed, and something you'd like to let people know about? Like, you can get frustrated all you want, but like this is kind of what's going on, and these are now we got to wear all this stuff, and this is why that
Yeah. So I think people certainly are frustrated always with long wait times to surgery.
I owe it all to her. I told her one day I was going to do something stupid like this.
Wait a second, are you the one who fixed his knee?
Yeah,
Whoa.
he's fine.
We're gonna change gears here, dears, because Mikey's had knee surgery, right? Like, he dropped that bomb on the podcast, and I'm like, why are you ultra marathon running?
I didn't tell him that was a good idea.
You heard it here first. Orthopedic surgeon says run after major surgery.
It's been a couple years since his surgery, and Mike was a great patient. He did everything that I asked and more, and has had a wonderful recovery, obviously, or he wouldn't be doing what he's doing.
You want to know something funny? And nobody can see this but me, but Mikey's texting me right now to explain that. But the first text says, a swear, or what looks to be a swear, I F my knee. That's what it looked like to me, and I'm like, oh boy, that ain't going to be good.
Yeah.
And now it's come through 3 more times, because I'm sure you can see my confusion. And it says, please, 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 she fixed my knee. That's the communication going on here today.
He did the first thing, and then I did the second thing. Yeah.
That's cool. Is it amazing to see what he's doing right now?
It is. I must say, Mike is probably the poster child for. I've had lots of patients had successful surgeries, but nobody else has started becoming an ultra marathon runner post knee surgery. Mike's an exception.
Well, as I was saying, like, he's up past 62 kilometers. My head does simple math, and I go, well, if he holds that pace, that's 100 and, well, now I can't even do 124, right? 124.
And he's going 12 hours?
12 hours.
Yeah, he's a crazy person.
Now, he's got to hold that pace, and that might be a little lofty, but at the same time, I mean, I just go, man, like what you do for a living and the way that he's come back from that. Did you ever think, like, you probably see stories like that from time to time, or is Mikey just a rarity? I mean, 12 hours running on a treadmill is a rarity, but in general.
Mike's special, but I would hope
Well, you hear that, Mike? You're special, buddy.
But I would hope that most of my patients go back to doing daily life without having to think about that knee that used to hurt, that shoulder that used to pop out. That's the goal, is that you can go back to sports and work and life, and you're cured. Right. Not everybody has such a roaring success as Mike has had, but many do.
Now, you specifically, are you originally from Lloyd?
I'm from Marwayne.
Marwayne, that's right. Why did you, after all your schooling, and I assume there's many a giant hospital,
yeah,
why Lloydminster?
Well, so I grew up on a farm. That was a pretty good draw to come home to the farm again, and my husband, being a farmer rancher, didn't want to be in the city either. So right from the start, we'd always planned to come back to Lloydminster. I thought I would actually do family medicine when I started medical school, and then I saw some orthopedic surgery in the summer between my first and second year and thought this was pretty cool stuff and explored it, and then was lucky enough to be able to come and do orthopedics in Lloydminster because that had just started. Dr. Kowalczyk, my partner, had come back and started orthopedics in Lloyd just a few years before I came back, and he did a ton of work to get the program up and running. David Fan, who used to be the CEO of the old Prairie North region, kind of stuck his neck out a bit and gambled on orthopedics, and I'm grateful that he did and that Dr. Kowalczyk set it all up because now we do a lot in Lloydminster, and we've got a pretty great job. Our orthopedic practice is general, so I see knees and shoulders, I see kids and adults, I see broken things, and I see worn out things, which in the city you'd have a fairly narrow practice. People tend to have a foot and ankle practice, or they're the spine guy, and yeah, hilarious.
Hey, I'm impressed he's stayed with it for this long, eh? You
Yeah.
just want to get out and roll, all right, bud?
My job's pretty interesting in life.
That's right, that's right. Just talking about the people who've been donating, the companies, I've been, like, where we're at today in our area, the industry, businesses, everything just in very difficult times. Does it surprise you how much support this has received?
Yes and no. I think the Health Foundation and the community in Lloydminster has always done a wonderful job of fundraising through the gala. Not being able to do that this year and some of the extra financial stress that people in the area certainly are feeling this year, you'd wonder if maybe this wouldn't be as successful a fundraiser. So I'm impressed and pleasantly surprised that the dollars just keep rolling in today. That's wonderful. And I guess I shouldn't have expected anything else. That's kind of one of the beauties of being in a small community.
Now, before I let you go, why I've been getting so many stories about how doctors, nurses have impacted people personally. Why did you want to get into becoming a doctor? Can you remember that moment?
Yeah, I loved science, so I knew that I wanted to do something in that field. I thought about veterinary medicine and a few other avenues, and I think probably what inspired me to do medicine is that I think if people have a gift and an ability, that they owe it to society to use that.
That's pretty cool. Well, speaking of inspiration, before I let you go, the guy there on the treadmill running, would you mind saying a few, whipping him into shape here as we roll down the second part of this leg?
You betcha.
And just let them know that you're thinking of them.
I saw the tweet yesterday that you were going to be doing this, Mike, and I thought, oh my goodness, this guy is really testing my work. So I'm glad that it's holding up. Go, Mike, go. Go, Mike, go.
Right on. Well, thank you so much for stopping in, and thank you for just sliding in there the knee thing. That's amazing. I kind of forget about that from time to time, but really appreciate you sitting here and coming in and bringing Angus in and sitting across from us for a few minutes.
Oh, pleasure. It was fun.
Thank you.
Thank you.
Well, we keep rolling on. I've been, Mikey, you hearing me? I feel like Mikey's gonna see me put headphones on, and I'm gonna get him to put headphones on here. He's probably coming here at some point, folks. I can see him thinking about it. But we're up to $140,000 on the day. Mikey at $118.50 per kilometer. I'm going to hassle some people here pretty quick because I'm curious what the donation total is going. But hey, Mike, can you hear me?
Yeah.
I completely forgot about your knee.
I know, man. When I saw her, I was just like, oh shit, Joan's here. I mean, colorful language.
I think you've earned it now.
Yeah.
Well,
so she gives me a little bit more motivation to keep pounding on this.
I think it's a pretty cool story. That her and Angus are still sitting beside me. They just can't hear you. That's the biggest thing.
Well, you give her a big up for me.
Yeah, he says, just to bring you back in for a second, he's saying that essentially it means a lot you being here, and it's firing him up to keep going.
Good.
And tell her I might need to book an appointment, a checkup.
He says I need to book a checkup.
After this run, you might, yeah. The warranty's only good for 500 kilometers, Mike.
Yeah. I blew that up a long time ago.
Right on. Thanks, Mike. Thanks, Joan.
You're welcome.
Okay, well, we carry on here. Like I've been trying to update as we go. I'm going to start hassling the ladies here. I haven't had a total adjust now in like 15 minutes. That seems kind of odd for us. I'm not going to lie. I feel like I'm cracking the whip on my own side here. We're up to $140,000. We've been saying that now for the last 20 or so minutes, which maybe by all means we're at 140. To go recap the first 6 hours as best as I can. We started off the 7 a.m. morning with a $50,000 donation from Husky. And then from there, it just rolled. Premier Scott Moe called in. You can see Steph a little bit here cleaning. And we're making sure everything is top-notch. Like, I got the best staff ever. Some of the other big ones that came in, Agland at $15,000, CNRL at $16,000. There was a couple power hours we did. Like, it's just been, the support has been pretty mind-numbing, to say the least. I have a hard time talking to it all because there's been so much. Now, everything's cleaned up, so I have Donna Shelonberg sitting across from me. I hope I'm not torturing your name.
Not torture my name. It's all good.
Now, you're from To The Core.
Yes, I am.
My first question, and it may be a poor one, is why is Pilates so important?
Oh, wow. So just in general terms, or
I don't
just
know.
because of this year? Because
Well, I feel like I asked a loaded question.
you did
Fire
ask
away.
a loaded question. So Pilates is very much a mind-body exercise. So we're encompassing much more than just, oh, well, how much are you going to sweat today when you go out and get your exercise, right? We're much more about movement, and moving is very important for quality of life. So regardless of your age, that quality of life piece is essential for your good health. So before, it was important. Now it's even more so.
Yeah, well, we can talk about the now part of it because we're all living through it now, right?
Yes.
Like we're all dealing with what's going on right now, and I assume that when you say before and now is the mental side more than anything.
Yeah, and I find before the mental side was there, but now people are more isolated, and wherever they can get out and be part of a community that is outside of their own little tiny bubble, so to speak, then the better it is for them, right? And so I found over the last 10 months that social aspect has been huge for people and their mental health.
Yeah, well, people close to me that I would have never, I guess, thought would have to deal with mental struggles, just like, the isolation, everything, have started opening up about it.
So it's not just about exercise. We're talking about earning your quality of life now so that you have better quality of life later. And so for a lot of people right now, and what I've heard a lot of this year, and we've been promoting it for years, but now we're hearing more of it, is that people are moving more and making decisions and choosing to look after themselves instead of just looking after their illness or their injury. And there's a really big difference between those two things. So if you're just looking after your illness or your injury, you're already in the treatment phase. You're already there. So you've already got an illness, or you're waiting for a hip or a knee replacement, whatever the case might be. And instead, we're starting to choose to look after ourselves so those things don't happen later. And that's the quality of life piece. That's the important part.
Oh, wow. Well, I appreciate you sharing that. I hope that, there's a lot of people tuning in, right? And it's good to hear things like that.
Yeah, absolutely.
Bringing it to what we're doing today, raising money for the Lloydminster Hospital, continuing care, the work we're doing here with the Health Foundation. Why is it so important to the Corps and yourself to be a part of what we're pushing today?
So my whole business is built around quality of life. And I think that once we start talking about people being in nursing homes, that quality of life has really diminished for an awful lot of them. And whatever we can do to help give them an improvement in their quality of life is worth supporting. It's not even a question for me. Those are the people that have built our community. They're the people that made us who we are today. And if we don't support them and give them what they need, then we're really, kind of giving them a disservice, right?
I smile because I've said many a time today, our seniors are the shoulders we stand upon. And you just said that verbatim.
Yeah.
And I completely get that. Now, as we slowly wind down, or wind up, or whatever we want to call it, I see that, you get to experience. You come in here and you start seeing things wave at you and everything else. We got Mikey running there. I've been getting everybody to just pass along some thoughts on him. He's running 12 hours on a treadmill.
Yeah.
He's already over 62 kilometers for the day. He's already raised $7,300, but it continues to grow because it's 118 every K.
Yeah.
And so if you can encourage him a little bit, I'd appreciate that.
Yeah, well, and I think it's phenomenal, Mikey, what you're doing. I mean, there's, I would never be able to do that. I'm supporting anybody that is physically active at this point, but this is like massively inspirational. I can't imagine running for that amount of time. So the fact that you're doing it, way to go, man. Like, just amazing. I feel for how you're going to feel by tomorrow morning. And I will be thinking of you in the morning, but right now, way to go. It's awesome.
Well, thanks, Donna. I appreciate you coming in and opening up part of your day for us to sit here and have a quick little chat. Really enjoy it. Before I jump off to the next one, I've been hassling the ladies
I
a little
know.
bit here.
I want a total.
$143,000 is what we're up to, just shy of $144,000, and we're on our way as we trek towards the goal of $200,000. We're pushing as hard as we can go, and it's exciting to have everybody watching and listening and being a part of this day. So once again, thanks for hopping on, and we'll now throw to the My Why ladies, Kristen Travers and Jessie Mann. Well, I'm joined today by the My Why team, Kristen Travers and Jessie Mann. Ladies, first off, thanks for hopping on. How's everybody doing?
Thanks so much for having us. We're doing good.
Great. Thank you so much for having us.
Well, I mean, you both have incredible stories. First off, for people who don't know, you do a podcast here at Lloydminster, sharing some pretty amazing stories. I think is a fair word to say. So it fits perfectly in what we're doing today. We're raising money. We're trying to tell stories about the Lloyd Hospital and continuing care that happened to our residents. And so you two ladies come just screaming to my mind on two you gotta have. So no, thank you for joining us. Could you lead us maybe through your stories of how how the hospital kind of put you back together, so to speak, and maybe either or can hop in first and we'll go from there.
So I guess I'll start. So I'm a nurse. So I've worked at the hospital for a long time. I think since 2006, I worked for dialysis unit. I was a stroke coordinator for a time as well. So, healthcare is very, very important to me. The hospital is very important to me. I'm also a patient. So I've been a patient and a nurse in the hospital. So most people know this story, but in 2015, I suffered a cryptogenic stroke, which means I had a stroke without a cause. And I literally was unable to, talk, speak, write, read, all of that kind of stuff. And I had the stroke on my way to work, and it was the nurses and it was the doctors and it was the emergency physicians or emergency healthcare team that kind of surrounded me and helped me through that. So there's so many times, and I mean, since then I've had a lot of health issues. I've, had septic shock and all of that kind of stuff. And I've been a patient as well as a healthcare provider at the hospital. And, we definitely need to support them. They're doing their best. They're some of the most caring, compassionate, intelligent people there. So I definitely have lots of ties to the hospital.
I have to stop you there for 1 second. Did you just say a stroke without a cause?
Yes. So that happens quite often now, especially with young people. So I was 31. I was very healthy. I was training to do a marathon. So I think I ran 13 kilometers the day before I had the stroke. And so I'm a vegetarian. You would look at me at that time and think I was, the optimal health person. And all of a sudden I had a stroke. So, stroke doesn't discriminate. Yeah.
Wow. Okay. Well, thank you for sharing that. That just blew my mind a bit. I cannot believe. All right. Okay. Well, you got me a little bit speechless. I appreciate you sharing that. Jesse, I know you have an interesting story as well. Would you be willing to share it?
Yeah, of course. 2017, I am at a barrel racing in Ponoka and was excited. I was going to run in a slot race there for some serious cash, pretty excited, very well prepared, and was just about to head into the arena. And my horse took one of those stumbles where you're sort of trying to catch your feet, and he didn't catch his feet. We did a somersault, and I heard the bones break. I knew that they were broken. I thought both of my legs were broken. I was laying there in the dirt, and a fellow barrel racer came over and saw it and was pretty shaken up and asked how I was. And my horse was standing there with me. And I just said, my legs are broken. I don't have my phone on me. Can you call 911? And she was so shaken up, she couldn't do my 911 call. So I grabbed the phone and she threw it down to me and did my 911 call. And I went through Ponoka Hospital as well as a hospital in Edmonton. And yeah, I ended up being sent home. And you only have so long, so I won't get into all of the details, but the level of care I got in Edmonton, they were exhausted, and it was pretty touch and go. And they actually sent me home, like out the door home. And I said to my mom, I'm like, I can't go home. I can feel my bones are broken. I don't know what's going on. I'm not sure why I'm being sent home. And I just advocated for myself and was lucky enough. I got one nurse that showed such compassion. She called home to the Lloyd Hospital, and my doctor was working, Dr. Ackerman. And he said, you know what, we'll send an ambulance and she can come here and I'll look her over. And I was still on a stretcher. I was still covered in dirt. This is, 15 hours probably after the initial accident. My pelvis was broken. I had between 9 and 12 breaks. It kind of depends on how you look at it. And when I got into the Lloydminster Hospital, the level of care I received was second to none, honestly. I was so lucky. Dr. Ackerman met me right outside when the ambulance pulled up, and they did a bunch more tests, ran some more x-rays, and decided there's no way I should have been sent home. I was supposed to be in the hospital for 6 weeks. And I was just really, really lucky to be pretty much put back together, like you said, by a team of nurses and doctors and physiotherapists at the Lloyd Hospital. And I went from, kind of just feeling like a number in the big city, kind of at a very busy time, to walking in and feeling pretty damn special and being very, very looked after.
Well, ladies, I think you've painted a very clear picture on why healthcare and maybe very importantly, the hospital in town is so vital. I mean, I don't know if I can say it any better. Those are two pretty amazing stories of how healthcare workers in town have been very vital. I assume you agree.
Yeah, for sure. That's something that, like, Kristen and I battle with autoimmune diseases, and Kristen still has, residuals, I guess. Kristen, is that the right way to say, from other things? And one thing that we would love to see the Lloydminster Hospital receive is extra funding for equipment, so that we're not having to sneak to the city, every time we need scans and things like that. And it would be really great to have more, equipment and personnel here so that we don't have to sneak away to the city all of the time to receive that, extra type of treatment that we need.
Yeah, and a nurse too, like I, worked in emerge and stroke coordinator and hemodialysis, and the equipment is vital for timely results. That is literally life or death. So when we get those results, if we have updated equipment, all of that kind of stuff, it literally tells you how to diagnose and all of the treatments that is vital to, living or dying. So it affects everyone in the community. So it's very important to get that equipment and to help out the hospital for sure.
Well, I don't think anyone in town would ever go, nah, our hospital's upgraded enough. We don't need any more.
Right.
It's like when we're talking about life and death and, all the stages of life, whether you're being born or maybe you're on the way out or maybe you're in the middle of something, a crisis, you want the best healthcare. Yeah, you want the best care possible. And I always talk about I've been saying it over and over again today about Casey when he was born, and the guys who did the celebrity golf tournament. That money went to a huge upgrade in the maternity ward. And I didn't realize it until I took a tour of the hospital just recently that I used every piece of equipment that they got from those golf tournaments. So today, when you mention all the upgrades to lab equipment and why it's so important, you just don't know what that's going to do to somebody else's life, whether it's a year from now, 5 years from now, but chances are it's going to save or impact somebody's life in the near future.
Well, minutes, Kristen, right, with yours, if we would have had different equipment, a couple minutes would have made a huge, huge difference for you in your stroke recovery.
Yeah, absolutely.
Yeah. So anything we can ever do to give kudos to the healthcare professionals that have been working, especially this year. I cannot believe how hard they've been working and the amount of stress to continually worry about taking, the virus home with them to their families, and they just show up selflessly every day. So whatever we can do, I know individually, my why can do, to say thank you, but also to have and encourage people to donate and to make our hospital even better.
I'm glad you bring that up because we got Mikey Dubs running 12 hours, and I'm glad everybody's laughing because we're all going, who in their right mind would run 12 hours? That guy would. Would my Y be interested in donating a dollar amount per kilometer? And if so, what are the ladies, what is my Y willing to part with today?
Kristen?
We are thrilled to donate anything for sure. We can't wait to see how much he runs. Let's start with the bucket K.
Bucket K, cool.
Perfect.
Well, tell Mikey to start running, please.
Yeah, Mikey, run. Cost us as much money as you possibly can. Run.
Or start running. Yes. I'm excited to see.
Who is giving him treats and water, and how is he sustaining this?
We got a great team here. The ladies from Red Bicycle are running around like crazy. And Harvest to Home has brought in a ton of food. So he's well taken care of. I mean, minus running 12 hours on a treadmill by himself. I mean, besides that. Well,
awesome.
thanks.
Well, good job, Mikey.
Thanks again, ladies.
Thanks for having us, Sean.
Thank you so much.
And hope everybody donates. Everybody, please donate. Let's make our hospital even better than it already is.
Absolutely. That was the My Why ladies, Jesse Mann, Kristen Travers, hopping on to talk a little bit about their stories and just some really unbelievable stories. I've said unbelievable a lot today, Richard.
Yeah.
It's become my favorite word of the day.
Yeah, exactly.
Sometimes I just can't believe what's going on. Anyways, I do have Richard Dixon sitting across me right now. How's Richard doing?
Awesome, buddy. And yourself?
Yeah. I've kind of hid away my emotions now since the second hour because it's almost overwhelming how many people are reaching out through. I talk an awful lot about how negative social media can be.
Yes.
But today it feels pretty damn positive.
Oh, it's very positive. Yes, exactly. Yep. And the amount of support that's rolling in here is incredible.
It's incredible.
Yeah.
And so I've locked away the emotions. I'm trying as hard as I can to hold it together here for the homeward stretch. But let's talk about Richard Dixon for a little bit.
Sure.
I first met you when you were running the Legion.
Yes.
And had the Hitman banquet in there.
Exactly.
You're an Army, or were a medic in the Army.
That's
All right.
correct. Yep. I'm a medical technician in the Canadian Armed Forces.
Now, a thing that's been coming up an awful lot, not only today, but leading up to today, let's call it the last month, has been mental health.
Yes.
I assume you could probably talk a little bit about that.
Yeah, absolutely. Mental health, especially nowadays where COVID has hit us here, is so paramount for people because the isolation is beginning and the decrease in social interaction is occurring. So it's very important to try and maintain your mental health, whether it's via social media, Zoom engagements, or however you need to do that, or standing in your driveway waving at your neighbors driving by, or anything like that to keep the interaction going, to keep the mind occupied and busy.
Yeah, and it's a difficult time for that, isn't it?
It's
Because
very difficult.
I don't mean to say the government's making it more difficult on us, and not like that, but the rules put in place are taking all the normal things we do. Come to the Legion for a banquet.
Exactly.
Gone, right?
That's correct. But these rules and that the government and our healthcare authorities are issuing are paramount to follow. There's a reason why it hasn't blown out of proportion bigger than what it is, because of the what we're doing and the precautions in place to help. So,
Where are you originally from, Richard?
I am originally from Nova Scotia.
Yeah, that's what I thought.
Yep, God's country.
What God's country. What brought you to Lloydminster?
After I retired from the Canadian Forces, I decided to come out this way. I'd spent some time up in Wainwright, so I came out here and I haven't left.
What has it been about Lloyd then that's really sucked you in, so to speak?
Besides family, the community support, the people are just phenomenal out here. And the love and compassion that this community shows for the citizens here is just incredible.
So today isn't surprising you then that we're sitting at 144 and change, and Mikey Dubs is,
I know, yeah.
60, I don't know, probably at 65K now. He doesn't like it when I undershoot him, right? So if he's at 70, right. I should be saying 73, because by the time it gets to him, he'll be there, right?
Yeah.
But, what he's doing is unbelievable.
He's doing an incredible mission, is what I call it. And he's still smiling and still giving her the thumbs up, so that's awesome, man.
Here's what I want from the viewers. I want somebody to either message me on social media, or if you got my phone number, text me a different word. The same word is unbelievable, but a different one. So I can use a different word. Because it
gets stuck in your head.
Stuck in my head.
Word,
I want a different word right now. Somebody give it to me.
Stellar.
Sure. Yeah, we'll start with stellar. Yeah, absolutely. What was it about today? Because you've been running the door out front, right? Like
yes.
You've been making sure everybody gets checked in and
correct.
And get proper PPE and all that stuff. What was it about today that went, absolutely, I'm in. Don't even, boom, I'm here for 12 hours. We talk about Mikey running,
yes.
and he's paramount of what he's doing to his body. Then everybody always points at me to talking for 12 hours. But then, all the people who are around me get no love because they're not in front of this thing. They're behind it, making it run.
Yeah.
12 hours is a long day, and we were here awfully early this morning to make sure it was all set up and all that. What made you want to get in on this?
Oh, goodness. It was just a great opportunity. I love to help people and give my time back to the community and help others. So this was an awesome opportunity and a privilege to come here to help the Health Foundation with.
Well, I can safely sit here and say I really appreciate having a good crew around me. So that all I got to worry about is who's coming in next. Richard.
Right,
all right, let's roll. Right.
Exactly.
Now, for the man, Mikey Dubs, the man, the myth, the legend, sitting there, who's running. Can you give him a few words of encouragement here as he cruises along?
Yep, Mikey, keep going, buddy. You got it in you, and you are blowing people's minds away, man, especially mine. I've done some running in my time in my career, but nothing like he's done.
You want to know? I know people are watching this. Before we can even get you done, I said, "Can somebody please give me a different word for unbelievable?" Well, I've had a text from Mr. Mullet, a guy I work with. He says incredible, inconceivable. Hey, that's good. What's the movie I'm thinking of? Princess Bride. Inconceivable.
Inconceivable. There we go. Yeah.
Thanks, Richard, for hopping on and being a part of today.
Thank you very much for having me.
Absolutely. Okay. Well, we are closing in. Rod Peterson. Rod Peterson is ready to roll? All right. I'm talking to myself here, nodding my head. I believe we got Rod Peterson coming up here in a few quick secs to update people. If you want to get involved, lrhf.ca/radiothon. If you go there, you can donate, and you see all these names scrolling along the bottom. If you donate, that's where it's going to come up. And so I would love to try and keep up with how many donations are like just absolutely coming in. But the list on the bottom is doing a better job than I ever could. And you see above my shoulder, Mikey Dubbs fighting through it there. He's been running since 7 a.m. this morning, closing in on, 70 kilometers right now. He's raising, they updated it, $122.50 for every kilometer he runs. And that's because of all you folks out there. I want that number to go up, 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 up. Because I think it's just, in my brain, I go, every time he hits another kilometer, it's a $100 bill, right? Like there's a $100 bill. Whoop, there's a $100 bill. Like that's pretty cool. And so everything we're doing here has been just absolutely unbelievable. I'm seeing Bioclean, I believe. Now, if my life was scheduled for me, which it is, Michelle's going to yell at me. I see the Bioclean symbol in the top right corner. I believe it's their power hour. I believe that's what's going on. I'll wait for her to... I'm getting a nod. Yes. So anything donated for this hour is gets doubled. So up to $2,500. Every dollar you donate 5, it becomes 10. You donate 100, it becomes 200. And the first hour we did, that's exactly what happened. Now, I am joined by another man, myth, legend, the former Rough Rider voice, the man who does the Rod Peterson show. He's looking around. How's Rod doing today?
Awesome, Sean. How are you doing, buddy?
Well, I'll give you the quick notes here. We're a little over halfway through the day. We had the goal set at 200,000. We're at 144,000. We got a guy running 12 hours. He's over 65 kilometers now. And that total for every kilometer he runs is $122.50 for every kilometer. So it's amazing.
It is amazing. And as I told you, I'm putting down $100. So I guess... has the power hour started? Does it become $200 then?
That certainly it does. It certainly does. I like that. Maximizing your money. That's a smart man. Now,
I don't know what to tell you about that.
I appreciate you hopping on. I know you're a life coach or a sober coach. You deal with people. Mental health. Mental health has become such a big topic lately. Now, it should have been probably had a light on it beforehand, but right now, in our current situation, it's really become a prominent topic, and I thought maybe we'd start there.
I appreciate you asking that. Yeah, and I don't even know what I am, if there's a term. It was sober coach for the longest time, and it became recovery coach, Sean, because there's a lot of people that I was helped getting their lives out of the ditch and turned around into the right direction. That had nothing to do with substances, right? It had everything to do with mental health. To say life coach, I'm not sure that I got all my ducks in a row there, but I'm just noticing with people where mental health has come into the discussion, particularly in the pandemic. And I know it's really hard, Sean, to kind of put a face on it, right? Or what is it? And you can break it down to some pretty simple things, like just basically your happiness. And in a way, security, which leads to happiness. But there's a lot of people right now in these times and pre-pandemic that just were struggling to become happy again. The definition of depression, or one of them, is a complete absence of joy. So I'm trying to help people find that in their lives. And it's been a very rewarding path for me. I know we talked about it when I was on your podcast.
Yeah.
But I had a meeting with a guy last night. Some of your listeners and viewers might know him. His name's Alan Keller out of Saskatoon, and he's like a sober consultant. And he said, men are starting to talk about this. We are making a difference. And I said, well, I hope so. I don't know. I don't see the evidence of that. But really just, Sean, getting the discussion going and talking about it, if it makes a difference in one life, I'm happy.
100%, Rod. The fact we're talking about it right now, I think speaks to exactly what he was talking about, right? Like, I've heard more about mental health in the last, when years prior, you'd hear about mental health every so often. But in the last probably 2 months, to me, it just has become very prevalent. Everybody talks about we don't, our grandfathers went to war, all we're being asked is sit on a couch. But what they don't talk about is the isolation part of it. You talk about the elderly being isolated in their homes. That is a different type of battle we wage every single day. And, for guys like yourself and me, I know the Rod Peterson show is doing very well, and you get to interact all the time with people. Even though it's like this, it's still an interaction. For a lot of people, they maybe lack the means to be able to do that, or their creative outlet at one point has been pulled back because now they're not allowing the group gatherings. And so to me, I just think I see a definite step forward. But for you, maybe, wouldn't you say mental health is like the big thing here that the most of us are tackling on a day-to-day basis, especially with Christmas on the horizon?
Well, I don't want to get in trouble. I see the restrictions that the medical doctors are imposing on both sides of our border, Alberta and Saskatchewan. And I do kind of say, guys, have you spent any time on mental health? Because it's all about physical health and the spread of a virus. And in my own personal experience, Sean, mental health isn't taken that as serious by medical doctors. It's just not. So something hit home with me this week. My wife went to Edmonton to see our new granddaughter. She's been gone 2 nights. The first night I was laying in bed going, I don't know how single people do this. You know what I mean? Now I understand how for the last 9 months I've had these people reaching out and they're struggling because they are alone. I've been able to work. I've been able to interact, as you say. I've had my wife at home. It was completely changed my perspective on, imagine being shut in at home. And the one thing is, it's on you to reach out if you're struggling. Nobody's going to reach out. It's not, the onus isn't on them. The onus is on you if you're struggling to reach out. And a lot of guys don't want to do that. And so that's a big part of it. But I get a kick out of this. You'll laugh as a hockey guy that you are. Brent Sopel wrote me yesterday to our show Instagram account. And I don't see those messages. They go to our producer, Clark. And the message was, Rod, I don't know if anybody's told you, but you're doing great work. I'm really proud of you, man. And Clark, he's like, there's a message here from Brent Sopel. It's weird. Like, it's, who says this? And I said, Soaps is in recovery. We talk about that to each other. We tell each other that we love each other. We tell each other that we're proud of each other. Why do we got to be in recovery to do that, Sean? Can you tell me? Why do men not talk like that to it? This is Brent Sopel, one of the toughest SOBs to come through the NHL and WHL, as you know. Most people wouldn't just reach out of the blue and say, hey, you're doing a great job, I'm proud of you. Right?
Well, you can't,
it's weird.
You can't see Mikey Dubs running right now, but he's probably skipping at those things, because you know what he says to me last night before we go to bed? We're sitting there texting back and forth, and everybody's excited about today and whatever, and I'm going, man, just go to sleep, would you? You got to run 100K today, right? Get your sleep. He goes, I just love you, man. And then I didn't respond. I just gave him the thumbs up, and he goes, we're men. It's 2020. We can say it. So yeah, exactly. I get what you're saying.
And I don't know that we'll ever change that, but I can tell you that Brent Sopel's happy. I can tell you that I'm happy. So I guess my point is, as we approach Christmas and more severe lockdowns and what people are going through, here in Regina, 500 layoffs at Evraz Steel here just before Christmas that take effect this week. There's a lot of struggling people. There's no shame in reaching out for help. You'll find that there's going to be more than enough people that want to help you. And the thing is, Sean, I'm not sitting here from some pulpit talking down to people. I never asked for help. I was the idiot that had to face an intervention before I got help. I refused to ask for help. You put me in a hammerlock and I wouldn't ask for help. And all it did was hurt me more and more and more and drive me more and more and more into the ground. So asking for help isn't a sign of weakness. It's a sign of humility, which is actually an attribute. And I appreciate you asking, because there's not that many people talking about stuff like this right now.
Yeah. I keep telling people with the lockdown coming, first off, Rod, thanks for sharing. But I keep telling people with Christmas on the horizon to make sure that you reach out to your friends and your family, because you just don't know who needs to hear a good thing on any day. And I sometimes undervalue what a simple, kind word can mean to someone. But the truth of the matter is, that probably means I'm pretty fortunate, because I don't need a kind word every single day. It still helps, makes me feel good. Rod Peterson texts, hey man, I hope you're having a great day. It sends some positivity your way, and you feel that. But I would say, and you probably agree, that moving closer to the holiday season here, make sure that we're reaching out and touching base with all of our family and friends, because you just don't know who needs it.
Well, the check-ins are great, and you hope that it hits the right person at the right time. But I'll say this again, too, for somebody that might be struggling right now, don't be afraid to check in on somebody else. And you're saying, things are great for me, I want to check in on my friends. What if you think that your walls are closing in, but you want to check 3 to 5 buddies? Like a couple of years ago, I've been doing this 3 years, this recovery coaching full-time, Sean. And when I first started, I said, I'm going to check in with 3 people a day. I was still dealing with my own issues. We will always be dealing with our own issues.
Amen.
It meant so much, right? That we're on the receiving end of those text messages. It was like the sun coming up for them in their life, and they opened up to me with what they were struggling with, and I just made it a mandate every day to check in with 3 guys. A miraculous thing happened, Sean. I forgot about my own problems. That's not to say that they went away, but I didn't sulk and sit in them.
Well, I appreciate that. I appreciate that, Rod. I think it's really good advice, and I 100% agree with what you're saying. Before I let you go with we're running out of time here. I hate the time thing. I run a podcast, man. I love just chatting, as you know. We got Mikey Dubs running on the treadmill for 12 hours. I've been getting people to wish him well, or not wish him well, give him good thoughts, tough talk him, whatever you want to do, Rod. The guy, every step he takes raises a bit more money, and I just want to keep him going. And like I say, the next click raises an extra $122, and the click after that, $122, and maybe the click after that, $144. And if you donate right now to anyone watching, $1, it turns into $122, right? Like we're just rolling here. So give Mikey some thoughts here, Rod, before I let you go.
Yeah, well, for both you guys, Sean, kudos for you with the effort that you're putting in, and for Mikey Dubs, kudos to you. Keep running, man. And just remember this. Rick Hansen went around the world in a wheelchair. So I think you can keep running on a treadmill for a little while longer. So kudos to both of you guys. I'm proud of you. But think there's guys that have done way harder than this.
Awesome. Thanks, Rod. Thanks for calling in.
Thanks, guys. Merry Christmas.
Merry Christmas. Well,
Sean Newman anywhere around here?
That was Rod Peterson, and now look who just walked in. Look at you all sharp. Hey, I'm now joined by.
My hat, eh?
I do like your hat.
Thank you.
Grab a seat, sir. Pull a stump up. I'm joined by Skip Craig. So, Skipper, how are you doing today?
I'm doing pretty good, and I just talked to an old friend of yours.
And who would that be? Oh my goodness. Are you kidding me? So what Skipper just brought in is can we see that? That is Jerry Cheevers. So for the viewers who don't know, that's pretty cool. I'm going to have to shoot him a text and tell him thank you. Jerry Cheevers signed picture. That's unbelievable.
Pretty good.
Skip played for the Boston Bruins back in the day.
Back in the day is right. That's a long day ago. Yeah.
Now, you've been in the Lloyd community. I was singing your praises the other day. That lady right there is Michelle Myers. That would be Hap's niece. I was saying, she said, oh, yeah, you know,
I
Hap
know.
Myers.
I met her, and I don't hold that against her.
I was so Michelle, who's a lady, one of the ladies from Red Bicycle, who's making this go off without any problems, has been working probably way too many hours, deserves a raise. Jill has been behind the scenes. Anyway, so we're sitting there, and she goes, "Well, who's Skip Crick?" And I said, "Well, actually, he played here." And then we start talking about it. She goes, "Well, my uncle used to play for the Buffalo Sabres," and I go, "Well, that's funny." Because Skip used to play for the Buffalo Sabres. I wonder if it's around the same time. So I text Skip, and before we can look it up, Skip's going, "Oh, yeah, he was my old roommate."
Yep.
And that's how small the hockey world is.
Some days, there's no question, Lloydminster boy, Hap, and yeah, he was, we are still good friends. And if you ever, I'll give him a plug, if you're ever in Edmonton, you got to go to his restaurant, Hap's Hungry House. You'll have the best breakfast ever.
Well, yeah, Michelle's laughing back there.
Yeah, you will.
You're flooding back memories. As
I worked there, that's for sure.
Yeah.
Now, you've been in this community a lot of years, Skip. What year did you come to Lloyd?
Well, I got involved with Bill Foster back, I was still playing. And I came here and worked for the Summers in 74, I guess. And then I moved here permanently in 76. Till the oil patch went down like it has way back then in the 80s and till 89. So I was here for 13, 14, 15 years, whatever. And then I moved to work for the Oilers for about 6 years. And then I teamed up with Fountain Tire and in Edmonton. And then I came back here in 96, 97, I guess. I've been here ever since. Yep.
So 23 years,
Yeah, oh, yeah.
24 years, and
Yeah.
then plus a 13-year stint
Yeah.
before that.
Yeah.
What is it about the Lloydminster community that when we do an event like this, and I don't know, I just get blown away. We're past $144,000 now,
Yeah,
where our
that's-
goal for the day was 200,000, but it just seems like no matter what, there was a will, there's a way. The times are tough right now, but we're going to get it done because it's going to go to improvements at the hospital and continuing care, and it just seems like the Lloydminster way.
Yeah, it's something. I mean, I came here because I had the business opportunity, but then through the years, I joined Kinsman when I first got here, and still got friends through that organization and K40s, and just a whole lot of good people, no question about that. And we've been pretty fortunate in the business end of things throughout the community, actually, in the area, with the oil patch, the upgrader, and things like that, and certainly with good tire stores like Fountain Tire.
Great.
No, but
Hey,
a lot of good people.
Fountain Tire donated money today. Michelle, how much did Fountain Tire donate today?
$2,500.
$2,500 came in from Fountain Tire earlier. They're huge community supporters.
Yeah. Stanley's a pretty good boy, no question about that. And anyway, but it's just, we've been fortunate, and they see it, I guess, as a community, and pass it on, share it, if you will. Yeah. It's as good a place as I've ever lived, probably, or I wouldn't be here.
That's right.
Yeah.
Now, I want to take you back. I want to rewind the clock, maybe to Boston, maybe to Buffalo, maybe to Cleveland, wherever you want to go with it. I've been bugging the NHL boys, so Wade and Corey Cross, Scott Hartnell, etc., about doctors, nurses around the NHL. You get an injury or something along that lines. Maybe you have a story on how they impacted you back in your hockey playing days. You playing years ago, I thought maybe that might spring something to mind for you.
Well, yeah, I've had the odd injury in my life. The worst one, I guess, probably I tore my knee up back in the WHA in 72, I guess it was. And there was a doctor who was the orthopedic surgeon for the U.S. ski team, if you can believe that. And he did the operation on my knee, and it was shredded, apparently. They pulled it together with wires, the ligaments. And I have not had one ache ever since. I mean, it's never bothered me one bit, so that's how good he was.
Put you back together.
Yeah. But there was lots of guys and stitch you up and put you back out there and away you go. But no, there's been some great people. But and you talk about doctors, never mind hockey. It was here a couple of years ago. I had a little bit of a problem, and it was the middle of the afternoon, and my wife had just come home, fortunately, and I said all of a sudden I couldn't breathe, and she wheeled me into the hospital here, and I had a heart attack. That was 2 years ago, and they literally saved my life here. And the doctors, I had the surgery done, triple bypass in Edmonton, and the doctor there said, "You're lucky to be here, pal." And if it wasn't for these guys here, nurses and doctors that were in charge of that emergency unit that particular day, we wouldn't be chatting. True story.
I appreciate that,
Yeah.
Skip. Appreciate you coming in. I circled this one. I've circled a lot of them, but you've been very kind to me in our short time of knowing each other. And the Jerry Cheevers picture coming in is just... We're back. We had batteries die on us in mid-sentence. You were just asking about the guy running on the screen, Skip. That's Mikey Dubs. So he's been running since 7 a.m. this morning.
Yeah, right, yeah.
You know, going back to your training days, how far did you ever run at one go?
I trained real hard one summer, and I hate running, and I vowed I'd never do it again. If I didn't have ice to skate on, it wasn't any fun. So, no, I never did any of that stuff in our day. We used to play ball all summer, and that was enough training. Run a little bit in the outfield, that'd be about it. But, no, it's a whole lot different today, these kids today. But it's all about the dollars and cents seems to me nowadays. I mean, they've got a whole lot to lose if they don't, if they're not in good shape. No question about that. So they've got to take good care of them. But we did all right. We used to be able to stay out there for a minute and a half or 2 minutes instead of all this 45-second stuff. No, that kind of interests me too. I think that's interesting where they're such good shape, but they can only stay out there for a 40-minute shift or a 40-second shift. I don't know. It's way over my head nowadays. It's different.
Well, I really appreciate you coming in. Apologize for the mics dropping on us in the middle of it. No. I will finish off my thought that I was about to say, and it's just that I'm happy you're still with us, Skipper. I'm glad that our excellent staff is there, and that is why the hospital is extremely important. Because of now I get to sit here and have this conversation.
You got it. And something else too, I've had firsthand experience with your long-term care homes too, Pioneer and specifically Jubilee, and unbelievable crews there. So a lot of good people in this town.
A lot of great people. Now, before I let you go, can you give that guy some motivation? The best way Skipper knows how is he continues to run. He'll be able to hear it here. He's got it playing in his isolated room. Can you give him a couple of kind words, or lay it to him, Skipper? Whatever you want to do.
No, keep up the good work, and it's about time you did something good. Get at it.
Right on. Well, we will head to Kyle Tapp and Lance Ward. An interview with them.
Take care. Thanks, man.
We're joined now by Kyle Tapp of IHD and Lance Ward of the LPSD Hockey Academy. So first off, boys, thanks for hopping on.
No problem. Thanks for having us.
Well, first and foremost, you guys have been training kids here in town for, well over a decade. How has 2020 been? Like, how's things going on your end of things?
It's different for sure. I actually think a lot of good has come from it. I think this summer was different for sure. I know Lance did a really good job on the operations end for our company in terms of scheduling and just managing the COVID restrictions that were constantly changing. I do think the good thing for the players is there wasn't a lot of pressure. I think not having the parents in the rink and having people watching over their shoulder at all times. I saw more growth in players' games, willingness to get out of their comfort zone more typically this year than before. So that was an unexpected positive, but I think from the management in terms of what we were allowed to do on the ice at certain times, we had to be incredibly creative and think on our feet in order to make sure that everything was useful this summer.
Yeah, it's been a big challenge for us from an organization, from programming, but more so for the kids. I mean, for the kids that are supposed to be away playing junior hockey right now that have been kind of in limbo for 10 months, that's way tougher than what, we've gone through a lot of stuff and we can manage on short notice things. But, for the kids that are, that have dreams, aspirations of, college scholarships, playing pro, whatever that is. I mean, to me, that's the age group that I really feel bad for, more so than even in my own family. I mean, we've got, you can never redo Pee Wee AA, I get it, but you've got a lot of hockey left in you. There's 20-year-olds in the Western Hockey League or 20-year-olds playing junior that are, hoping for great years, and it's just kind of been, more than anything, it's just been the whole pushback of, hey, we're going to go in January, maybe not. Oh, we're going to go in February, maybe not. So it's been tough on us. I mean, Kyle and I are resilient. We can manage through all of that stuff. Tougher on the players for sure.
Yeah, I think you guys will probably agree with this. When it's a month or 2 months, you can pretty much soldier on if you're kids, and you can give them hope and say, listen, guys, it's not the greatest situation. but we got 2 more months of this, and then you get to go play hockey. And then when 2 months turns into 4 and 4 turns into 8, it can seem almost like it's never going to end. And that's been a mental health side of it has been a big thing in our community and in the, in Canada, North America. Like that mental health part of it has been a real struggle lately, because it at times feels like you don't know when we're getting out of this, and things are starting to tighten up again. So I get that. And for the kids, you're absolutely right. That's got to be difficult, but at least they can get on the ice and have some creative Kyle tap drills. I can just imagine what that's like.
Oh, it's creative. All right.
Well, we're raising money today for the Lloyd Hospital continuing care. Just wondering why is the hospital continuing care important to you guys?
You know what, for me, I mean, I was born and raised in Lloydminster, was born in the hospital here in Lloydminster. So for myself, this kind of goes way back. Even being back here full time for the last 11 years now with my family, having 4 boys and 4 active boys. I can say this with confidence that we have all been in the emergency room and been taken care of, from, knocking our teeth out, falling downstairs, to being drugged behind a wakeboard boat by a rope by your leg. Broken collarbones and open heart surgeries. I mean, we have literally we've been to the ER room in Lloyd for everything, seen some amazing staff, nurses, doctors, and just thankful that we've got a great facility here.
Yeah, like I think every family dynamic's different, but like I know within our family, I have a 92-year-old Baba, and my mom's, up in age and stuff, and I, with COVID and how it's attacking kind of the older generation, and we talk about mental health from the hockey side. At the end of the day, you're a 20 to a 10-year-old player. You got a lot of things ahead of you. Things are going to change, but just hearing some of the stories, and even within my own family, seeing how isolated some of the elderly or older population is, and how that's deteriorating even their mental health. Like I can't imagine how difficult that must be for the workers, the nurses, the people that are running the day-to-day in those environments, and just the amount of stress all of them would be under, and the uncertainty. And yeah, like I just hope we can have some good news soon, and even just get to see, our grandmas and grandparents, and just give them a hug and say hi and do some of those things.
Yeah, that's fair. I know the Newman side of it, we have people in continuing care, and the isolation part is difficult on everyone. Most importantly them, because they're the ones locked in and they can't get out and nobody can go in and see them. So today is about helping make that a little more comfortable for the people that are isolated. We're raising money for that. I've been twisting arms all day long, and I haven't had to twist that hard. I kind of use that as, I'm joking. But, we got Mikey Dubs running 12 hours. Every kilometer he runs raises a little bit more money. First off, I got 2 guys who are training athletes. You ever heard of somebody running 12 hours straight on a treadmill?
Yeah, Lance does that before breakfast usually.
I get too bored on treadmills. I don't know. I like working out, but this treadmill stuff is a little monotonous for this guy.
Well, I tell you what, all the Ks he's running, there's we've had different guys donate some pretty incredible amounts, and every K that he runs raises a little bit more money. You boys interested in tossing a little bit of money per K towards Mikey Dubs and the cause today?
Yeah, IHD will do $5 a kilometer. How fast is this guy?
That's a good question. I've been trying to figure out for everybody how many K he's going to actually run. I have no idea. I just keep saying run harder, Mike, because every time I talk to somebody and another dollar comes in, another $5 comes in. Now, if he runs an extra couple K, that adds up and it becomes a big number. So I don't know. I'm hoping 100. That's what I'm hoping. Before I let you guys go, you'd mentioned that you're doing IHD's purchasing some ice over the holidays. Could you maybe just explain that quick, Tapper?
Yeah, so we're going to donate a bunch of ice back to the community. It's been, like Lance has alluded to, guys have been training for 9 months. So rather than run ice and make a profit, we're going to buy up the ice. We're going to organize it in the city, make sure COVID restrictions are followed, and we're going to donate a bunch of ice for kids to get on the ice kind of over the Christmas break, that 3-week break, until hopefully restrictions get lifted mid-January. So stuff will be coming out shortly. You just got to register, sign up, and all we're looking for is a food bank donation or a gift donation.
I think that's a really cool thing to do, especially over the holidays. So thanks again. Merry Christmas to you and yours, and appreciate you supporting what we're doing today.
Thanks, Sean.
Yeah, thanks, Sean.
That was the boys, Kyle Tapp, Lance Ward. Now I'm joined across the table from Dr. Jessica from Violet Eyes Optometry.
Hi.
And first off, walking in with a bang, a $5,000 donation. Let's start there. Why did today mean so much to Violet Eyes Optometry?
Well, I mean, every year Violet Eyes Optometry and Dr. Mashteller and myself support the foundation gala, and we go to the gala and we do our best to do a donation with our sale that we do on a yearly basis. So since we didn't get to do the foundation gala this year, we decided to combine our efforts and our donation from the sale that we do every year and what we like to spend when we come to the foundation gala, and put it all together as one so that we can do a big donation, because this year more than ever everybody needs as much help as they possibly can get.
Well, I think this year with everything going on, it's just really cool to me that all the companies in the toughest of times are still opening the wallet, still donating things like this. You know, like with the 5,000 on there now, we're at 149, and I bet you the ladies will come in and tell me that we're actually over 150. Mikey just told me he's at roughly 80K now.
Awesome.
Right? And let's go there. Have you ever ran, what's the, like, can you imagine running 80K?
No, I can't run down the block without not making it. So definitely not that.
It's pretty cool. To watch Mikey. You can see him right there cruising along. He's slowly closing in on 100K.
Ugh.
You know, like, everything has to go right? Like, it only takes one tweak, and then maybe he goes down. But, like, to see him still, like, rocking it is unbelievable.
Still going. That's awesome.
Yeah. Going to the community, the hospital, I've been asking for different people to share different stories on maybe how the hospital or continuing care frontline workers have maybe impacted your life or you and yours. Would you be interested in sharing something?
Sure. Yeah. Last year, my son, who is now 9, he was 8, was hospitalized with pneumonia, just pretty much right around the Christmas season. So we got out, I think, the day before Christmas. And, you know, nobody knew really what was happening last year. And the doctors and the nurses and the staff and everybody from the time that we walked in, you know, just it was really great support. And I never felt uncomfortable. I knew that he was getting the best care that he possibly could. And, you know, that's kind of one of the big things that I've had go on with my kids. I mean, I've brought one child into the life, into the world here in Lloyd. Dr. Mashteller has brought 2 kids into this world at the Lloydminster Hospital, and the care that we've received is amazing.
Isn't our maternity ward like...
They're amazing. Those girls are amazing, and the men out there, everybody's great. Like, everybody.
Welcome to my world. They just wave things. I know. If there is somebody out there that has been watching this now for going on almost 8 hours, kudos to you. But most people don't. And when you come sit across me, anyone who's sitting there watching on the phone just gets to see the screen, right? And so they have no idea what's going on. But I get things waved at me all the time. I'm waiting for like a pen to go off my head because I'm not, paying attention to what Michelle's waving. But just want to wrap up. Thank you so much for your donation. $5,000 is no small amount, and it's going to a huge and great cause today. Before I let you go, can you talk to that man and just give him some encouragement as he closes in on 80-ish kilometers?
Yeah, just keep on going, man. I definitely couldn't do it, so I'm glad it's not me up there. And I don't know, my workout, I pretty much can't even get past 30 minutes, so this is huge. Keep going, buddy.
Right on. Thanks. Thank you, Dr.
Yeah,
Jessica,
thanks
for coming
for having
up.
us.
Yes, absolutely.
Bye-bye.
Okay, folks, we are, well, we're rolling along here. What time are we at? We're closing in on the 3 o'clock hour. If you know who Dr. Jodie Carrington is, she is calling in at 3 p.m. I think a lot of people are pretty stoked about that. And so as we slowly churn our way through this, and I use the word churn because I know that's what Mikey's doing in the in the room there. He's just slowly churning away, picking those miles up, picking those $100 bills up, Mikey. Just keep going, buddy. You're stacking them up, and that number is coming closer and closer. I want everybody to think about this. He hits 100 kilometers. That is 12 grand right now. Like, that is friggin' cool. And that is no small feat, big shooter. And I also want to remind people that I bet my brothers at the start of this, and I have insider trading knowledge, and I'm just saying, Mike, I'm pleading with you, get to 115 so I don't have to buy the bottle. All right, that's all I want. Now we got a few different people coming through here. They're just doing their cleaning, making sure that we stay safe. I've reminded people all day long. We got this lovely screen here in front of me to make sure we're safe. People can socially distance properly, that kind of thing. We're up to, with Violet Eyes coming in, we're up to 149 is what I'm showing. It is the Bioclean Disaster Services Power Hour, where if you donate, it doubles up to $2,500. So that's pretty cool. If you're wanting to donate, now is the time to do it. And we just keep closing and churning away at this $200,000 goal as time is not slowly ticking. We got lots of time. I know Mikey would like the time to tick a little faster, I'm sure. But lots of time. I know Lloyd here. We're gonna absolutely crush it by the time the end of this comes. We're almost through this thing. I mean, I know I've been talking an awful lot. Well, now I'm joined from the folks at Bioclean Disaster Services. So first off, thanks for joining me. And they only told me one of you is joining. So how about names first?
Sure. I'm Jody, and this is my wife Sharon.
Oh, Jody and Sharon. Well, the staff. I'll give the staff a break here. They've been absolutely phenomenal all day long, and we all have errors. And so
that was not an error on their part. Jody just decided that I should come along. So
there's actually a reason. So I've been able to tune in off and on throughout the day.
Okay.
And really impressed to see some of the guests and the couple husband and wife speaking out about why the healthcare system is so important to them as a family. And actually, my wife Sharon, her mother passed away last year, right after Christmas on December the 28th. And her mom was not only a nurse for her entire career, but towards the end of her career was a CEO of a hospital out in Ontario. And so Sharon and her family has a lot of ties to healthcare.
yeah, so that's why he decided that he wanted to bring me along. But I think Jody and I have been huge supporters of the Health Foundation for as long as we've been able to, and that's because of my connection to the healthcare system. And my mom's philosophy was always the patient comes first. And throughout her entire career, her last years of a CEO, that was what she was advocating to governments about, let's put the patient first. And so I think this year especially is our donation is particularly special because it's in memory of her. And as we think about all of the, elderly and at-risk patients, I think it's so important this year that we give what we can.
Yeah, absolutely. I commend all the businesses in town today. First off, appreciate you sharing the personal side of it, because that is, we all have that story to share on how these services affect our lives. Because, like I've been saying, the hospital is that one place, and continuing care is probably number 2, where some way, shape, or form throughout our lives, we're going to be impacted on the care there.
Absolutely.
And so the better the care, the better off we all are, right? So that's what raising money today really, you don't know what it's going to impact for people down the road, but I can safely say I've been impacted by the fundraising the Health Foundation has done previous. So I know where it's going, and it's really cool. I think for Lloyd and area, and maybe Canada for that matter, during our current circumstances with, the lockdowns, businesses struggling, people struggling, the support of today has been very impressive, beyond impressive. What is it that, is it just go back to the healthcare side of it, or what made you go, you know what, we're going to go down there and we're going to share our story? Like, what is it about today that really touched you guys?
So when Sharon was living in Ontario with her parents and growing up in the more of that medical side, she was encouraged to be a candy striper down at the local hospital and to volunteer her time. And then when there was different galas and fundraisers and so on, just to assist, behind the scenes, all the organization that goes on. So Sharon's been involved with it for a long period of time. And after we got married, she just sort of started to encourage me with different things, opened my eyes to a lot. So for an example, all my grandparents had passed away, but while both my grandmas were alive, they were both in long-term care facilities. My one grandma in particular, she had dementia, Alzheimer's, very, very bad.
Yeah.
Didn't recognize anyone but my dad. I can't even imagine what it would be like if she was alive today, that she wouldn't be able to recognize anyone. Now we have these workers, they're in PPE, so even people that they perhaps recognize,
yeah, they can't.
They can't see them. And if we can do something, whether they have a means of communication, whether they have a television, whether they have something that they don't currently have, barriers set up so at least they can see people through the barrier. Anything that we can do to help out for that is just so important.
Yeah, no, I can't. Absolutely.
And both of our parents raised us to be of service to others. And I think that goes a long way, whether it be a smile, whether it be a financial contribution, whether it be dropping off something for somebody. And I think we were both blessed to have parents of that service mindset. And if we can continue to model that way and help out where we can, when we have the chance and have the ability, we try to jump on board, especially when it comes to mental health, anything to do with the Health Foundation and women and children. We always want to be there when we can.
Can I give a quick shout out to Mikey? I'm wondering, has he passed Vermilion yet? What's he doing in there?
He's well past Vermilion. So absolutely, that was going to be my next. So you can see him on the screen there. Yeah. So it's a little delayed, so he may start to look at us here if it catches back up. It's on a little bit of a delay feed to him.
If he doesn't look at us, that's fine. Like, he's got to stay focused.
But the interaction is good for him. We talk about, he's in an isolated room, so he's running by himself on a treadmill, and I know runners talk about it all the time, that is a very challenging type of run. Not to mention, the physical aspects that it's doing to his body, but to be locked in a room by himself and to get to have people give him shout-outs and encouragement just kind of keeps spurring him along. And I know he runs by here to go pee every once in a while, and he'll poke his head in and say, man, loving it, right? Loving having everybody just encourage him and keep going, right? And he's been on, we talk about technology. Some of the lovely things is he's been able to be on a conference call this morning out of there.
That's pretty cool.
And have people interact with him. And I just know how important that is for people. I can only speak about myself, but I know how I get when I don't interact. Everybody wonders how weird I am for sitting here for 12 hours, but I really enjoy it.
Yeah.
And for Mikey to run, he really enjoys it, but to do it isolated is tough. And so, yeah, absolutely. Lay it on him, and he's closing in on the final 4 hours of this thing, and somewhere around 80 kilometers right now.
That's intense. Yeah. Mikey, I think I ran a whole 1 kilometer this year, so good for you. You've only done 80 times more than myself in one entire year. That's fantastic.
It's unbelievable.
It is unbelievable.
I wasn't going to say unbelievable anymore. It's inconceivable.
That's a good one.
That's right.
That's a really good one.
Well, thank you very much for stopping in. For another 16 minutes. It is the Bioclean Disaster Services Power Hour, where if people donate, it gets matched up to $2,500.
It's fantastic.
And I just hats off to you guys for being involved in this and coming in, and just appreciate it. And all the best, and best to you guys and your families through the holiday season.
Let's just hope these donations keep on coming in. It's just so important today.
Yes, absolutely. Well, I trust the Lloyd community. I trust all the viewers out there. The goal is 200,000. We're going to get it.
We can do it, absolutely.
Absolutely.
That's awesome.
That's right.
Thanks so much for having us.
Yes, thanks for stopping in.
Take care.
Okay, well, we're We are rolling along here. It is the Bioclean Disaster Services Power Hour. Like I said, your donations, if you head to lrhf.ca/radiothon, your donations for the next 15, 20 minutes, what are we at here? 16 minutes, will be matched, doubled, up to $2,500. So by all means, the other thing I was gonna say, and I kind of spaced on it here. Let me find Donna Shelonberg from To the Core, Mikey. When you hear this, donated $4 per kilometer to you, and she challenged any other wellness company in Lloydminster that if they would match her $4, she would donate an additional $4. So she'd actually donate $8 a kilometer. So if there is any other wellness company out there that wants to match Donna Shelonberg To the Core at $4 per kilometer to Mikey Dubs, she's going to up it. So there's the challenge, Lloydminster. And a thanks to Donna Shelonberg from To the Core for doing that. I completely spaced Donna. That is my bad. And somehow, boom, light bulb on, and there we go. So let's get at it, folks. Like I say, Mikey Dubs closing in on 80 kilometers at 122.50. I believe that number has gone up slightly. I think it'll be 126.50 now with the number from Donna. And we're with Bioclean and now Violet Eyes. I believe we're at 151. 151 and change, I think, is the number we're at. So it's been It's been entertaining, shall we say, last little bit. To catch everyone up to speed, some of the big donations that have come up, and I should really, check the bottom of the screen, folks. Like, it's just constantly going. Like, there's an anonymous $1,000 donation. How cool is that? Like, that's unbelievable. Oh, and all right. I'm getting. This has been the day. This has been the day. So, is it just you by yourself?
It's just me by myself.
All right. Well, I got Randy Noble poking her head in to say hello.
Hi.
What does Randy know today? You've been working it in the background here.
I'm typing all of the names coming across the screens and correcting any errors that I've done, and it's great to be under the gun.
What? Like, I just noticed, I was just saying, there's a $1,000 anonymous donation.
Yeah.
Like, that's cool.
There's a few of them. I know. It's pretty great.
How has been, paint the viewers a picture of what's been going on in the back.
A whirlwind. I don't know. It's like Tambry's back there just answering phones, and who else is answering phones, Michelle? I can't remember her name, the young girl. Alex.
Shonda, Stephanie.
Shonda, yeah, everyone is just answering calls, and it's, ringing. It's like telemiracle.
It's pretty crazy, isn't it?
It's wild.
Thanks, Dustin Mullet, for sending me inconceivable, because that's going to be the new word for the next hour, hopefully. It's almost inconceivable how busy it is here.
It is, yeah.
I mean, last year we did this, and I'm not knocking $50,000. $50,000 was amazing, but it was a day we had to grind from the first hour. We only had 2 pre-recorded videos. I was pulling people out of the audience as they're walking upstairs to to go see their new child or to see their grandparents or whatever. Hey, Bob, I know you. Get in here. Let's have a little. And they're like, what are we talking about? I'm like, don't worry about it. We're going to sit down. We're going to talk. And to see what's going on here today, like, I just keep.
It's crazy.
Yeah, it's like a bullet train, and you're trying to hold on.
You are pulling the riffraff, though. Like, I'm here, so.
Now, is there anything that I should be? So, do you want to talk to that?
My sister is in the Lloydminster Running Club and is a huge fan of Mikey, obviously, and the running community in Lloydminster. And so when she found out that Mikey was running, she was like, well, now I have to donate. Like, we've always wanted to do a donation in memory of my mom. So she texted this morning and she's like, hey guys, LRHF is putting on a radiothon. Mikey's running. The running club's all donating. We got to do something.
Did you say, yeah, I'm there?
I was like, I know. Thanks. Yeah, I actually said I'm working there all day. So, yeah, Lee answered. He's like, yep, sign me up for $250. And, I mean, I'm not going to say less than that, obviously. So we all did $250 each. That's pretty cool. Why is healthcare
our hospital, frontline workers. I'll let you pocket which one you want to go with. So important to this community.
Oh, I could speak on just my personal experience
Sure.
right, with my mom.
Let's do your mom.
Yeah, well, she was ill for years and years and years and would travel to Saskatoon. You just let me know how much time you have. Like all the time, her specialist was in Saskatoon and then went to Edmonton, and it would have just been a lot easier on her to have certain tests been able to be done here, right? Her end of life care was phenomenal in Lloyd, like top notch. We're so lucky to have the people we have here. Sorry, I'm getting a little emotional.
That's okay.
But yeah, it's such a good crew here.
You know, it's okay to be emotional when you talk about things that matter.
Yeah.
That's what.
Yeah.
You know, when they pitched this idea to me a year ago, a year and 2 weeks ago, probably, because it was like 2 weeks before it. Yeah. The reason why they got me hook, line, and sinker is I'd just been through my youngest son, Casey, dealing with what he had to do, and my wife, and all that stuff. So it's an emotional tie for me. That's why I sit here and I'm just like, let's do this. And you want to put up 200,000? I don't know if we can get there, but let's try it, right? Like I'm guns a-blazing.
Yeah.
So it's okay to be emotional about things that matter.
Yeah.
Heck, it's okay to be an emotional human being. I'm a guy who gets emotional about things, and I can't go give Mikey a hug. It's driving me nuts. Like, 'cause at the end of this, all I want to do is be like, man, that was cool, and so proud to be a part of this.
Yeah, his physiotherapist just popped in.
Really?
She was watching and she saw him, like, she's like, oh, he's shrugging his shoulders. I came to check on him. Isn't that amazing? Like,
yeah, it's unbelievable.
Yeah.
It's inconceivable.
It's
Damn
inconceivable.
you. Stupid, unbelievable word. I got to, like, write it in front of me.
Yeah,
Do not say this
unreal.
word. It's stuck. Somebody's been watching, I'm sure, 9 hours or 8 hours now, and they're like, they're drinking, and they're just going along checking off.
That's the
they're
new
3/4 in the bag every time I say unbelievable.
Perfect.
No, but that's cool. I mean, that's what makes this so important is how it affects us all personally, right?
Yeah.
That's what ties everybody to this.
Yeah, absolutely. No, it's good. We're lucky to have our hospital here. We're lucky to have, this community who is so willing to like open up their wallets for us. Like it's awesome. When my mom was sick, we had to send her down to the States for care, and we did a fundraiser, and it was like $80,000 over 2 weeks that we raised or whatever it was. It was amazing. Like who gives like that? Lloydminster does.
Lloydminster, me and you personally know Hillmon does.
Yeah.
I had Brew Man in here earlier, and we all remember the accident last year, and we did that golf tournament in like a 4-day span, and it reminds me of this today, right? Like you're trying to breathe and you can't. Like I keep saying in the radio station, I just keep trying to doggy paddle, stay above water, right? Because every time I think I'm starting to get a hand on this, then Randy Noel walks in and I go, all right, well, let's see where this goes.
Yeah, no. How much time do we have?
We've got plenty of time.
Yeah.
That's the lovely thing.
Ricky actually brought up this story. So we obviously have a long history together being from Hillmon, but 2 minutes we've got, Michelle says. Those signs are fantastic.
They are. Don't worry about Michelle.
Okay.
She waves things at me all the time.
My grandparents knew your grandparents, whatever. Ricky was telling this story this morning, or last night, how Mom, when she was ill, like right when we first learned that she had hepatitis C, she went septic, they call it. So her liver was so kind of toxic that she started to get really confused. Her hands were shaking. We're getting ready to go to the Hillmon Christmas concert. And she drove Ricky and I there, and we were like, oh my God, we are not going to make it. Like, it was almost like she was on drugs, but she was not. She was septic. So we get to the school, and Ricky's like, I got to find Auntie Marie. Marie Noble, nurse in the family, love her. So Ricky went up to her, and she said, something's wrong with Mom. Marie's like, okay, I got you. So we all go back to the house or whatever. But sorry, this is the funniest part. I don't want to skip it because it relates to you. Don Newman is at your grandpa is at the Christmas concert, and my mom walks up to him. She's just there chit-chatting. She goes, you're a cute little guy. She says it like, and he was probably thinking, what is wrong with Anne? But it's terrible to laugh at her, like, but she was, that was a
fun memory, though,
isn't it? It was
a
fun memory, but
Yeah.
she was so sick. But we got her looked after and into Lloydminster Hospital and off to Saskatoon after that for that Christmas. So she actually came home on Christmas Eve that year, so it was pretty crazy.
Well, I appreciate you sharing.
Yeah.
I appreciate you getting thrown to the wolves and sitting across me. I tell you what, $1,000 that they just threw, that you guys are throwing at this, that's pretty cool. Like,
Yeah.
that's really cool. I think it's amazing how our community just continues to step up over and over and over and over again as we march towards $200,000. Like, it's really cool. Before I let you out of here, give Mikey Dubs some thoughts.
Mikey Dubs, I don't know if you're paying attention to comments coming on Facebook, but everyone's cheering you on, buddy. Keep those knees high.
High knees, Mikey. High knees.
Yeah,
Awesome.
you're doing great. I feel like the Noble brothers would challenge the Newman brothers.
The Newman brothers donated $9.60 this morning.
Oh, did they?
And we were all outbidding each other. So it's $9.60 a kilometer right now, which on pace it'll be right around where you're at. Oh, actually, if he goes a little over, maybe we'll just squeeze by him. We'll have to challenge the Nobles back.
Challenge accepted.
Well, thanks, Randy, for hopping in.
Thanks, Sean.
Yeah, absolutely. Okay, well, we are getting close. Oh. Okay. They are just tidying some things up here, folks. We got Sarah Ruka hopping in here nice and quick. They're just going to do some quick cleaning from Home Hardware, talk a few things. I'm hoping she brought me a coffee, because that would have been nice. No pressure. And then 3 p.m. comes, and we got Dr. Jodie Carrington. So this is going to be a whirlwind, because I can already see the buzz of, let's get things going here. Let's get things crack-a-lacking. Time's ticking. But I'm still talking to myself, so I don't know why I'm all excited, because I'm still talking. I'm not talking by myself. I'm talking to you folks. I hope everybody's sharing this and blowing it up. Mikey Dubs is calling me. Mikey Dubs, you're on air right now, talking to me.
Hey, buddy.
How you feeling?
I'm doing good. Do you want to follow up with Shark Canor here, who just tweaked my back into place real quick? Would you like to talk to her for 2 seconds? She'll come over there.
Do we have time? We're gonna have Jodie Carrington here very, very short, like.
Okay, I just thought I'd give you guys a follow up on my.
If she wants to hang out from Jodie Carrington, yes, we'll try and squeeze her in. Okay.
All right.
Well, as you can tell, this is an ever-evolving situation. Mrs. Ruka, how are you doing? Miss Ruka? Ruka?
Hello.
I see you've brought me something.
I have. I've brought you a salted caramel latte from Timber Cafe.
Oh, yeah, I'll take that.
Yeah, you want that?
Yeah, I feel like this is the drink of the gods right here. This is gonna spur me on to the end, is it?
That's to get you through the second half, yeah.
Okay, Michelle, how much time do I actually have here? Like 4 minutes. Okay. You think that sounds like a long time, but
I have
tell
so
you what,
much to say.
That's right. Well, let's talk about it.
Sure.
Home Hardware, you guys are definitely involved in the community. What about today has you bringing me a cup of joe?
Yes, we're definitely involved in the community. The Health Foundation and health in general has been something we've been passionate about since the day we moved to Lloydminster and took over the store in 1999. It was always a focus of my parents because their goal was to make the biggest impact. What is going to make the biggest impact on the entire community? And obviously,
The Health Foundation
the
is a
Health
big one.
Foundation does, yeah.
Yeah. Let's talk about the importance of frontline workers right now.
Well, of course, yeah. Frontline workers are playing a super important role in our community. They're who we're relying on to make us feel safe, and they're obviously doing a great job of that.
Yeah, and what is my total up to? 151? I'm calling it 151. I've been doing the quick math in my board. Michelle's gonna hate me. I promise, viewers, Michelle is doing an exceptional job. I should probably compliment her more than I like to tease her. But we're like 151,000. Nope. See, that's how quick she is. $168,000 now.
Yeah, unbelievable.
It's unbelievable.
Yeah.
You've
Oh,
been-
is that our word? It's phenomenal.
Yeah, thank you. Hey, see,
outstanding.
somebody else is paying
It is
it's
fantastic.
That's right. We got to get rid of unbelievable, because it's becoming the new normal here. That you just look over and the number just keeps going.
Yeah.
That probably doesn't surprise you in the least bit, does it?
Not surprising at all for Lloydminster. This community knows how to rally together. It's an extremely generous community. That is an unbelievable number for the size of our city. Unbelievable.
Unbelievable. See, hey, it's kind of catchy. It must be because I've said it so many times. It's sunk
It's
in.
all like, yeah.
I'm starting to wonder how many people are actually going to be sick of me by the end of this day, because everywhere I go, all I hear is my voice, and I'm like, I'm going to need to isolate.
12 hours.
No kidding.
Yeah.
Now, before I let you out of here, you see the man there running.
Yes, we would like to actually. When I stopped by the cafe to grab these, we had a few quick ideas.
Okay.
For starters, they want to replenish all the calories he's burning here because he's going to be exhausted and hungry, I imagine, by the end. So we would like to invite Mikey to Timber Cafe on Sunday, sometime between 10 and 4, or you can spend the whole day. We want to buy you a brunch and maybe a drink. We'll do a toast. We've got mimosas going. It's the last Sunday before Christmas. And we would also like to donate all the profits from any sale we make at Timber Cafe this Sunday between 10 and 4 to the cause.
Well, you know where Mikey's going to be, right? You're going to be feet up on a desk, Mike. Yeah, that's right. He's cluing in right now. It's a little bit of a lag, so he actually gets to see that. That's super cool.
Yeah.
That's awesome. Well, I guess I know where I'm headed on Sunday, don't I?
Yeah, well, everyone's welcome.
That's right. Are the mimosas there all day long?
Mimosas and Caesars and crepes and brunch and Christmas music and shopping.
Ah, Christmas music. You know, there's only one time a year where it's allowed. As soon as D1 hits, away we go.
That's right.
Well, thank you for stopping in. I'd love to give you more time, but you know what they're going to start doing? They're going to start waving.
Turn the music on. turn
That's
the
right.
lights,
That's
yeah.
right. Give you your fade away. I appreciate the coffee. That's super
My
cool.
pleasure.
We're closing in on Dr. Jodie Carrington, is what
This
we're
is
doing.
exciting. Well,
Yeah,
thank
it
you
is.
so much for having me.
Yes, thank you for stopping in and bringing in coffee and bumping his spirit up, giving us something to look forward to on Sunday.
Absolutely.
Awesome, thank you. Well, I see she's there. How's it going?
What's going on, bitches?
You know what I said this show needed more of, Jodie? Was some colorful language.
Well, you know what? I mean, I think the time is now. I mean, we're closing in on Jesus' birthday. It's the middle of a global friggin' pandemic. Mike is insane on a friggin' treadmill. I don't think there's anything but colorful language that is appropriate at a time like today.
Shit, no. I agree.
How are you? How is he?
Mikey's doing amazing. I can't believe he's at 84 kilometers in 8 hours. Like,
Oh my God.
what does Jodie think of that?
I think that's goddamn ridiculous is what I think that is. But he is insane. I talked to him early today and he's like, hey, so like for sure we'll just get you training and you'll do this with me next year. I'm like, just a second. Do you know me? I don't think I will. No, I don't think anybody would, Mike. You're the only one who is a lunatic enough to do this. But look what he's doing. What's your number at?
Well, the number, okay, so we're at $168,000 raised on the day. Yeah, like, whoo!
Can
Right?
you even? What was your thought? Like when you started this, what was your hope?
So the goal was 200,000, but here's the magical part about it. Last year we did it. We threw it together about 2 weeks beforehand and raised $54,000 with me talking to an iPad like this. Okay?
Yeah.
I text Mike about a month and a half before this one, and I go, you want to come on and do like 5-10 minutes and we'll just talk and, talk about running and the healthcare and whatever. And he's like, well, how about I run for 12 hours? Yes. Okay. Right? And
You know
here
what
we
I mean?
sit.
I mean, like let's start small.
Yeah, and now it's this, like, I don't know, $168,000 raised. If Mikey hits 100K, which he's going to do, He's getting $122.50 per kilometer right now, so that's $12,000 he's going to raise by himself.
Stop it! He's
I'm
amazing.
telling you, Jodie, you know, I'm glad you're in the
Lloyd?
the third part of this because you're energizing me.
Oh my God! As you should. Now, are we live? Like, what's happening?
Yeah, we are live. We are rolling right now.
I was gonna bring my best stuff, but if now is the time.
Now is the time.
Now, can we see him? Can we communicate with the beast himself?
So that is the one glitch right now for people who call in. You can't see him, but I can hear him laughing down the hall. He can see you and hear everything you say.
Oh, brother, come on, you bitch, run faster! Come on, it's for the people. Don't you give up. I will come there myself and be very angry at you. I'm going to give him money only if he finishes, though. Did you know that?
God damn, I'm happy you're on.
You know what I mean? Okay, so the goal is $200,000. We are at 168.
Absolutely. We're at 168.
What do we need to do, Lloydminster? What do we need to do here?
Well, I tell you what, first and foremost, they keep donating per kilometer to Mikey. He has to continue running. He hits 100, now he might as well do 125, right? Like, who doesn't want to walk another kilometer to get another $100?
Right, well, exactly. And here's what I think is really important about this, is that we don't want him to die. So I feel like, you know what, Lloyd? I mean, this is a life and death matter here. So I feel like really need to appreciate is just how hard it is. I can't run down the block. Mike and I are not genetically related. He's my brother from another mother. But and this is where I cannot run down the block. This fella can run forever. So if you've pitched by the kilometer, if you are donating by the kilometer, buckle up, Ron McLean. You're going to be broke by the end of this.
I heard you had a crush on Ron McLean. He was your first crush back in the day.
Oh my God. In my yearbook, grad 93, Viking, Alberta, Canada, it says, what is your dream? I said to play in the NHL. What's your second dream? To marry Ron McLean.
It did not.
I love me some Ron McLean. Oh my God, I love Ron McLean. He never knew, but he was my first crush. I mean, I'm from Viking. It's home of the Sutter brothers. You understand? Like, I coach hockey. I still think I'm making the NHL. But I coach and I play and I tried to marry a Sutter. It didn't work out. I had to make it on my own. It's fine. But I love, so Ron McLean was the epitome of like Jesus, you know? And so someday I will tell Ron. Someday.
Well, Ron is a gem. I will agree with you there. Now, all joking aside, I know that you talk a lot about the importance of relationships and connections. Can we talk about that?
Yes, I do. Yes, we can. Okay, so you appreciate this, right? Sometimes our ability to connect with people virtually is tricky, but we are wired for connection. In fact, if you disconnect from an infant, they will die. I'm a child psychologist by trade. I don't even like kids, but I really am a huge fan of the people who hold them. I am a huge fan of the people who hold them because here's the truth. Ram Dass said this, so he's dead. He's a philosopher who died. And here's the hard part about it. Like, generally we figure out everything about life and then we die, but this fella wrote some stuff down, which I'm very thankful for. So he wrote this quote, which guides me every day in this brand that we're building. He said this, we are all just here walking each other home. We are all just here walking each other home. And in Mike's case today, we are all just here running each other home, which is dumb. No need to run when you can walk. So back to Ram. Ram said we are all just here. Ram Dass, we're all just here walking each other home. And so much about that is we were never meant to do this alone. Not one time. Not one time. Parenting, grief, trauma, a global pandemic. We were never meant to do this alone. And never in the history of the free world have we been more disconnected than we are right now. When we are raising money for causes that mean we want to help people in need, we want to sort of connect to people who, may be not in a position of privilege that we may find ourselves in. Our job here is to walk people home. And if you have the means and the capacity to do that, my Jesus, there's nothing more holier on this planet than serving humans, because you will need it and so will I at some point in our life.
Man, that's a great message. Mike, I just mean that's a great message. We've been offering support to Mike all day long as he does this, right? It's been great to have guests come on and to be able to talk to him, like through the screen he's watching everything. And I know that just every time he runs to take a pee, Jodie, he's got a big smile on his face, because every guest that comes on, we talk a little bit about him and what he's doing, and it's just so incredible. And I think your message about running with him, I think that's awesome.
Yeah, I mean, I think sometimes what I really want him to remember right now is that, when it hurts and when he's feeling woozy, all of those things, if he only knew, if he could only remember just for a second the impact that this is going to mean. I mean, I'm watching as it goes across the bottom of the screen, Gary and Shirley and Sheila Mason, $35. Like, he are inspiring people to do that. And the ramifications of that are huge, way beyond this day. And that's our purpose, particularly in our small communities. I mean, I'm certainly we're raising our babies in old Alberta, Canada right now. And I deliberately chose to set up shop in a small community. We are so much stronger together, and proximity matters. When I know you, when I coach your kids' hockey team, when I understand the vision, the purpose that I'm fighting for, I'm all in. I'm all in. And I don't know if you have met a guy on this planet that is more all in than our Mike Weglin. I mean, have you ever, in a history of the free world, met anybody who's more all in? So
He amazes me every time I talk to him. Yeah, I've had him on the podcast before, and me and him bantered, and we had his orthopedic surgeon in here. He's had knee surgery, and he's still doing this. Like, is that not unbelievable?
Some would say insane.
I would like to see the definition of insanity.
Well, exactly. It is a fine line. He walks it every day, which makes me so proud to support this process, right? I mean, this guy is the epitome of sort of what he says, right? Like, if you got kindness and connection and giving back to your community, but I'll tell you, like, he shows up. We have Stay Lit, so we do 4 events a year, and it's all about reconnecting the community, and it's virtual now these days. It'll be virtual for the rest of our lives. Mike comes, I don't know if you know this, well, you obviously do know this about him, but he's a DJ, right?
Absolutely,
and so
yeah.
I say to him, would you show up and, like, spin, this is my universal sign for DJing, are you ready?
Absolutely.
So I say to him, in no uncertain terms, I'm like, hey, would you just show up and, like, we don't have any money to pay you, but I'm just wondering, like, would you do a little for our event where we're going to change the world? And like, he never even, he's like, yeah, like, what do you need? And he comes, and, like, not just but there's, like, and his wife is there, and he's throwing it down, and he's making shirts, and he's like, are we going to change the world? Are we all about, inclusivity and diversity and talking about racism and having those hard conversations? Like, what do you need, Joe? And I just, like, there's not enough people like that in the world who truly have a heart and soul that just resonates from the core. And, I mean, he's so nice that sometimes I think he's drunk. You know what I mean? Like, those people that you really want as your friends because they're so nice you think they're drunk all the time. And he's not.
The first time I ever met Mike was late at night. We did his podcast. And I know exactly what you mean. You're like, is this guy on something? Right? And now you go, no, that's just Mike, right? He's the guy who walks by and says, man, I love you. Keep killing it. And you're like, yeah, for sure, Mike, right? Like, who's that nice?
Right? Yeah, so I love you're supporting him, and all of these people are supporting him. It's amazing.
Well, I tell you what, I'm pumped. I'm going to be very truthful with you, Jodie. I've heard of you. Mikey's told me a lot about you. when I was doing the research, my wife, who's a teacher, looks at me and goes, "You're an idiot." And I'm like, "Okay." And then I listened to you last night, and all I want to know is, so are you going to be on Mr. D? And are you going to be the love interest?
Yeah!
Are you really?
Oh my God, we're still emailing back and forth. So I'm like, listen, Jerry, I feel like here's the thing. You need to have an inappropriate relationship with a psychologist. Like, are you game? And so I'm waiting for a response.
Hey, I just like to say we're breaking news on this thing, too. I think that'd be friggin' kick-ass, and I think you'd be perfect for it.
I do too. I think he'd be a lucky son of a bitch if he would just engage with me. I think it'd be so good. Listen, he was phenomenal. He's salt of the earth kind of guy, and is doing great things for teachers, and is super, super funny. I am such a huge fan. So it was an honor to get to talk to him.
Now, as we move into the holidays, your cup struck a chord with me last night. It said, "Braver Together." And I thought that was really important for, where we're heading in the next couple months, or at least the next couple weeks. Could we talk about that quickly?
Yeah, no, for sure. So this is going to be probably one of the trickiest seasons of our life for many of us, right? When, the government, and I understand in Saskatchewan, you just got the news yesterday as well, that it is this idea that we have to actually separate from the people we love the most to keep the greater good safe. And it's a message that is so tricky to digest, particularly if this is the last Christmas you're going to have with Grandpa, or, if you're a single mom and you're trying to figure out life. It's not as tricky if you're a physician or a paramedic who has had to hold people, as they say goodbye to their sons and daughters through plexiglass. So perception is a function of experience. And I think all I would say right now is that we are wired to do hard things, because there's so many people who've come before us that have sent their babies to war for 4 years and didn't know if they were alive. That this isn't the first pandemic, that people have buried their own children. Can we survive hard things? Yes. Yes, ma'am, we can. But we will be so much better if we stay connected. And some of the greatest teachers of all time have done their work virtually. A guy by the name of Mr. Rogers was never in the same physical space as his students. And he was a game changer for millions of people. And he did it all virtually. So as we celebrate the season, if it's at all possible to keep the greater good safe, I know people are not going to love it, and I understand. If you can think about what it means to save other people at the risk of your own, I mean, that's where we're at. Oh, our whole family tested positive for COVID-19 except for our oldest son. He tested negative again yesterday. We were in quarantine together for 32 days. And our oldest is still in quarantine because, of course, he's still in the isolation period. But it is not something you want, and it is certainly not something you want to give.
Well, I appreciate you hopping on here and sharing everything. This has been a treat for me. I got to be honest, you've just fired me up for the next 3-4 hours of this thing. I'm sure you've got Mike going. Before I let you go, we've been twisting arms. I don't know, maybe Mikey's already twisted. Maybe there's no twisted that's needed. Maybe you've already donated. I have no idea. Can I get you to donate some money? And then can you whip Mikey into shape for the final go here?
Okay. So first of all, this is what happens. If he completes this, I have a check for $1,000 that I am going to give to him, to you, and it's my heart is so full. And look at me right now, Michael, look into my eyes, okay? You are a strong son of a bitch, and you are doing great things for amazing people. All over this community, people are looking to you in admiration. If you ever need a kick in the ass, this is it. If you only knew how important you were in this process, you would do this for another 12 hours. You've only got a few left. Dig in, and I am so proud of you. I love you, brother.
Awesome. Thanks, Jodie. Thank you for hopping on.
Thank you for having me. Sending all the love, and now apparently all the money. All the money.
Almost got through it.
Yeah. I'm sorry. I mean, it's the best I can do. All right.
That's awesome.
Take care.
All the best.
Bye for now. You too. Take care. Take care of him.
Okay, that was Jodie Carrington, Dr. Jodie Carrington. And now we're going to head off. Well, Mikey, you got your earphones on? No, he's listening to it. Mikey, I'll come to you after. Let's go to the artist Brandy Hoffer and a little sit down we had with her. We're now joined by Brandy Hoffer, the very talented artist, Brandy Hoffer, I should say. As you can see in her background, she is a little more colorful than this guy. First off, thanks for hopping on.
Thank you for having me. I'm excited to be here.
Now, I got to ask, how has life been on your side in the middle of a pandemic? 3 young boys. I assume some hilarity has ensued being at home with them.
Yeah, so I actually started documenting and like blogging a little bit about some of our experiences initially because it was scary and we all reacted in different ways. So we looked back at some of those photos and at some points I was chasing the kids around in like a banana costume. Like we were just, all the board games were pulled out and everything was just, yeah, you were looking for a distraction. Although my husband, Carly Clausen, he still had to go to work. So that was really scary, just because we didn't know what to expect. And so he was still there every day. Windsor Pride was still like an essential service. So actually, things didn't change at all for me, at all. You know that there's like a little meme puppet and he like looks to the side, and I think some people have used it recently, but it has like a caption and it says, when you find out your normal daily lifestyle is called quarantine. That's me.
That's you?
I obviously work from home and the majority of my day is spent with my 3 boys. So we were just here, but doing the same things.
I chuckle because I've seen your recent videos, your blooper videos, which I highly suggest people go out and watch, because as a parent with 3 young kids, when you're at home, hilarity always follows, and usually not like you're laughing, but you're like, oh my God, they just did X, right? Like, I don't know what it is. Like, I'm sure we all got a million things. So when I watch your videos, I think a lot of people can relate. Is what I'm getting at.
Well, so many people now are working from home. They're like, oh, I get it. And this is not at all easy. Like, I feel like a ton of mothers or parents or stay-at-home parents, I should say, it's not just mothers, it's fathers too, but stay-at-home parents were just kind of like cheering a little bit, like, now everyone knows how I feel. Right? We're like, yes, finally. And a good example of how real things happen. So I have a platform and I talk a lot about artwork, and I was making this very sweet video of this artist sent this beautiful package and she had dried flowers, and I was like, look at these dried flowers, and wow, she found this photograph and she sent it with a written note, and all of a sudden Finn's like, Mom, I got poop on my hands. I'm just like, okay, I have to go. So thank you for sending me this beautiful artwork, and that's it.
But that's life. That's life, right?
Yeah.
Except when you're in the studio. I specifically built this thing away from the house so I don't have to try and like dodge people coming in. But I'll say I had Ken and Jen Rutherford stop in with their newest edition, Ben. And while we were trying to just record a quick little thing for this, right? A little quick interview about them having their 6th kid in hospital. There's Ben just squawking away on the mics. It was awesome. It was such a cool experience. So I admire you.
More endearing, that's for sure.
Yeah, I admire you for what you do, because I mean, it's got to be difficult at times when you just want to sit down and hammer out some work, and kids are coming everywhere, and you're like, yeah, well, here we go again.
Yeah, they're like, oh, I'll just paint with you. And Theo's figured out, he's 1. And he's figured out how to open paint, and he's like, I know how brushes work, and I know how, like, it's just like, great. I've got another one. I've locked them in the garage. Hopefully no one makes it out through that door.
Well,
we have a bouncy castle in there. This is the things we've done. This is the lengths we've gone to. I have a bouncy castle in the garage.
Let me be very clear. We figured out the bouncy castle very early on. We got very hyper children, and we put a bouncy house in our basement. We fit it in, and it was like,
I think
perfect.
I told you to do that. It was like a year or 2 ago or something. And I was like, get a bouncy castle. And when it's -23, like it is today, blow it up. We
Yeah,
have two now, actually. We've upgraded. We have one in the basement, one in the garage. And we moved from the levels.
parenting tips with Brandy Hoffer. I like it.
Yes.
Now, pulling you into what we're doing today with with trying to raise some money for the hospital, continuing care for yourself. Like, maybe you got a story or two of why those two, the hospital, such a vital piece of our community, why it means so much to hop on here and be a part of this.
I mean, it's an essential part of our community. We obviously need it, and we hope that it is up to date and we have as many supplies and things to utilize as possible so we can treat people properly and give them all the services required, right? So we all need that to live and survive. But I feel like it's so tight knit and it's always close to the heart when it comes to the hospital. Obviously, I had my 3 children there, and the staff is amazing. They care so deeply. They're there all the time. In fact, when I had Theo, my 3rd, I was looking forward to going to the hospital because I had spent the summer pregnant, waddling around on the street, chasing after my 2 other boys. And I was just like, I cannot wait to not do this anymore. And my husband, Carly, was like, do you want me to stay? I was like, no, you go. And he phoned me later. He's like, what are you doing? I was like, I'm enjoying this meal that someone else cooked. It was like mashed potatoes and like a burger with gravy. And I was like, oh, this is great. And I had my new baby and who's sleeping. I was like, this, beyond all the pain. I was like, but you get painkillers. Beyond everything else, I was like, not really painkillers. It's like high strength Advil.
Listen, you ladies just gave birth. I think we can call them painkillers or whatever. It doesn't matter.
But I was like, this is like my hotel. This is my hotel stay. I'm having a great time. And the same day, 2 Hofer babies, my baby's a Clausen, but the same night, 2 Hofer babies were born. So it was kind of funny. And the other 2, one woman this was her 6th, and the other woman had her 7th. I was like, you know what? I bet these women are really enjoying their stay too. Just milking it. They're probably like, I should probably stay an extra night, actually.
Well, I appreciate that. I'm sure Mike, if he hasn't fallen off the treadmill laughing yet, he's been chuckling to himself. That's awesome. Normally I twist every guest's arm about trying to donate some money, but I know with you mentioning your husband, Windsor Plywood, could we maybe just shed a quick light on what Windsor's done today?
Yeah, so they donated, I think, 1,000 to something for that. I didn't get the specifics. We've donated and we're excited and we're happy to contribute. It's a worthy cause for sure. I wanted to talk a little bit more about that, just one little thing. So I live around 2 nurses who work at the Lloyd Hospital, and we're great family friends. One has 4 boys, one has 3. So obviously they all travel as a pack together. And the sacrifices of the staff, it's not just the hospital, you're supporting people. You're supporting people working in our community. And talking to these mothers who were going in, and at the beginning of the pandemic, they were willing to, they were setting up rooms and to not see their families for however long was necessary in order to, face what was potentially could happen, right? So you're just not supporting a building, you're supporting the people in the community.
Yeah, 100%. I can't say it any better than that. I appreciate you hopping on and taking a little bit of time away from your family to shed light on what's going on in the community and helping support this. Before I let you go, can you tough talk Mikey Dubs while he's on the treadmill running, and just give him some Brandy Hoffer tough love?
I'm not really a great trash talker, but maybe like more of a go for it sort of cheerleader.
Cheerlead away.
You can do it. You can do it. I know he can. I've watched his videos and him running days and nights and all sorts of things. Like, I'm not surprised, and I know he can. And yeah, I'm happy. I'm proud of him.
Well, thanks for hopping on, and great tough talk.
Yeah, friendly. Thanks for having me. It's always good to talk to you, Sean.
I don't know. What do the viewers think? Do you notice my missing teeth? I don't know. We've been having a chat here about it. It's just me. That was Brandy Hoffer, Windsor Plywood, donating money to the cause, and now we're squeezing people in because we got to talk a little bit about Mikey Dubs. So I'm joined now by Shara Knorr of CBI, a physiotherapist. Just give us the lowdown of what just happened to Mikey, because all I heard was somebody, you were watching him on the thing, and he's starting to walk, he's moving weird, and now what? Now you're down here, and what's going on?
You know, the pleasure of working with athletes like Mike is they're bonkers. And so you get pulled into their insane world, unwittingly down a rabbit hole of crazy, and a good crazy, but crazy nonetheless. And so, you know, if you think of it like a vehicle with mileage, Mike's a smart car. You know, he's not a big dude. Probably runs a little lean, you know, gets good mileage on the highway. But even at that, you'll have to stop and pull off and, you know, maybe check the tire pressure.
Yeah,
And
adjust
so
a couple things.
Adjust a few tweaks and things on his. And he's got so when you run on a treadmill, it's very different than running outside. It's a different mechanics altogether. And so what people don't realize is on a treadmill, you're very limited to your stride length. It's dictated. Every time the same stride has to be the same, and your shoulder movements are the same. So when you're outside, the cadence is different. You're up and down a hill, you'd step over something, and so the journey is very different on a treadmill. It's actually much shittier on a treadmill. And so not only is he on autopilot,
You were just listening to Jodie Carrington, weren't you?
Yes. I'm going to swear too, can I?
Well, we encourage not swearing, but you are following Dr. Jodie Carrington.
Ron McLean's memory, Mikey Dubs' endurance, and Jodie Carrington's wealth of expletives is what I would like to pull in from the last hour. And who was the hockey player? I want his life. You're the older gentleman that came in.
Oh, Skip Craig.
Yeah, that's
man.
the guy. I want to go for a beer with him. If
He
I
is
could
he
pick
is
from
he
the
is
day
one of
of
the
what I
best.
want to do.
Now
Anyhow.
you're getting the wave, which means I got to slowly wrap this thing up. You walked in. We got to talk about it here for 2 seconds. You walked in. She's playing Unbelievable on her phone.
Hey, you guys.
And I've been
here's
getting
the hype
texts.
song.
Put it up to the mic. Yeah, she thinks she's hilarious, but you know what? It isn't just you. I got people texting me they're playing a drinking game right now, and they don't enjoy the word unbelievable anymore. So I've just said it 3 more times. It is now mind blowing and impossible, and we're turning the impossible into the possible with you two, Mikey, sitting over there. A few words for Mikey as he carries on.
Mike, I'm happy to tune up this car of yours, but you are an unbelievable individual. It's not a word that doesn't get used for somebody unlike yourself. And I'm happy to be here and give you a tune-up. But this smart car is going to have to pull off the road at some point. I hope it costs people lots of money for having done what you're done. It's a joy to be part of this journey. I'm proud to be a Lloydminsterite, and I'm proud to be part of this. Thanks, you guys.
Yeah, thanks for hopping in and fixing them up so we can keep going. Because, Mikey, we still got time, man. So get moving. And she did say you're a smart car, so I don't know. I guess smart car away, big fella. Okay? Thank you, Shar, for hopping in.
My pleasure.
Okay, well, we are, I think, waiting on Glenn, I think is the next one. And as the phone likes to do, it just keeps ringing. That is right there, radio stations trying to get a hold of me. I apologize to anyone trying to phone me right now. They're probably watching me talk right now, go, oh yeah, he's still on. Now, we are at $168,000. $122.50 per kilometer for Mike, and he is over 80K. I think when I was talking to Dr. Jodie Carrington, he was at 84. So it is going up, 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 up. And we're closing in on the $200,000 mark. That's from all of you folks watching, sharing, donating. It's just been mind-blowing to be a part of. And it's always funny. I should point this out. When people sit down, they're like, oh, Sean's still talking, so I should probably sit here. And then I keep talking, and they realize, well, Right, he isn't done. So what happens now? So then they sit here, and then they go to the door, and it's a slide door. I've been saying this all day. It's a slide door, and they all pull. And then they get a little nervous because now they're like caught in this like zone of like, uh-oh, now I'm creating noise. And now they have panic, and we all giggle a little bit, and then they finally figure it out, and away they go. I got the table being cleaned, as we keep mentioning. We got this in between us so that I can sit like this. There might have been down everything across for me, so for the next guest, it's all cleaned and all ready to go. You know, at 62 kilometers, we had 93,000 steps. I'm wondering what we're at. Give me one quick sec here. I want to do this. 88 times 50. It's like 132,000 steps he's up to now. Like, think about that. I know that's a day in the life, but whatever. I couldn't do it. I don't know if this man could do. Glenn, I'm now joined by Glenn Vagnon. First off, thanks for popping in. Do you think you could be where he's at? He's at over 80 kilometers now.
Yeah, no. I go on the treadmill every now and then, but not quite to that extent. That's incredible.
It's I almost caught myself there, folks. I caught myself. It's mind-blowing.
Okay.
I've been saying the other word an awful lot, and people are starting to make jokes, and you just missed Shar come in and have the unbelievable song playing, so I get it. I'm saying it an awful lot. I'm trying my best here. Let's talk about today. You're a guy who gets to see and be a part of things. Does this surprise you whatsoever?
Oh, not at all. I mean, this is a great community, and there's always tremendous support that they throw out there. So we've got a great volunteer base, we've got a great business base, and just a wonderful community to live in.
Yeah, absolutely. You're here on behalf of Border City Connects. What are some things that are going on that side of the world?
Well, you know, it's interesting. We've got quite a relationship with the Health Foundation. We go back to back in 2015 when we were approached by the CEO at that time. That was Wendy Plandowski. And she said that they had a problem getting people to medical appointments in Edmonton and Saskatoon. Is there something that we could do? We were known as the Handy Van back then.
Okay.
And so we kind of put our heads together here, did a little research, and we came up with the Border City Caravan and came up with the Made in Lloydminster solution. So we were able to have volunteers. They actually, the Health Foundation donated the first vehicle. It was a 2015 Dodge Caravan, brand new, and we still have it. And we've got 3 additional units that we've got now, but they donated that first unit to us. So that had a big impact on the success of that program and the way that that's the way that it's grown. So we offer people pick up at their door, a drive to their appointment in Edmonton, Saskatoon, or Vermilion, wherever it may be, and then we wait for them, and then we bring them back. And that's all for a donation, as well as we don't turn people down. If there's a financial issue there, we have individuals and companies that pay for those individuals that donate dollars so that everybody can go. So it's been a great success, just a great success to say the least. So yeah, we've gone from 1 caravan and now we have 4.
I have to ask, and I don't know the answer to this, so obviously you'll be able to tell it to me, but is the Paragolfer under you as well?
That's correct. Yep.
I had Brew Man in here earlier today, and me and Brew go way back.
Sure.
Best friends with his oldest brother, and me and him played hockey he was my defense partner in senior up until the accident. And that thing right there, that Paragolfer, which allows him to golf now, you can just see, like, it lets him have a bit of his life back, which is just so awesome, right? He can kick my butt in golf. Like, let's be very clear, I'm not a very good golfer. But maybe could we talk about the Paragolfer just for a quick sec to shed some light on? It's a relatively new addition to Lloydminster. Just how that came about. Maybe if people don't understand what the paragolfer is, just a little bit about it.
Sure. Well, the paragolfer is a unit that was developed. It has a hydraulic seat, so it allows the individual. Again, it can be a single, a double amputee, or a paraplegic that doesn't have use of their legs. It puts them in an upright position, and so it was developed by a veteran in the U.S. and he developed it for golf, and so that allows people to stand up, get the swing the club, and it's just a nice compact little unit that goes into sand traps, goes everywhere. I mean, I was driving it around the other day up at Brew's place to pick it up.
Yeah.
And so, it's kind of an all-terrain little unit. And so, what it does for an individual is just incredible. It just gives them that gives them that freedom. They can get back onto the course, and it's also can be used for archery or riflery. There's many different things. And one of my favorite things for it is, if you take a look at there was an example that when I was taking a look at these things of a gentleman standing up at his wedding, and he would be in a wheelchair, but he was in a paragolfer, and he was standing up while he was taking his vows beside his wife. So that can be graduating students, many different things. So yeah, it's a very powerful unit, and it allows just great freedom for people to stand up.
That's cool.
It is.
Before I let you out, you kind of see the things waving. They're slowly winding us down. You see on the screen Mikey Dubs running there, trooping on. What I've been getting everybody to do is just push him along here as we continue this live stream. He's by himself, and any words of encouragement he gets to hear, and be better than me talking for another 12 hours. So could you throw some love at Mike?
Hey, throw a little love at you there, Mike. I mean, you're obviously doing a fantastic job. I admire you immensely for that. And, you got a lot of things on your shoulders, a lot of people depending on you here. And just keep up the good work. It's incredible.
Thanks, Glenn. I appreciate you stopping in. And now we'll switch over to an interview with Chris King. We're now joined by the head coach of the Lakeland College Women's Rustlers basketball team and co-owner of the Hoop Factory, Mr. Chris King. So thank you, sir, for hopping on.
How you doing today?
I'm doing pretty good. How are you doing? I always think of you when at home with the three kids. How's life on your side of things? 3 kids, pandemic, locked in a cage. How you doing?
Yeah. Well, you know how that goes. We've had a fight over a train, a fight over a Barbie, and a fight over a T-Rex so far today. So that's 3 pretty good fights, and only 2 of the 3 are up. So there you go.
Well,
but, life's good.
That's awesome. For the viewers, we should throw your wife some praise. Courtney is getting her master's right now?
Yeah, her MBA. Yeah, correct. Yeah.
And how young is your youngest now?
Okay, that's a loaded question. 7 months. Let's say 7 months. Yeah.
7 months. Imagine doing your MBA and having a 7-month-old. Not to mention another 2 on top of that. That's impressive. So, I kind of feel bad for you, but I know you got a good woman beside you that's taking the brunt for you.
Yeah, she's carrying the load. Let's be honest here. I'm just coming home and helping when I can. That's how it works.
Now, Chris, today we're raising money for Lloydminster Hospital and Continuing Care. You've been head coach at Lakeland College for 13 seasons. You've been a part of this community for a lot longer and grew up in Kitscotty. First off, with your team, how have things changed here? In your 13 years of coaching, this season or lack of a season, it's been an odd year. How have things been going for the basketball squad?
Yeah, odd year is an understatement. We've been practicing like normal, just no games. The biggest thing that I've noticed is just the mental health of our athletes at this point. With no real care for them, they're struggling a bit with that. And this is the first time for a lot of them that all their classes are online. So they're learning a new way on the basketball court. They're learning a new way in the classroom. So it's been a rough year for the group altogether. Now, I'll give them credit. They've been really positive about it. So I've been very proud of that part. But the uncertainty, as everyone knows, is leading to probably a higher stress level in our athletes at least.
You mentioned practicing. How has been practicing with now with social distancing and everything else? Like, how has that been?
Yeah, so we're done. The social distancing, when it started, it was like one person per hoop per ball, which is great because you're doing something instead of nothing. But ultimately, that only lasts like a week, and then you're getting bored of no contact, no one to compete against. So we're lucky the college really supported athletics and had us on campus and had us training as a pod for almost the whole semester. So we got 50 practices in. As a coach, I thought it was great. As players, they're like, we need some games. Like, we got to play some games. They're getting sick of me. So when they come back in January, if we're going, I think they'll love to hear a different voice at some point.
Well, like I say, today to steer it towards what we're doing today, we're raising money for the Lloydminster Hospital. I've been getting everybody to share some stories on maybe how healthcare or the hospital has impacted their life. I was wondering if you could share something about your life.
Sure, yeah. So you probably know I'm a severe asthmatic. I was born that way, so I really struggled with it as a young kid. So for me, I spent a lot of time in the hospital in that May season and then again in September, basically matching up with the farmer's life, really, with all the dust and pollen and stuff like that. So for me, having the care and having everything available, nebulizers and stuff like that, I was in there probably more than I'd like to admit. I'm going to blame my parents on poor genetics on that part, but just having such a warming healthcare system here in Lloydminster for me personally has been a big part of my life because it has affected me so much. And if you take that further as a coach, I coach a lot of international kids in the hospitals, probably the first stop that they go to when we have injuries or when we have issues. They're using that facility. So I can't express how much it means to me as a former community member, now as a coach with athletes in the community.
Well, I share everybody's sentiment with the hospital. It's such a, I think Ken Rutherford had said, he talked about the vital organs of a community, and he was talking about schools and, for Canadians, the hockey rink, but the hospital's right at the top of the list, right? Anytime the good, the bad, every stage of life, there it sits. And if we can give it the best, absolute best equipment and people in it, we all benefit from that. And I think you'd probably share that sentiment as well.
Yeah, and especially having all three kids born in Lloydminster. When you drive past it every day, you think about the joy that brought our family, having those three kids delivered safely in Lloyd.
You stopped in and dropped me off a shirt, and I just realized, what am I doing here? Here, I'll give you a.
That's still a good team. It's still a good team.
There you go. Hey,
there you go. There you go.
I'm representing. Now, I've been twisting arms all day long. We're trying to raise money today. I'm curious if you're interested in hopping along with the game I've been doing with guys. We got Mikey Dubs running 12 hours on a treadmill. I don't know if you've ever put, as a coach, the ladies through running on a treadmill for 12 hours. I would assume that's cruel and unusual punishment.
Yeah, we might get to 12 minutes. That would probably be our max, to be honest. Not a chance that long.
Well, we've been getting people to donate a dollar amount per kilometer, and at the end, after he's done, and I finished 98K. Who knows? Maybe I'm setting that high or low, Mike. I apologize, but wherever he gets, you multiply your dollar amount, and that's what you donate. Is that something I can twist your arm on doing?
Yeah, you bet. So we'll do, I'll donate $1 a kilometer from myself personally, and then Hoop Factory will also match that donation $1 a kilometer. Does that sound good for you?
Oh yeah. No, that's awesome. Mikey better, I've been saying this over and over and over. Mikey better be like getting fueled up and just hammering that treadmill. Cause I want him to hit something crazy, like 110K or something. So we're all like, oh man, that's unbelievable. But when I do the math on that, I go, I don't know if that's possible.
I have no clue on running on a treadmill what it takes, but are you going to be taking him energy packs over there so he's like juicing up so he's got enough carbs going the whole time, or what's happening?
Mikey's got a team member there keeping him on. I'm in my little bubble. I get to sit and chit chat with people, and that's what I'm doing. So Mikey, give him the thumbs up, Kinger, and tell him get running.
Yeah, let's go, Mikey. Let's go.
Thanks for stopping in.
Okay, no problem. Thanks a lot.
So I just listened to that, and I realized even in the pre-records, I'm saying unbelievable. Mind-blowing. I'm now sitting across from the mind-blowing Kurt Price.
Mind-blowing. Thanks for that mind-blowing introduction. Thanks. Appreciate that.
How's it going?
It's going very well, despite this pandemic and the COVID-19, the restrictions that were announced yesterday, and that have everybody a little bit bluer today. But things are going good.
Yeah, well, this has been, I've been having a lot of fun in here. I know you, a guy who sits behind the mic, know that 12 hours is not easy, but when you're having fun doing it, it's doable.
It's amazing how fast the time will go by. I mean, it's exactly like that. As long as you're having fun, and as long as you're having fun, it'll come across for everybody else that the day is going by just as you had hoped, right? And I think that it's going exactly like that, just as you had hoped. Things are running nice and smooth, and all of a sudden you look up and it'll be 6 o'clock and be like, how do we have an hour left? Where are we at? What's our total?
Take a look at the board for me. We're at 100 now. It hasn't been updated in a little bit, and that's I'm not blaming anyone. That's just the way she goes sometimes. We're at $168,000, but that's like 15, 20 minutes ago. So you can imagine that we're closing in, and that I believe that doesn't include Mikey's running number.
Yeah.
So as Mikey closes in on 100 kilometers, go Mikey go. That is an additional, at 122, that's and there he is. See, he's running to the bathroom again. Get running, man.
Well, you got 168 on the board. On behalf of the new Lloydminster Nissan, we'd like to make that 169. On behalf of our general manager, Jeremy Wagner, and our team at the new Lloydminster Nissan, we'd like to support the Lloydminster Regional Health Foundation with
$1,000, folks.
$1,000 from the new Lloydminster Nissan.
Appreciate that.
Well, we appreciate what you guys are doing, and we appreciate what the Lloydminster Regional Health Foundation does in our community, and we appreciate what our doctors and what our nurses are going through, and what our seniors are going through as well.
I think seniors is a big one.
Yeah, we had Malcolm on the show yesterday, and he talked about the
apologies for dipping out. I told maybe Malcolm brought it up, but I do work a full-time job.
Yeah.
And on the weekend it went sideways, so it took precedence over everything. I had to cancel a whole bunch of things. But anyways, carry on. I've interrupted.
Yeah, no, I think just that we appreciate what our doctors, our nurses are doing, and we appreciate what our seniors are going through too, and our healthcare workers, and what you guys are doing here. And what Malcolm told us yesterday was how much that of this money is going to our seniors to help them.
Yeah.
And to make life easier for them, particularly during this pandemic, that it's really, really important to donate today. And I don't think there's a bigger or better cause right now than our health, and that's being shown by this pandemic. So,
well, at the 2 months ago, it was a big deal. I just keep going with Christmas holidays coming up, which is a time where Grandma and Grandpa get around, all the kids come together, and all the grandkids come together, and it's supposed to be like this, like emotionally charged day. It's like one of those days we get in a year. We don't get many of them.
Yeah.
Especially how busy our society had gotten. Now it's thrown on its side. But now it's thrown on its side in an even different way, right? Like, we just don't get that. So I agree. I couldn't agree more with what you're saying. And it's donations like this that just come in and then the total goes up $1,000 more, and it just keeps going, and all the money goes back to our community, Kerr.
Exactly. That's what's so great about the Lloydminster Regional Health Foundation, and we hear from our doctors all the time, and from our specialists all the time, and from our hospital, how important the Lloydminster Regional Health Foundation is to them, and how important the Lloydminster Regional Health Foundation was when this pandemic kicked off. When Malcolm was there, and we had Dr. Governor come on my show and talk about how really important the Lloydminster Regional Health Foundation has been to that hospital, and it just means the world to us that we have the specialists that we have here in Lloydminster in our hospital. We have the healthcare workers that we have that take so good care of everyone in that hospital and our nurses that take such good care of our seniors and do everything that they can. And not only that, but I think when we look back at this pandemic and we look at the way that our healthcare professionals have handled this, we will look back with a whole lot of pride in exactly everything that they have done. I mean, you think about when the pandemic was at its peak in the spring, and we were hearing that it was in the lodge, in the Pioneer Lodge. And what did our healthcare professionals do? They took care of that immediately. We didn't see that in larger communities, but we saw our healthcare workers take care of that immediately. And it was people like Dr. Governor saying, we're going to test everybody right now, and we're going to get it out of there immediately. And we're on pace for this day to have our hospital through this outbreak. And what happened at midnight that day that he listed? The pandemic was over. So when we look back on this, we'll be able to look at our healthcare professionals and smile and say, they made us really, really proud.
That is really well put. And it is why you are good at what you do. And before I let you out of here, I think it's really wise that the viewers know that Kurt normally runs a show on Tuesdays.
I do, yeah.
And for this, you guys moved it to Monday. And I really do appreciate that. And you lent us a guy sitting back there who's making it happen in Forge's Media, Paul Forge. And it's the little things that make something like this just tick along, and nobody ever catches notice. But I noticed, and I do appreciate that. I think it's a huge trying to tip the cap towards you, because that would go unnoticed otherwise. And to me, I really noticed that, and I think, geez, that's a veteran move in your part.
Well, it's a no-brainer. That's for sure. This is really, really important. It's important for our community. And when I come in and I see the sign saying this is our community's gift to health, that's exactly what it is. It's a Christmas gift to health. There's no better season to give than the Christmas season. And if you can give, I hope that you will give. I hope that you'll do whatever you can. If you can't give, I hope you'll do other things like write a Christmas card to our healthcare professionals or to our seniors. I know Dawn Interiors is doing senior cards for the healthcare for the seniors here, and so do whatever you can. Share this video. Even sharing this video is going to help. Even sharing
that's
the live
something
stream.
cost effective. You don't need much money to. Well, actually, you need a piece of paper, write a card on it, right?
Yep.
And then we go and light somebody's world up. Now, before I let you out of here, because they're waving signs and doing what they do, you see the man running there. He's closing in on 100 kilometers. What do you got to say to the man to spur him on?
Well, I think about a guy like. I think his name was Tom Moore. He was a veteran in Britain that did 100 laps around his garden. And everybody he's a World War II veteran, and he did whatever he could, and he just did laps.
Jeez, isn't that a cool
And that's
story?
kind of exactly what this gentleman right here is doing. He's doing whatever he can with his body, and he's insane, but we appreciate him doing it.
Well, thanks again, Kurt, for stopping in and giving us a little bit of your time. To Nissan Lloydminster for the $1,000 donation. And just once again, thanks again for being a part of this.
Well, you're welcome.
Okay. Well, we move along here. The ladies, I assume, are going to fly the door open and do some cleaning. We got more guests just coming. Kurt's laughing at me because he knows how this goes, right? The total is now $169. I'm waiting for maybe Michelle go up. $180,000. There you go. So.
You're getting very, very close here. You're $20,000 away from your goal.
Yeah, what time is it? It is
About
4 o'clock.
Yeah.
So we have 3 hours to go.
Yeah, and you're only $20,000 away.
Yeah, like
only.
Yeah. No, like that's a small number.
But when you have a community like Lloydminster, it's very doable, right?
Well, that's what I've been saying. They set the goal 200,000, and I went, oh,
yeah,
that's a big number.
It is, but
I go, if there's a community that's going to do it.
Yeah, I thought of any when they first said 200,000, I was like, that's more crazy than the guy running for 12 hours. But here you are, you're $20,000 away, and once again, this community just proves why it is so special. There's so many unique things about Lloydminster, and I think the Lloydminster Region Health Foundation is one of those things that makes us stand out as a better community.
Absolutely. Once again, I just couldn't agree more with what you're saying. I give you the mind-blowing Kurt Price, folks. Hey, all you unbelievable fans out there waiting to take a sip of something. I'm getting harassed here. On the phone. It's
What are you sipping?
I'm not sipping anything.
Oh.
But they've
you're
made
like-
a game out of the word unbelievable because I keep saying it all the time in every video I do, and I'm getting text, and you know who you are. So they're having some fun out there. People are paying attention, which is cool, right?
Every broadcaster has their crutch. Every broadcaster has their crutch.
Well, and the thing is, as the hours go on, I think I lean on my crutch a little harder, Like it just gets...
Yeah, I can relate to that. Yeah. Mine's of course. I'm always saying of course. Of course. Of course. Of course.
Well, thanks again, Kurt, for hopping on. I better keep this thing rolling along. See what the sign says?
Yeah.
They got to...
You know, in broadcasting, when they show you a sign that says wrap up, it basically means keep going, keep going, keep going.
Keep going. So this is one of the signs for the people. If you could see that, there you go. That's what they keep putting up for me. Wrap it up, Chatty Cathy.
And of course, when you're at home, you get the sign that says shut up. It doesn't say wrap up. It says shut up.
Yeah. Thanks, Kurt.
Thanks for having me.
Well, if you want to open that door, Kurt, I assume somebody's sitting there, yes?
Yeah, Jill from City Furniture and Mashteller Home Store.
Okay.
Good stuff.
Yeah.
We'll get the big deal in here.
That's right. Thank you, sir. So we got an action-packed hour coming here, and the donations just keep coming in. I got the check sitting in front of me, folks. I don't know what to do with it, but we'll get it to the right people. Kurt Price. I mean, there's a professional right there. There's a guy who's been around this industry a lot of years. Here's my lovely Stephanie doing the cleaning. Man, look at me. Look at what's wrong with this video, Mike. I'm sitting here, and they're cleaning everything. You know what? I'd like to become clean, Steph. Be sure nice if that Brant Wheeler would come back in here. The audience sure seemed to like when he was cleaning.
I like when he cleans. Perfect. Are we ready?
Oh, yes, you can that is a check.
Perfect.
Sorry, that was a $1,000 donation from Nissan Lloydminster. Okay.
Perfect. You ready for Jill?
Absolutely.
Wonderful. Thanks so much, Jill.
How's Dill doing?
I'm good. How are you?
Good. I'm now joined by Dill, the owner of City Furniture. Don't mind what's going on over there. They're going to start waving at us at some point.
Okay, can I take my mask off?
Yes, you most certainly can. That is why the screen is up. That is why they wipe everything down, is so that we make sure there's no issues on taking masks off.
Perfect.
So how's Dill doing today?
I'm all right. How are you?
I'm rolling. I'm feeling pretty good.
Yep.
Yeah. Now you guys are donating $1,000 is what I have written here. Is that true?
Yes, sir.
So make that 181,000 as our total up to today. Like that, it's pretty crazy.
Yes, it is.
How have things been going with City Furniture? How has the current climate been with business and everything going on?
Everything's been very well. It's just stock was a little bit of a problem. It still kind of is. But we have been ordering and keep on flowing our products as best as we can. And it's hard to open a store during a pandemic. We purchased the buildings in November. Didn't think that this was all.
You purchased the buildings in November.
Well, our family. It's a family business.
Yeah.
So, yeah, we acquired the buildings in November, and then we showed up in March to get things rolling, and this is the cards we were
So
dealt.
you don't know pre and post. All you know is what's going on.
Yes. So, yeah, I'm from the Shuswap. My other uncles are from Dawson Creek, Grand Prairie, Prince Rupert. So we're spread out all over BC and Alberta.
So what attracted you to Lloydminster?
Just expanding the family business. So
what have you thought of Lloydminster so far?
I spent 5 years in the oil patch. So I used to work on drilling rigs. I made my way up to a motorman, and it was a great time.
Like so many of a story in this town, isn't it?
Yes, so it's easy to communicate with people, and I have something to touch base with people and touch home with Lloyd. So, but yeah, 2015 was the downturn in oil. I lost my job in the oil patch, and then I ended up teaming up with the family. So,
can I get you to sit just a touch closer to that mic? I don't know if I want to make sure people can hear exactly what you're saying. They get to hear to my booming voice all day long, so it's good when they can hear the guest voice. Just want to make sure they can hear you.
Yeah, no problem.
What do you think then about $181,000 in 9 hours?
I think that is amazing, and I think we can do a little bit better. I think we can get a few more people out and spread the good word. It's for a good cause, so.
Yeah, well, the lovely thing about today with the Health Foundation and raising money for the hospital and continuing care is it all goes back into this community, right?
No.
Like, it's what's so special about today.
Fantastic.
Now, that man right there, Mikey Dubs, has been running. Are you a runner, Dill?
I'm not a runner.
Don't feel bad. I'm not a runner either. So he's closing in on 100 kilometers, not for today, but I mean, like, he's still got 3 hours to go. So he's closing in on 100.
Yep.
Like, what word describes that is not unbelievable?
Driven.
Driven. That's a good one. I like that word.
Yeah.
Have you seen anyone like Mikey Dubs before where they just go and do something that is incredible?
There's a few of the greats that are listed in books, but I've never witnessed with my own eyes before, no.
Who are a few of the greats for you?
Probably like Terry Fox and...
Yeah, that's one of the greats. Absolutely.
So,
absolutely.
To set your mind to something and be able to succeed with it.
Absolutely. Now, we've been sharing stories of how healthcare professionals or hospital, it doesn't have to be in Lloyd, it can be anywhere, just how it's impacted maybe your family or your extended family, and maybe just share a story about that.
Well, it's like for anything, like they're working countless of hours. I got an uncle who's a doctor and he's a hospitalist, and between his practice and the hospital, he's probably working relentless. And I haven't heard from him much, but I hope he's doing well. But it's just been crazy times. So, and we all use the hospital at one point or another. We're born in a hospital. When we get sick, we go to the hospital. You break your wrist at hockey, you go to the hospital. So it is a good thing to be a part of. So
isn't that the truth? That's what it's been said all day long.
So
is that everybody uses the hospital.
Yeah.
Doesn't matter age or anything else.
Yeah.
Well, before I let you go, we've been pushing that man along. It's kind of a little delayed, but he gets to hear us talk. I like to get some words of support towards Mikey Dubs as he's running. Could you give him a couple kind words before you take off?
Just keep doing it, man. You're an inspiration to everybody, and you need anything at City Furniture or the Ashley Home Store here in town, you come see Dill.
Awesome. Thanks, Dill. Appreciate it. By all means, I'm gonna be proactive here. When you turn around to leave, it's not a pull door; it's a slide.
Okay, perfect.
You won't
I don't want to be walking through it.
I've been joking all day that so many guests do the same thing. They think it's a pull, and then they get like frazzled because I'm still talking, right? And then they're like, and they have a mild panic attack. Slide the door.
All right. Thanks you very much.
Nice meeting you.
You too.
Now, we're still rolling along. I'm waiting on one more guest. They'll have to come back in, clean, and just make sure we got everything up to date. And then here it comes. Where's Brant Wheeler? Hey? Brant is avoiding us. You know, Brant Wheeler came in and cleaned very early in the day. And I tell you what, I gave him a nice little ribbing. But the best part about it is that all of you continued to give him the ribbing, because after that, he wouldn't come back in here, which I find kind of humorous, right? Like, I'm happy people are paying attention. I'm now joined by Laura Marin. Hey. Animator of Project Sunrise, Mental Health with AHS.
That's correct.
Thank you for hopping on.
Well, I'm so glad to be here. I have to tell you that I was a little starstruck. So at 3 o'clock, I was watching, it's like, oh, Dr. Jodie's going to be on. I'm just going to, I've seen her like 6 times and met her a few times. And I thought, I'm just going to watch. Oh, and then Brandy Hoffer came on, and I was like, oh, I can't go yet. And all of a sudden, I was like, I need to get going. So here I am.
Well, I'm glad people are... I'm honestly, I'm really excited that people are tuning in and enjoying it. If you want, slide across. That way we could see.
See you.
Yeah, it's as much fun, I hope. I'm having fun.
Good.
These two over there know I'm having fun. They ignore me now. Every once in a while they'll wave a sign at us. We don't worry too much about it.
Yeah,
but I'm happy to hear people are enjoying it.
Yeah, it's wonderful. So I have something for you.
Yeah.
So these are cinnamons for Unbelievable. So there's a big list of them there, because I was like, if I hear Unbelievable one more time, no, I'm kidding. it was just really unbelievable. So I thought I'll bring you some other some other words.
So I didn't realize how much I said unbelievable until you get a ton of people watching you and you do, I don't know, how many interviews are we up to, Michelle? 50?
I don't even know.
I don't know. She's in the middle of a bite of something.
Yeah.
We're up to 50-some interviews. I guess I must say unbelievable a lot because I've now had the theme song come in. I've had texts about it. They've created a drinking game on it. And now this. So I've actually written mind-blowing and impossible at the top. But preposterous is a very good word. I like that.
Well, good luck using that.
Okay.
Yeah.
You know what I'm going to do for you?
You're going to put that there? Okay.
I'm going to slide it.
Well, I just think it's spectacular.
There we go.
And
Spectacular.
so,
That's a great word,
yeah,
too.
incredible that
Yes.
you're doing this.
Well, I tell you what I'm doing ain't any in comparison to what that man's doing. He's closing in on 100 kilometers. What do you think about that?
I think it's incredible. And I've been watching people donate and cheering him on, so I'll be excited to do that as well.
The bottom scroller, I don't get to focus on it enough.
Right.
But every time I do, it's preposterous. It's outlandish. It is just mind-blowing how many names are going across it.
And a bit unbelievable.
Yes, a
Yes.
bit unbelievable for all you drinkers out there that are having fun this Tuesday
Yes,
afternoon.
yeah. Well, I'm so glad to be here. So,
how about Project Sunrise?
wow, what an incredible gift to our community. So my friend Wendy Plandowski had this vision for Project Sunrise when she was with Lloydminster Region Health Foundation, and she really recognized that we needed to put some supports in place to help people get to the next sunrise. Evenings and weekends were really hard for people. They didn't have access to services. And so we started to dream a little bit about what would that look like. And Malcolm pulled us all together, a bunch of community people, and said, let's figure this out. We're raising some money. How do we invest that back in community to really make a good impact in Lloydminster and to meet the needs of people? What are those needs? And so the city and the Health Region Foundation did the Lloyd Needs Assessment, and from that we learned that about 8 out of 10 people in our community were impacted by a mental health or addiction.
8 out of 10?
Way higher than the national average.
Oh!
So we knew we needed to take action quickly. And having said take action quickly, it took almost 2 years to
Yeah.
get some of the tools
Well,
developed.
as we all know, projects don't happen overnight. Like
Well-
you don't snap a finger and boom, it's there.
And projects that you need to do really well because they're so important can't happen overnight. So it took some engagement. We did some design jams to hear from community. How do you want to receive information? What kind of information do you need? And from all that, I had this incredible team of volunteers. They were unbelievable. And they came, I'm sorry, they came together.
I see what you're doing and I like it.
I'm helping people out here. And so we came together over about 18 months, and we started to draft out what would a resource look like for our community to really help people access the resources they need. And what we heard a lot from people was they didn't even know what was available in our community, and we actually have a lot. So how do we do that education and make it easy for them to access? So this is what was born. It's the Lloydminster Mental Health Navigation Tool. I think you'll know who designed this. It's our friends from Red Bicycle. It's just
Awesome.
a beautiful design, but life is a journey. And sometimes that journey can be really hard. And so we wanted to make it easier for people to access the supports and services and resources that they needed to do well. And so this is a booklet, but we also have a website, lloydminstermentalhealth.ca. And it's fantastic. You can go on there and you can learn about mental illness. Sometimes, there's a lot of stigma attached to that, but when you learn about that it's a disease and that we can help people, we can treat people, then it changes that stigma. And when 8 out of 10 people in our community are impacted, right, we need to make sure that people understand what is positive mental health, what is so
See what they do? See what they do for me?
How do you even do that?
I see. I apologize because the only thing is when she throws up things like that, we got to stop. So you're my 60th interview or guest? Guest? Interview.
Interview today.
So when people go, the unbelievable drinking game, I've probably said it like 130 times now.
Yes.
So you can imagine why it's caught on and why I'm getting teased about it.
Yeah.
But you are the 60th person to come across here, 60th guest.
And I've had the privilege to watch many of them today, so you're doing a great job. I don't know, what else do you want to know?
Well,
about this tool?
I'd written down the tool, the Lloydminster mentalhealth.ca. I just think right now, as we, and people have, if you've been tuning in, you've heard me say this several times, as we get closer to the holidays and how things are not, going back to the way they were a year ago, I just think mental health, we need to be very conscious of everyone's and really be touching base and spreading positivity, because I think the negativity spread, we all know it spreads just as easily. And I think when we talk Project Sunrise, mental health, and the fact that 8 out of 10, that number's staggering. Yeah. I just think, I don't know, I want to, you are a wealth of knowledge on it, to just make sure that people know there are options there available for them if they're struggling, and you have just provided a bunch of different ways for that.
Yeah, so, hey.
And there he is.
There he is.
We're challenging that mental health right now.
See how crazy he is?
Yeah.
Sorry, Mikey's just popped in.
I got a goal in my head. I love you guys. I'll be listening.
Sounds good.
Okay, great.
Like,
so
before I go there, how crazy is that that guy has ran, I don't know, close to 100 kilometers and still walking around like that?
It's amazing.
It's a little bit, you almost...
Freaks me out.
It's almost like he's sitting in there on a chair and he's pre-recorded or something. Like, Mikey, you sure you're in there?
Well, and I saw him sometimes and I thought, he hasn't moved. He's still doing this same movement. They're just like replaying that or something. I don't know.
You think about it though, right? Especially when he walks by like that and he's all like cool and calm and, hey, how you doing? And you're like, how are you still talking?
I know.
Anyways.
There he goes again. That's
right,
fantastic.
There he goes. Hey,
So-
Mike, come on, get moving, big shooter.
So I love what you're saying. And in the booklet and on the website, we have strategies that will help people manage their mental well-being. And so things like being kind, right?
Yeah.
Practicing kindness. That's good for other people, but it's also good for your own mental well-being. Practicing gratitude. And so my husband and I had this conversation the other night. He was talking about 2020 has been a really hard year for everybody, and our family's no exception to that. And I said to him, oh yeah, but let's think about all the good things that have happened in this year. And we welcomed a grandbaby, we have another one coming, we're both working, and we started to list all of these wonderful things. And it's like that whole practice of gratitude can just refocus you and change how you feel about your life, right? And do things that really build hope. So those are the important things. Eat healthy foods, get active, be yourself, and get your groove on. Who knows what get your groove on is? It's music, right? Listen to some tunes, and laughter is, we hear laughter is good medicine, and it really is. It makes a difference on your mental well-being. So all of that's on the tool, Lloydminstermentalhealth.ca. Booklets are available here at the Health Region Foundation and in city facilities around town. And then we have these really great window clings, and I brought one for you and one for Mike. And it's just to tell you that you're doing an amazing job.
That's pretty cool. You're doing an amazing job,
doing
folks.
An amazing job.
All of you are doing
All
an
of you are
amazing
doing
job, yes.
job. And I know that we're running out of time, but I just want to say that in the book and on the website, you'll find apps that we vetted. So if you're an app person and you want something on your phone to help promote positive mental health to keep you on track, you can go on there and find some. There's websites there, and then all of the resources. So if you're a family, a child, a youth, a senior, and you need to access resources, Lloydminstermentalhealth.ca is where you want to go. So I need to issue a bit of a challenge, if that's okay.
Oh, well, fire away.
All right, so today I want to donate $5 for every kilometer that Mike runs, and I want to challenge my fellow city councilman and the mayor.
The mayor comes in here in a couple of...
Does he?
He certainly
Good.
does.
Well, you can tell him the gauntlet is down, and I want to challenge them to make a donation, whatever they're comfortable with. And I'm going to put it out to my Project Sunrise committee today. If you're able, if you would consider a donation to Lloydminster Region Health Foundation today, it would be spectacular, unbelievable, and incredible.
Well, that is great. I'm not gonna do it. I'm gonna look at your list and I'm gonna say astonishing. How's that?
Astonishing. I love that.
I appreciate you coming in. Before I let you out of here, you got to give Mikey some encouragement as he plows on and he smiles and goes. What words of encouragement do you have for that man?
So, Mike, I know you can do this. I've been watching you all day. You're just a hero to this community. We appreciate you, and we're going to raise a lot of money because of what you're doing there, man. So keep it up.
Awesome. We will now go to an interview with Paula Burge. Let's walk the talk. and we'll be back. Actually, and Tyson from LNL Oilfield, back to back, and then we'll be back. We're joined now by Paul LaBerge. How's Paul been doing through, 2020's been an odd year. It's been a year of a lot of things shut down, social distancing, a lot of this where we don't get to actually do this in person, right? And curious, how are things been going with you?
Honestly, not too long ago, I opened up about with everyone about taking my life, and ever since then, it's been a positive outcome. I wish I would open up a long time ago, and that's what I've been trying to do, to try to encourage everyone to open up. But you almost kind of feel guilty in a way, because you see everyone kind of, well, I wouldn't say everyone, but a lot of people are suffering, and I'm actually doing really good. It makes me feel bad, but I'm actually doing really good. I've been just trying to do things to keep me busy, try to distract myself from COVID, making a challenge for myself every day. I think I only lasted about a week or two doing the rocks, the Dwayne Johnson challenge. It's very tough. Waking up at 4:30 every day. So now it moved to like 5:30 every day, which is still pretty good for me. I'm not a morning person. I'm more of a night hawk. I like staying up late and watching TV and doing whatever courses or whatever, just trying to get the brain going. But honestly, Sean, I'm doing good.
Well, that's good to hear. I appreciate you saying that. I mean, I don't think you should ever feel bad. I by no means am I a health or anyone to do with the health community, so to speak. I don't have any degrees, but I don't think you should ever feel bad about feeling good ever.
Right.
Especially when you're talking about some of the things. For people who don't know Paul, he's a strong mental health advocate, right? And I just don't think you should ever feel bad about feeling good. I think you should spread that positivity. I think positivity spreads. I say that all the time.
Yes.
And spread the feeling good, man. That's what the world needs a little more of right now.
Right now, yes, positive vibes. I think that's why everything has happened to me so far, because I've been positive. I got this great job, and then just starting to open up a lot more. I feel great, but I'm the type, I like to see everything around me be good. But hopefully, maybe one day we can get back to normal. But as of right now, like I said, I've been feeling good. I've been going to the gym about 5 or 6 times a week, and yeah, I'm just I'm trying to have my eye on the prize right now, is get ready for the walk. I'm not going to do what I did the last walk. I only trained for like 8 weeks before the walk. This year I'm going to train about 7-8 months before and get ready.
Well, on that thought process, where is your next walk that you're planning to do? I mentioned right off the hop, the first one was Saskatoon to Lloydminster. Where are you planning for 2021?
Regina, Saskatchewan to Lloydminster, Saskatchewan.
And how many kilometers is that?
532.
I like it. I like a lofty goal. Now, pulling it in, I'm sure you're going to get a ton of support for that. I wish you all the best in that. I'm 500K. Mikey Dubs, I wonder what he says about that as he runs 100, hopefully, in 12 hours. That's what I'm hoping he's doing on the treadmill. That would be. Bringing it to what we're doing today, we're raising money for the Lloydminster Hospital, continuing care. Why is supporting local important to you?
Supporting local to me is so important because, well, first things first, how I look at it, if it wasn't for the community, I wouldn't be able to play hockey growing up. Like we would probably just be playing like City League, I think they call it now, right? Like when the community gets together, they supported us with sponsorship and everything. Like that's not cheap. And I played rugby. Also, my dad was a big type. He volunteered a lot in hockey with the Border Kings, Bandits, minor hockey.
The Hillmond Hitmen. Old Marcy was there the night we won.
Penalty box, right?
That's right. That's right.
Into that, he loved that. He missed that. He kicked himself. Like I think the year after, he didn't go back, and he was kicking himself that he didn't go back. And we were trying to tell him to go back, and I wish he would have. He loved it though. He honestly did. He loved being any part he can be with any team. He just loved it, and that's just who my dad was, and that's why I just want to pay it back. Because the community now, I feel like majority of the community's been behind my back with this walk and everything I've been doing. So that's why I love being, supporting it. We do amazing things when we get together and we rally together. And I know you know this. Like you look in the past for all the stuff we have done as a community, it's pretty impressive. And I just really wish everyone can see all the things we've done in the past. We should come together right now. We really need to come together right now as a community because, things, we're suffering with COVID. And this is more important right now to be together as a community. So that's why I support this community, because it's helped me with my sports. It helped me with my walk. And now that's why I want to keep helping the community out.
Yeah, I agree. We stand on the shoulders of some pretty impressive people that came before us.
Yes.
Final question for you is, I've been asking everybody to share, a story about how, whether it's healthcare or whether it's a doctor, a nurse, it can be funny, it can be personal, just a story, about what healthcare kind of means to you in your lifetime.
Yeah, I have one. I actually like to say a big shout out to Sydney Bodner. Every time I had a concussion or broken bone, she's always been my nurse. So every time I saw her, she started laughing at me. So Sydney, if you're watching, thank you. You saved me a lot. The one time I had this doctor, who's not from Lloyd, by the way, she hated sports. And I had this one doctor, I broke my growth plate in my ankle. And if it wasn't for Sydney, I have no idea what would have happened. She was telling her, no, you got to send this kid, like the Camrose to Edmonton. He needed to get surgery. There's a lot of times, like I broke, you name it, I broke it, and Sydney was my nurse. So that's my story.
Cool. Well, I really appreciate you hopping on, Paul, and all the best with your future endeavors here with raising money for Project Sunrise, and all the best to you.
Thank you, Sean, and it's great to be back on the podcast, and I wish you guys luck. Hope you guys reach your goal.
Oh, give Mikey a go, Mikey, go for me, would you?
Go, Mike. Go, buddy.
Welcome, Mr. Tyson Moorbutter, to the show of LNL Oilfield. First off, thanks for joining me.
Yeah, no, you're welcome.
How are things on your side of the world today?
Oh, they're pretty good. I'm working from home, out of my office at home, so.
The new norm.
Yeah.
Now, you're on to talk a little bit about LNL. You guys have donated to Lloydminster's gift to the health radiothon here, $1,000. So first off, thank you from all of us over here for being a part of it and donating. Can you tell us just maybe a little bit about LNL? You guys got a strong history here in town, over 50 years, founded March 25th, 1970, family-run business. Maybe you could talk a little bit about that.
Yeah, so yeah, we're that one-stop shop in the oil and gas sector for maintenance and construction. We got multiple divisions in the area. We run a 40,000 square foot welding shop in Lloydminster, and we also have another fully functional shop in Marshall that we run insulating and scaffolding out of. And then recently in April this year, we added another division onto our company in Turtleford, Saskatchewan, and it's just a smaller version of what we run out of Lloyd. So
I assume it's been a little interesting here over the last, what are we at, 8-9 months with pandemic going on, how you guys have had to probably change a few things in how you work and how you make safety a priority.
It's been different for sure. I don't think anyone's ever seen something come through the industry like this, and negative oil prices back in April, big swings. It's just, it's definitely a different time right now for sure.
Can you talk maybe briefly, just I think it was your grandfather who started LNL, your dad, and now you. You guys got pretty good, 50 years is that's pretty decent. And to have it run through your entire family, maybe just, maybe some of the lessons learned along the way, having a family-owned business and trying to live up to the legacy of the guys before you?
Yeah, so it's like my grandfather started the business in 1970, and he ran the company till about 1995, and then my father and his brother took over, and they ran the business and then but me and my cousin, we are the third generation to run the business, and we've been running it since 2016. We've always supported the community huge in Lloydminster. We've always been drove on that success, and we've it's been long time coming.
Well, and that's that support, that supporting local, something that LNL has had a strong history of doing. At these times when things are so uncertain, what made you guys, still want to support local, support the infrastructure here? What is it that spoke to you this time, Tyson?
Yeah, the opportunity came along, and we're a really family-oriented business, so our family sat down, we talked about it, and it's just giving back to the community realistically, right? Like the community gives to us so much that we try everywhere to give back, and it's a great opportunity for Lloydminster and for such a great cause, right? Like to give to our health organization in Lloydminster. It needs all the help it can get, I think, right now, and I hopefully every other business in Lloydminster wants to follow suit and donate a bit too. So
cool. Appreciate you sharing. I try and get from everybody a hospital story, good, bad, funny. I'm sure at some point in your life you've had a trip to the hospital. Would you be willing to share something with us?
Yeah, I haven't had myself too much stuff go wrong with me. I've touched wood. I haven't been to the hospital much in my life, but I have a younger brother. He spent a lot of time in the hospital. He got diagnosed with cancer when he was 15 and 18, and he fought through, and he's healthier than ever. And just to see what the healthcare system takes on, there was kids that don't know how to talk all the way to 18-year-old people in those rooms, and yeah, you see a lot, and it definitely anywhere that anyone could help, they definitely need the help. So
I appreciate you joining us, Tyson. I appreciate you sharing the stories, and truly do appreciate you guys helping support today's Radiothon and everything else. And best of luck here in the moving forward. Hopefully 2021 is better for all of us.
Yeah, hopefully it turns around and we can get back to what we used to know as normal. So
that's right. Well, thanks again.
All right. Have a good day.
Hi. How are ya?
Welcome back, folks. Here we sit, LNL, just and then Paul LaBerge, and it just, I don't know. I'm stumbling over words now. It's like I've been doing this for 10 hours. I'm joined now by Candace Willits. So, it's been a while since I've seen you.
I know,
and it's funny that it's just like the door opens, it's like, hey, get in there, slam down on the seat, here you are. So how are you doing?
I'm good. I don't have really any huge complaints. I'm not really working very much right now, but that's okay. More time with my kids.
Well, are you enjoying more time with your kids?
No.
You've been listening to Dr. Jodie Carrington.
No, I enjoy it, but we are the type of people that love to be busy. So this is definitely a learning curve.
Yeah, like a giant learning curve.
Huge.
We've been talking an awful lot today about the mental health of everybody, because obviously, social creatures. We like doing this.
Yes.
We like, I don't know, going to OJ's, going to Three Trees, shout out to Three Trees, somewhere like that for a drink or a beverage and sitting across and having, or, going to a hockey game or the health gala, or the list just goes on.
All of the things. This is typically one of my busiest times of year.
And how's it been going? How have things been going? I assume nobody wants you up close and personal.
Well, not right now. There's nothing going on. And so for me, being a professional makeup artist, if there's nothing going on, then my business is not thriving.
Yeah.
So.
Now, it's going to come back.
Oh, for sure. I'm not worried about that.
And in the meantime, you get to spend time with those kids you love so much.
I love them.
Mama loves you, kids. Now, today, we set a goal of trying to get to $200,000. The last update I gave was what, 189, I think?
Yeah, I've been following along. You guys have been doing really well.
It's like,
yeah.
I keep using the analogy of a bullet train, and you just, like, I'm strapped to the top of it. I'm just holding on. Like, you're interview 61.
Oh, wow.
61.
Yeah, way more than I expected.
Oh, yeah. We're not sitting around just having me gab. Nobody wants to listen to that.
I do.
Well, I appreciate that. Well, through the day, I haven't asked anybody yet. What has been one of the ones that you enjoyed?
I loved Ron McLean.
Really?
Loved that. I loved that one.
Yeah.
I loved that one.
he's well, being coming from Canada's hockey, right?
Mhm.
And going to and at the hospital with the Humboldt bus crash and that.
And we all felt that one.
Yeah.
Right? And
Yeah.
so listening to that, I really, really loved that one.
Yeah. Oh,
Mhm.
fair.
Mhm.
Does it surprise you that I ask a lot of everybody coming in? You're getting me at tired brain, so I
Yeah,
apologize for
it's
that.
okay.
But does it surprise you the Lloydminster community and how it continues to rally around even at the worst of times? You just mentioned that.
Yeah.
It
doesn't surprise me at all. I think that our community is strong, and even the way that I've been supported in community, it shows me, it doesn't surprise me at all. We have a great community.
Now, speaking of you and how you've been kind of interacting on social media, that's where I see you everywhere.
Yeah.
You've been doing some work for the mall and things like that. How are things evolving that way?
I have to admit that my social media career, I guess you could call it,
Yeah.
is starting to thrive. I'm doing way better. I'm busy with that. I'm really, really busy with that. So I'm excited to see where that takes me.
Yeah, you'll be interviewing me soon, or I won't even be allowed on your show soon,
I
right?
don't know about that.
Hey?
Wouldn't that be cool?
I was thinking both graduates of 2004. I don't mean to date you. I'm not worried about dating this guy.
No,
nobody cares.
I'm
but
okay with it.
both graduates of 2004. I bet if we went back to that night,
Mhm.
you wouldn't have been able to talk to us for different reasons.
No.
But did
got
you ever
carried out of
think?
there.
Would you ever have thought we'd be sitting across having you on something like this?
No, really. No, not even a little bit. I didn't even think that when I graduated high school, this wasn't even on my radar. Even having this kind of career. Well, social media wasn't a thing when we graduated
No,
high school.
no.
Facebook came out in 2007, so
Yeah, kids. I wrote down all my friends' numbers on a piece of paper.
seriously.
Yeah.
And even we had the cell phones that had Snake.
That's taking me back.
Right?
Yeah.
So, we didn't have anything like this. So, for this to even be a career path for me and to lead me to, cool opportunities like I'm getting now, it's surreal. So, it's really, really neat for me to, have these kind of things going on. And then to have a really successful career with makeup as well. It's been really, really good.
Well, you're talented.
Thank you.
And people follow talent, I
Mhm.
guess is the way I look at it. And the
Mhm.
word surreal, to steal your word,
Mhm.
is exactly what today is for me. This is pretty surreal. I'm not going
Yeah.
to use the other word. But it's pretty surreal to sit here and have different people, 61 now, and I think we'll be closing in on 70 by the time
Oh,
this is
yeah.
all done.
Yeah.
To come in, sit across, talk about our community, raise money for such a cool thing. I've been asking everybody if they have a story on how healthcare or the hospital or continuing care has impacted their lives. Would you have a story?
Well, I mean, I have tons. I have 3 babies, and so I've obviously had all 3 of them at the Lloydminster Hospital.
How old are your kids?
6, 4, and 2.
Oh, yeah, you're busy.
Mm-hmm. So I have had positive experiences across the board.
6, 4, and 2. Does that mean that your first one was before the renovations and your second one was after the renovations?
What renovations?
In the maternity ward.
I
In
can't
2015,
remember.
they did massive renovations there.
Oh,
You were in too much pain. It doesn't matter. Just
my first baby was a blur. I don't remember.
aren't they all a blur?
Yeah.
Sorry, I interrupted. Carry on.
No,
with
it's
your
okay.
story.
I mean, really. What even happened? I'm not quite sure.
You woke up and there's this beautiful
Yeah.
child looking at you.
It was great. It went really fast. And then actually my son Sully was bit by a dog this summer, and we had to take him to emergency, and they handled it so amazingly. They were really calm with me. They calmed me down, and they touched base with me right after I got a phone call from Population Health, I think it was, because they deal with rabies and stuff like that. Hours after it happened, and they continued to touch base with me, and they were really good, and
That's
Yeah.
oh man, yeah. Your kids being hurt is
Mhm.
like a parent's absolute nightmare. You're welcome to the studio where they
Yeah.
show signs at you. Before I let you out of here, appreciate you sharing. That man is running. I assume, Mikey, you're over 100K. I just assume at this point, but I don't know anymore. He hasn't let me talk to him now in 2 hours. So
No.
I'm just assuming. Everybody calling in is look at him off,
Yeah,
on,
like
running.
I can't
But-
believe how well he's doing.
He'll run by here to go to the bathroom and smile and poke his head in and be like, "Hey, how's everybody?" I'm going back. Like, are you,
He's
you
going
actually?
to be so sore.
Oh yeah, absolutely. He had his physiotherapist in to adjust his back because she saw in the video he was like, "Oh, something ain't right." So she come in, adjusted him, and now he's back running again.
Yeah,
that is
amazing.
a true story.
Yeah, that's crazy. Good for him.
So we need some words for him to keep him going as we start to. Who would have thought about it? We are 2 hours and 21 minutes away from him being done, us being done.
It's a long
So-
time to run.
Absolutely.
Yeah.
But when he's been running for 9 hours and 40 minutes, 2 hours and 20 starts to seem like, that's doable. So
Yeah.
give him some encouragement here to bring him to the home stretch.
Okay, this might date me also. This brings us back to the day.
Oh God.
But, hey, Mikey Dubs. You got this. Was that lame?
No, that was perfect. That was
It brings
perfect.
me back to graduating in 2004. Here we are.
Your kids would be embarrassed,
Yeah,
but
they
I'm
would
not.
be.
I-
Okay.
Thanks, Candace, for
You're
coming in. I
welcome.
appreciate it, and I appreciate your support of the event and everything
Mhm.
else. Please do not try and open that door. Slide.
Okay. Okay.
People keep doing it. Once again, thanks for coming in. I really do
Yes.
appreciate it. Now, carrying on with this, we are waiting on the mayor to pop in. So I'll bring us up to speed. How about I give us a walkthrough of where we're at right now? I'm told $189,000 is where we sit. We're at, with the extra 4 that came in from the challenge, I believe we're at $126.50 per kilometer for Mike, which if you do the math on that, if he hits 100, which, Mike, I'm telling everybody you're at 100, so I don't know. I'm waiting for the thumbs up on that, or I'm not 100% sure where you are. I need to get a phone call in, but the cleaning staff is going to come back in and make things all perfect. I'm kidding. It's Steph. Steph is awesome, and regardless, at 100 Ks at 122 an hour, that's 12 grand. So you can start to understand where my head's going here. But we're going to wait. We're waiting on.
Are you ready? Yeah. Okay. You go ahead, Joe. So if I'm not here right when you're out, right
Look who it is. That's what we get to say?
Yeah.
How's Mayor Jared Albers doing today?
Mayor Gerald's doing great. Thanks for doing this, by the way.
Well, I tell you what, I just get to sit here and I would say look pretty, but I'm told I have a face for radio, so I don't know.
That makes 2 of us, but I ended up getting elected, so I was just lucky.
Well, here's the big announcement. So the goal was $200,000, and we now have $220,000.
And we're
with
not
2
done yet.
hours and 20 minutes to go.
That's awesome.
Isn't that unbelievable?
Absolutely.
And I'm told what we want to do is we wanna increase the goal of today with everybody supporting this thing and pushing it up to 300,000. Why not? Like
What the hell? Move the goalposts and we're going.
We're making the unbelievable believable today.
Absolutely.
So
Absolutely.
you know this very well. This community just impresses me more and more as the minutes and the hours tick by. But at the start of the day with a $200,000 goal, what were your thoughts? And then maybe to add on to that, does it even surprise you that we're here?
Well, we deal with challenges each and every day. It doesn't matter if you're in business, you're at City Hall, residences, and people just trying to cover their ends and make ends meet each and every day. And 200,000 at this time of year is a bit of a stretch. And I appreciate the Health Foundation reaching out for a goal, and you need to set a goal, just as we just talked about. I am blown away. The generosity of this community, time after time after time. And I don't want to mix too many charities, but I had a chance to spend some time at the Red Kettle the other day. And it was just tremendous, the generosity of people at the store helping others and sharing. Because this Christmas is going to be tough for a few people. We know that. Every nonprofit has been feeling it. We're going to be a little short on campers, and people reached into their pockets and gave what they could, from change to bills. And that's incredible. They brought out their credit cards, tapped for a few dollar donation or whatever it was. And it's just incredible. And I look back at different times. I think of the fires in Fort McMurray in particular, when we saw trailers parked in various businesses, a sign that says, I'm going to Fort Mac. Can you support us and help those? This community stood up. And, there's just example after example. And it doesn't surprise me. And let's go, Lloyd. If we can make 300,000, let's hit it. That'd be ideal. If we can't hit it, let's get as close as we can. And we've already broke 200,000. You've demonstrated it can be done.
Yeah, it's moving. It's moving, to be closing in on the 5 o'clock hour. And I talk so much about last year's because when I got approached with the idea, it was after our third child, Casey, being born, and there was delivery was not, shall we say, straightforward on it, and the hospital staff was amazing, and everyone's great. Casey's now over 1 and everything. And so they approached me after, it would have been probably a month or 2 since then, and I was just like, yeah, absolutely. Anything the hospital needs, it's not even a question. And so the first year we did this, it took us, I was pleading with the audience, like, just please reach into your pockets. Let's find a way to make 50,000. And we ended up hitting 54. We found a way. And it was not quite the production, as you get to see here. But when they approached me again and we got to do this, like 200,000, I remember thinking, that's a big number. Like, that is not small change.
That is not small change.
And that's not one company. That is like all the companies of Lloyd. That is all the people of Lloyd, all pulling together. I've had different siblings pitching together. I've had different families make bets. And there it is. See?
Yep.
That's 100K. And tell me, Gerald, when he walks by, are you like, that guy just ran 100K?
No, and you wouldn't get me in that suit just at this time. So I'm in amazement. That's awesome.
So hey, we got 2 breaking things this right now with Gerald Alpers. We're up to $220,000. The goal of today was $200,000. Now let's push it. Let's see where we can get to. We want to try and get to a $300,000 because once again, it all comes back into our community. It helps make the infrastructure, the continuing care, the hospital all better for our residents. And then 2, if you're following along with Mikey Dubs, he just hit 100 kilometers of running on a treadmill in a room by himself listening to this guy. And doing the simple math on what's sitting there right now, that turns into $12,200.
There he is. He's going back at it.
Yeah, it does,
Awesome.
buddy.
Yeah, it does.
How you feeling? How you feeling?
Okay, let's go.
Let's go. Get after it.
Sean, I just wanted to mention, you talked about the community, and I want to really talk about the greater community, because the city of Lloyd is one facet, but the community that surrounds us, the neighbors, the rural neighbors.
Well, you know me. I'm from Hillmont, right? And I say it all the time, Lloydminster and surrounding community, because
absolutely. The region that supports this city
absolutely
and supports the health foundation, because the hospital's sitting here, and it could be sitting anywhere, but it's sitting here. So,
I'm glad you brought that
and
up.
I think it's so important. And the regional, the folks that support the community support the hospital, because they know they're going to turn to the hospital. And, it's so important for all of us. Doesn't matter if you're Hillmont, if you're down in Lone Rock, you're out in Paradise Valley, you're likely coming this way because you know you're going to get the care you deserve. Kit Scotty, that we can just, that circle goes out. We've got people that visit our hospital from Denzel to get services. We've got people coming from way out past Maidstone coming this way. So this is a regional hospital.
Yeah, it's
and
a big area.
I think people need to remember that it services a big area. We have this conversation regularly with the government and the provincial government. That's where I can speak a little bit to that. And bringing that home. But I think people that live here every day see that. Oh, somebody just I hear clapping.
Well, they just announced 100 kilometers, Mikey Dubs. That's what they're talking about. 100% what you're saying, the surrounding area. I couldn't agree more. That and like I say, I'm from Hillmont, and when people ask where you're from, you give them the small town Saskatchewan.
Yep.
There's very few people who know all the small town Saskatchewans, because that's what Saskatchewan's built on.
Right.
And so you associate yourself with the closest big city, which is Lloydminster, and Lloydminster has become home.
Yep.
And the staff and the facility of the hospital and all the continuing care here services that area as well.
Absolutely.
And they do an amazing job. So you bring up a very, very valid point.
You know, and they support, you know, we've got the Maidstone Hospital, we've got the Turtleford Hospital, which are great. We've got the Vermilion Hospital and Wainwright, but there's still a lot of people end up here for MRIs and things like that when the MRI machines here in town. There's just so many pieces to that puzzle, and I didn't know a lot of this until I got elected mayor, and trust me, there's a little learning curve just on healthcare because it is so important to everyone, and it's not a cross-border issue. It is, but it isn't, because at the end of the day, people are looking for health care and looking to help get some services, and whatever those services are, be it that somebody's just recently had a heart attack or a stroke, broke a leg, needs a new knee, the list goes on, including, and I'll leave COVID alone because that's a whole separate subject.
Well, I appreciate you coming in. Now, I hate to put you on the spot. I would have loved to warn you this, but Laura Lee Marin, who you know, donated $5 a kilometer to Mikey's cause, and she challenged the entire city council. She also said she didn't want to hold anybody to the fire because $5 maybe is more than people can afford and everything else. But she did challenge the rest of city council, and including yourself, to make a donation, whether it be to Mikey or to the cause. So I'm going to put you to the fire a little bit. Can I twist your arm into helping the cause along?
You sure can. I was going to make a donation on behalf of my wife and I, but I guess that if Councillor Marin has already stepped up to the plate, I'll hold her to account at the next council meeting. That's no problem. But I'm in for $5 a kilometer too.
$5 a kilometer.
Yep.
I hope you heard that, Mikey. Another $5 a K coming your way, big fella, from the mayor. He's listening. It's a little delayed, but can you give him some words with a little over 2 hours to go? He's at 100 kilometers. Which means if he just pushes it hard, every kilometer he runs is an extra $100, extra $100, extra $100. So any encouragement we can give him.
Well, Mike, this is the Christmas present I wasn't planning on giving as this much, but hey, I'm in for it. And give her, man. Just tear off those running shoes and just keep going, because I know you've got it in you. I saw you here, and you're staying hydrated. Just keep it up, and the community's pulling for you. You've got a lot of people pulling for you, because every kilometer is another $5, and it's going to keep going, and
that's right,
and it's going to keep adding up. And if there's a few more challenges out there that people want to step up to the plate, so be it.
Perfect. Well, thanks for hopping in, Mayor. Appreciate you being a part of this, and that's a pretty cool announcement on a bunch of different things. You hit it at the perfect time.
Well, hey, timing is everything, and I lucked out on this one. So thank you so much for the invitation. Thanks for doing this, Sean. Thank you to the community and the greater community. Thank you to every business and individual that stepped up, because that money has not come easily, and that's hard-earned money by people that are giving it and supporting a great cause. And thank you on behalf of the residents of the city of Lloyd, the staff at the hospital. I can't say enough about the great work they're doing. Thank you for the support, and thanks everybody for coming out and making this such a great event. This is incredible.
Yeah, this is incredible is right. Thanks again.
Thank you.
Now, what I want Mikey Dubs. Is Mikey Dubs going to talk to me? Mikey, headphones. As he just announced walking by me, he hit 100 kilometers. So I want Mikey Dubs. I want to know how 100K feels like in 10 hours. Has it even been 10 hours?
Oh.
Mic check.
Okay, let me get this straight. You hit 100 kilometers.
Yeah, you bet.
Okay, now you got the gangster strut going on. I like it. Okay, how are you feeling at 100 kilometers?
You know what? I'm feeling like surprisingly really well.
Oh. Like, you're kind of freaking me out a little bit, man.
Me too.
So maybe we should have went for the record of what was the record on a treadmill? 150? 154.
Yeah, 154.
Well, I tell you what, man. Just alone with what you've done, the mayor just donated $5. Laura Lee Marin donated $5 per kilometer. So right there, I'm just doing the math. I believe that turns it into like 13,000. Am I right in my math? I think I'm right. You're up to 130 a kilometer every time you run a kilometer.
So I just want to drop a bombshell, because I don't think we've included something. I started a Husky Gives Foundation thing, and everyone at Husky jumped on right away. So then what Husky did is they donated 2 to 1. So if you donated $500, they would donate $1,500. So I don't think it's came in because it was supposed to come later, but it's going to average about $88 a click.
So you're just saying, let me get this straight. We went from, call it 120 a K. Let's go safe. And we just turned it into $200 a K.
Yeah, somewhere in there.
Whew. Okay. Well,
I gotta do
dude,
one
like, what do
shout-out.
you
There
got
were so
for
many-
thoughts? Yeah, not every day I get to talk to a guy who just ran 100 kilometers, and you still got 2 hours to go.
Man, I feel good. I've been like emotional roller coaster. Everybody, whatever they say is just so powerful. Of course, Jodie just blew my hair back from a little bit of hair I got. But just every single person, it's just touching. It feels good. You know what? I'm doing it because I love running, and I'm doing it because it's for a good cause. So it's a win-win.
Hey, that's cool. Now, my question for my own mind, has my voice going to haunt your dreams?
Actually, I think it's keeping me going.
Really?
Weird. I run listening to your podcast all the time, so it's just another day.
Hey, man, that's cool. Okay, well, anything else before I flip over to Braden Holtby?
No, I'm just going to keep going, and we'll see where we get.
Hey, man, I think from this side, it's just cool to look up and see you continuing to push it.
Yeah, thanks, buddy. I'm just going to keep watching you, and I'll check in a little bit.
Sounds good, Mikey. Okay,
All right.
we'll go to Braden Holtby now, the Stanley Cup champ. Well, folks, we're joined now by Stanley Cup champ and current starting goalie. This sounds very odd coming out of my mouth. The Vancouver Canucks, Mr. Braden Holtby. So first off, thanks for joining me.
Yeah, thanks for having me.
How is Vancouver?
It's awesome. It's obviously only spent some time here on the road, but getting to know the city, it's great. I think our family's going to love it here, and good place to play hockey by the sounds of it, and a good team.
Yeah, absolutely. How has been the moving? Yeah, I know I've been. I got to give the viewers a little bit of the background on how much I've probably blown your phone up, and I've been telling people by now. Braden Holtby probably hates me. Like, he probably just is like, this guy won't stop. He's just relentless. So I know you're busy. How has the transition of getting your family and everything? It's not like you're just moving yourself. Like, you got things on the go. How has the move been going? Everybody's probably wondering how you're doing.
Yeah, it's been difficult. There's been some things go wrong along the way, but as you can imagine, move across the continent, across 2 countries in the middle of a pandemic, for the first time doing it there's some challenges along the way. We finally got our stuff here in our place after some delays, but now I think it should be smooth sailing, hopefully, from here on out.
Well, I've been asking the Hartnells of the world and the MacArthurs, like, you guys used to have the Celebrity Golf Classic in Lloyd, the Hartnell, MacArthur, Holtby. And I was saying to the boys, like, I've had 3 kids now in the Lloyd Hospital, and the donation from all the money that you guys raised during those tournaments, and then along with some more money, there was $800,000 of total improvements to the Lloyd maternity ward in the hospital in 2015. So all my kids have been benefactors of that. And I was saying to the guys, it's pretty cool because our 3rd child, there was complications, and we ended up using every upgrade that maternity ward had. So I first just wanted to tip my cap to you guys for coming back and being a part of events like that, because you probably, unbeknownst to you, you don't realize, yeah, we're raising some money, but what's that really doing? I don't know. And then I come along and we end up using it all. And it's a pretty cool thing to be able to share with you, because I directly was impacted by it. Now, from your side, do you remember the golf tournaments? Was there any fun stories you could maybe share, or just the time of coming back to Lloyd and being a part of that golf tournament that ran for a better part of a decade?
Yeah, it It was pretty cool those few years in there. Obviously, myself, I was pretty young at the time, and kind of just had my name attached to it. All the hard work and heavy lifting. Obviously, Scott and Clark did a lot, but it was mainly the organizers and everyone and the volunteers that did all the work that deserved that credit. And the people donating the money too. Is I think that's probably the impressive part was the generosity around town, around the community, to kind of come together to help those things. I think that's probably the main thing that I took away from those tournaments. I mean, I was first couple years in the league, so it pretty neat to meet some of the different guys coming from different teams and those kind of things. And yeah, it was a pretty good experience. Hopefully, and in the future, at some point, we can find a way to do something like that again.
Well, we've been sharing different stories all day, Braden, of how the healthcare system or healthcare workers have maybe impacted your life, and maybe there's a fun story, just maybe your kids being born. I'm not sure, but is there maybe a story you could share, whether it's Lloydminster or whether it's somewhere else in the world, where doctors, nurses, that type of thing, continuing care has impacted your life?
You know, I've been fairly fortunate that it hasn't. The kids have both been healthy, and I think our doctors in Washington that delivered our kids were incredible, and they had a big part in Brandy and our kids being healthy for different reasons. So, but I think that's anyone who goes into that profession, be it nurse or doctor, is their heart's in the right place. It's to help others, and I think that's pretty universal in all the experiences I've had with either or. And so I mean, I so far haven't had any crazy experiences that way, but you can tell every time you deal with someone in that field, you know, that's the main priority, and especially in Canada, Lloydminster no different. That's kind of the way everyone goes about business, is trying to help each other out.
How about playing in Washington? Was there things you guys did? I assume yes, where you tried to, whether it was visiting kids maybe at the hospital or helping families out. Was there anything like that you could share?
Yeah, we would do a team trip every year to the pediatric ward, Georgetown University Hospital, and kind of around Christmas time, try and liven the spirits and everything like that. It's always hard to see people in that position, and especially the parents is tough. I mean, the kids are pretty young in those situations, and I think they're just excited about their, you know, the opportunity for the day, so they bring a lot of energy and that. But you see the kind of the bags under the parents' eyes, and you can see the challenges they've been through, which makes it kind of feel like you're not really worthy to be there, because you can't, you know, really put yourself in their shoes completely. You can say what it's like, to what you think it might be like, but you never know. So being in those situations is tough, and it kind of makes you realize how thankful you are for you know, people, your health, and your family's health. So yeah, I think every team that I've been a part of has done something like that.
Well, I really appreciate you taking a few minutes out of your hectic schedule. Really do truly mean that. I'm going to let you get back to your family and the new house of Vancouver, and just really appreciate you hopping on. Could you do me one favor? Could you tell Mikey, hey man, pick it up. You need to get running a little harder for us.
Hey, come on, Mikey. You need to pick it up. Let's keep going here.
Perfect. Thanks, Braden.
Yeah, you're welcome. Thanks for having me.
So we're back. That was Braden Holtby. If you just missed previous to Braden Holtby, it's been an eventful last half hour, let's say. We are now over the goal. We're at $220,000. So thank you to everyone whether it be companies, whether it be individuals who've continued to donate, as we see along the bottom there. It continues to scroll, and those are not small amounts by any stretch of the imagination. The new goal, as we still have time, is $300,000. And Mikey Dubs just had his victory lap. You can see him. He's eating a banana again, but yeah, he eats all day long, Sarah. You can imagine the calories.
Need to, yeah.
So he has hit 100 kilometers, which is downright impressive, and he's going to keep going right to the end. So we'll see what number he can get to. I was told that I'm not pretty enough for this, so what they did is they went out and they found somebody to compensate for my toothless face. So Sarah Ruka is back on with me, so thanks again for coming on to doll this thing up a little bit.
Happy to come back. I mean, I appreciate that. I think it was more like a convenient supper hour timber turkey sandwich delivery person more than anything, which I'm happy to do. Brought sandwiches.
Well, I can't wait to sink my teeth into one of those. I'm still counting you as a double guest. So we've been doing a running total of how many guests I've had on.
Mm-hmm.
So you're number 63, even
Wow.
though you were 57 and 63 now. So for people who, she won't laugh at me. She's too kind. But I couldn't remember the names. I'm starting to go somewhere in my brain, and I'm struggling to remember, and which is funny because I know exactly who you are, but. Sometimes it's gone. It's gone.
It's been a long day. You're in the home stretch.
So what we're going to do is we're going to force you to talk. Let's talk home hardware, running a business through COVID to start.
Sure. Yeah. I mean, not unlike everyone else, it was completely unexpected. We had no idea what was going on. We didn't know if we were going to be an essential business. We didn't know if we were going to be totally closed. So it was a lot of pressure and quick decisions, fast, and I mean, we have an amazing staff that really pulled together and worked so hard throughout the whole thing. And things are still changing, obviously. I mean, the regulations are changing constantly. Another thing I will say is our community, without a doubt, was very intentionally supporting us, even when it was more difficult for them and they had to make phone in and, complicated processes in the beginning. So we really, really appreciated that. And good things have come of all of this too, of course. Like, it's been difficult on all of us, but I really do think we are all undoubtedly closer as a community. Like, I think we really pulled together. We're kinder. We're more appreciative of the small things and the important things. And I mean, that's carried through this entire thing. So that's good news.
I love hearing the community support and that they're willing to jump through a few hoops for you folks. Like, it just brings me back to what we've been doing all day, right?
Mm-hmm.
Like the support of the community has been downright impressive today. And so it's cool to hear that businesses are seeing that as well.
Yeah, absolutely. I mean, they helped us work out all the kinks of this curbside pickup thing, which was totally new to us, and building an online store quickly was totally new to us. And
how quickly did you build an online store, if you don't mind me asking?
Very quickly.
Like, we talking like days?
I'm talking days. Within days, our staff had because we thought we were going to be closed, so we said we better get everything online. And we closed Timber Cafe, we cleared all the chairs out, they brought racks in and all the product off the floor, and every single staff member was entering product into the online store and combining our brain power, even though we were under stress in so many ways, and trying to come up with
How frustrating was that to figure out?
It was a lot. It was a lot to take on. But like I said, it really brought us all together. So, and we've had some of these staff members I've grown up with. We have people that have been there for 15, 20, 17 years. So we really, truly are like a family, and it felt that way during COVID for sure. And same with customers.
Yeah, I think it was Dr. Jodie Carrington who was a guest earlier, and I loved her. Man, she's a character.
She is a character.
She's a wild card. She said something that stuck with me all day, that perspective is built on experience, and going through something like building an online store sure gives you a perspective on how things have changed and how much work that must have been. Not to mention, I just think the frustration, man. You try and do a couple things on your phone, and you're just like, oh, man.
Yeah.
Now put an entire store on that thing.
Put an entire store on that thing. But like I said, we had the collective brain power of all these amazing staff members working hard to help us figure it out.
Well, the other thing, besides dolling this place up, that they wanted you on to talk a little bit about was healthcare.
Yes.
Healthcare stories, and maybe you could share a little bit about those.
Yeah, I was reflecting on this earlier, talking to my sister, like, what are our healthcare stories? What is our history with the Lloydminster Health Foundation? And obviously I have nieces and nephews, like 7 or 8 now, nieces and nephews born in the local hospital. I also have some somber stories. I was saying, even if you're healthy people tend to take their health for granted, and they don't really think, anything's ever
happen to them.
It can happen to them,
That's right.
And of course, anything could happen at any point. We are all going to be impacted at some point by something. We're all being impacted right now by COVID, of course. But in 2011, and we're all susceptible to emergencies. In 2011, I got attacked by a stranger and required surgery. And I was in a car accident, within months of each other, and had to be taken in an ambulance to the hospital. And so obviously there's a lot of physical trauma and emotional and mental health trauma that goes along with that. And to have the safety and security and support of our healthcare workers and my family doctor and everything through that means the world to me. And on a lighter note, well, actually on another somber note.
I tell you what, on the podcast,
yeah,
that right there is something I want to dig on. I don't want to force you to open up too much.
Sure.
And on top of it, they're already sticking the sign up, right?
Go.
That's the way this thing works.
Yeah, it's quick.
Well, now you got me. Yeah. Did you get it? Just one quick one on the attack. Is that happening in Lloyd?
No, it happened in Edmonton. Yeah.
Okay.
But then I came home to Lloyd.
And got in a car
with
accident.
Injuries. Yeah, I got a car accident. A rollover. Yeah. So it was a difficult, 2011, not a great year. And then this year, during COVID, amidst all of the stuff at work, obviously family-owned business, right as garden center season was starting, my dad was having leg pain and calf pain and whatever. Anyway, long story short, he had to go to the ER at the Lloydminster Hospital and was rushed to Edmonton and had a blood clot surgery and heart surgery. And I mean, the way, I'm going to get emotional, but the way they handled it at the Lloydminster Hospital was just absolutely phenomenal and made us all so grateful. And he's doing great now. So that's one of my healthcare stories.
See you Sunday.
Absolutely. I look forward to it. And also during COVID, I had a nephew that was born in the Lloydminster Hospital. That was in March. None of us could go see him, but we all felt so safe and comfortable, and
knowing they're in great hands,
they
right?
were in great hands.
If there's one place I know extremely well, and everybody's heard this a few times, I'm waiting for the chatty Cathy to start being thrown around. Michelle, my 6 hour looks awfully open. Just slide everybody back. She doesn't like
I'll come
that.
back.
That's
I'll
right.
come back at the end. Yeah, I'll just hang out there.
If there's one place I know extremely well, it is the maternity ward, and I cannot speak highly enough about that spot. So if you're going to be left alone in COVID in any of those wards, the maternity wards, all you nurses out there, hats off to you, because they're the best.
One more quick, funny COVID home hardware story is a good friend of mine actually went into labor during COVID, water broke in home hardware on the timber patio. No. Preterm labor, and that's another. I delivered her Timber Cafe food in the hospital, actually. That's just another funny COVID. Baby's perfect. So.
Awesome. Yeah. Well, I'm happy you could hop back on.
Thanks for having me back.
Well, who knows? Maybe a third time's a charm in the 6 hour or in the 6 o'clock hour. Thanks again, Sarah. And when I say I forgot your name, all that keeps coming to mind, and I have to keep looking at it. This is where my brain is right now. I graduated with your sister, Lori.
Yeah.
And so my brain goes, Lori, no, not Lori. Think about this, Sean. But it's starting to become, it's starting to become a little bit of a work on the old brain right now.
Yeah, I don't blame you. But that's my parents, the same thing. Sarah, Tasha, Lori, David, they can't remember either.
We're all going there someday. Thanks again for hopping back on.
Thanks so much.
Okay, well, if you are just tuning in and are wondering what's been going on all day, it started out with a bang. Husky Energy, $50,000, and some other, I don't even know. I want to say all the big ones, but I don't even know if I can remember all the big ones. There's been so many. It started out with a bang. Premier Scott Moe came in And then since then, it has just been a roller coaster, a freight train. We just keep holding on. And here we are going into 2 hours left, raising over $200,000. And my favorite cleaning lady, Mikey, has just entered the room. Yeah, Brant Wheeler back in, folks. He's been trying to dodge it all day, but we knew we could get him back in. I should have raised some money for this Brant. Hey, that's what we'll do next time. If you want to get Brant on the screen,
Dollars per cleaning.
that's right. Dollars per cleaning. Everyone's favorite, Brant Wheeler. Hey, Cheryl's laughing right
I
now.
was talking to my coworker Steph.
And?
Apparently you treat her quite respectfully when she comes in to clean. And I don't know why I get such a...
You know, if I could tell a short little story at the expense of Brant, we did a fundraiser for Brewman a year ago, and it was an online post an item, right, and whatever, and so the Wheelers, Cheryl Wheeler, donated a purse, and so I put from Brant Wheeler, but didn't tell anybody I put that, and it took him several days to clue into it, and then I got a message saying, "You little bugger." He still owes me for that one too, which makes mental note for me: never let Brant have control of the cameras. Now we are clean back up again. I believe I'm joined by coming in Jeff Kerr. Yeah. Maybe. I should point out right now, folks, it's a double power hour. For the 5 o'clock hour, PSM Lawyers and Red Bicycle Communications have each put in $2,500. Come on in. Come on in. Have each put in $2,500. So your donation is not doubled this time, but tripled. So if you donate $1, it turns into $3. You donate $5, $15, $100, $300, you get the point. So I am now joined by Jeff Kerr and Daryl Howell.
That's right.
Good afternoon. Well, boys, how are things going?
Well, you tell us. It looks like it's been a great afternoon here. We see that we've blown past.
If you just want to grab it and hold it, Daryl, you can do that. You just grab it and carry it. That way, at least they can carry it. Because you're going to want it close so people can hear what you're saying. Sorry, I cut you off.
No, I was just going to say it looks like it's been a great afternoon. We've reached and exceeded our goals, and so that's a tribute to the folks in the community who are donating to this, and to everyone who's worked hard here to make this event possible. So it's an exciting afternoon.
Well, and I want to point out PSM Lawyers here. I just, we get going, and this thing takes on a life of its own, and I feel bad as the guy trying to lead the charge because you get sidetracked on things, but it is right now for people. We've exceeded the $200,000 goal, but we want to continue to push it because we only get one crack at this. And when 7 o'clock comes and Mikey turns off the treadmill and I turn off the screen, that's it. That's all, folks. So as we push harder, right now is a good time because PSM Lawyers and Red Bicycle have each donated $2,500 to make this a power hour, a double power hour. Where I was just saying, if you donate $10. It turns into 30, 100, 300. And let's make this an hour to remember. And first off, I guess, why to PSM was it so important to get involved in?
Well, from our point of view, one, being part of the Lloydminster community, one of the problems you have is that there's an embarrassment of riches as far as good groups to get behind, different people doing exciting things in the community. So when we look at, okay, where can we make a donation, where can we get involved, we try to think of what's something that impacts all the clients that we serve with. So we have some older folks, we have some younger folks, everyone uses healthcare. So when we're having the small talk with people that we're meeting with through the office, healthcare is something which affects everyone. And so one, it has the benefit that we know it's going to touch everyone who's working in our office and the folks that we work for as well. Secondly, we have some history with the foundation. One of our founding partners, Myron Strilchuk, was the president of the Health Foundation in ages past, if you will. And so there is a connection here. So it's exciting for us to continue to be part of this and to support the community in this way.
Now, correct me if I'm wrong, guys. You're the current chair of the Health Foundation Board?
I am the current chair. I have taken over from Daryl.
Okay,
Howell.
and that brings me to Daryl Howell, the past chair.
That's right.
Now, we've talked an awful lot to start with PSM. How's Daryl doing today?
Well, I'm doing great. It's a wonderful day. We're doing better, I think, than we'd hoped, and actually, we're probably approaching the best we ever did at a gala. So this is really a great day for the Health Foundation.
I'm glad you said that. Mikey, if you hear that, we're approaching the best possibly ever they've done. So keep running, dude. He just passed 100 kilometers, guys.
Yeah, amazing.
Right? And at the current, with his, the Husky news and everything, it's like 20 grand.
I'm not sure it's real. It just seems so.
I know.
Yeah.
Right? And the crazy thing is, I'm the guy sitting here and knowing it's real. He'll walk by to go take a pee, and it's like he's skipping still.
Yeah.
Either of you ever ran, I don't know, what's the farthest you've ever ran on a treadmill?
On a treadmill?
Okay, no. We'll go. How far have you ever ran in a day?
Well, let's let Daryl go first so that I can exceed in my answer whatever he says.
Well, it's been a long time since I've run, but I think I did run 20 kilometers once about 30 or 40 years ago, yeah.
And how did the body feel after 20K?
Oh, terrible, yeah.
I laugh, but I understand, right?
It's an amazing achievement, really, yeah.
Yeah, absolutely.
I think the best I've done is maybe 15 kilometers, and it probably took me longer than it took Daryl to run 20. So.
Well, I share the story that it was only like two and a half months ago. Mikey came on the podcast, and he challenged me to do a 5K with him. Yeah, I'm a former athlete. Yeah. We used to do 5K at the start of every season as like a test, fitness test, blah blah blah, and 5K ruined me running beside that guy because I don't think he picked up a brisk walk pace. He didn't sweat. Yeah. Actually, I think he was cold at the end of it. It was crazy. So to see him do it is very cool. Your guys' connection to the Health Foundation, I know it probably doesn't surprise you to see how well this event is doing, but maybe just the importance of the Health Foundation, and we can talk a little bit about that.
Well, I guess in a perfect world, all of our health needs would be taken care of by government funding, but it's far from perfect. So what the Health Foundation does really is a huge contribution to the community. We also have this border thing going on here, and that, to be honest, it hurts us more than it helps us. And the Health Foundation, we would prefer to just be fundraisers, but we quite often get into a bit of an advocate role for the community as well. So I think the Health Foundation is tremendously important to the community.
If I could add something to that too, one viewpoint that I've really taken away being part of the Health Foundation, which you maybe don't always see as the donor or someone who's in the community, but something you really recognize when you're part of the discussions at the board level is just how judicious the board takes its responsibility to spend its donors' dollars well. So when we come to the community, part of why the community has been so great as far as buy-in with what we do is because we are able to present and say, listen, we've listened to stakeholders, we've talked to Saskatchewan Health Authority, we've talked to the folks who are involved in this, dialogued with people in the community. So we feel very good every time we're doing one of these fundraising events that your dollars are going to go somewhere. Unfortunately, sometimes the line between enhancement and providing services may be a bit blurred, but they are going somewhere where we're confident that it will make a difference locally for people who are in the community.
Well, I can just, being involved now in the 12 short months, as Brant Wheeler would say, right? It's been a part of 2 of these now in a year. And it just amazes me what we're able to accomplish when the right people come together, which a lot of them are sitting at the Health Foundation, or the Health Foundation can bring a lot of them together. And on top of that, what we can do is compounded by the people that surround this community. Because when we put on something like this, it is surreal to talk about numbers like 220,000, to have companies donate 50,000, walk in and it's $5,000 checks and $15,000 checks, and it is quite surreal. Mm-hmm. But I assume, in your time, Daryl, you've probably seen that time and time again.
Yeah, it's really been extremely heartwarming. I think I've been on the board about 12 years and was chair for 6. And, you know, we raised a lot of money for a lot of things. The one I'm proudest of, actually, and feel the best about is Project Sunrise. It's faded from view slightly with all the COVID stuff that's going on, but mental health is just such a big thing. It's a hard one to get your arms around because it's not a piece of equipment normally, but the community has just been wonderful in supporting that, and I think it's probably going to be even more important. COVID has put a lot of mental stress on all kinds of people as well, so I feel really good about that one in particular.
Well, Laura Lee Marin comes to mind, and she
Yes.
talked about 8 of 10 people being affected by mental health right now in our community. Like, that's a high percentage. Yeah, it's just enjoy and appreciate working with the foundation and everything that it does. Now, I'm gonna pass over the mic, the speaking to Jeff Kerr. There is a presentation. I'll let you take the reins and do it, and we'll go from there.
Sure. Well, we do want to take this moment. Now, normally we'd be having a gala event this time of year, and we're certainly hoping that next year we're going to have the mother of all celebrations as we go back to normal in the community. But we will have something then, but we also do want to take this moment to acknowledge to Daryl his years of service on the Health Foundation, particularly his leadership as chair. I know stepping into this role, one feels the enormity of the shoes to fill. And I know Daryl has brought such a tremendous background because of everything he's been involved with and his relationships throughout the community. And so we do want to take this time on behalf of the Health Foundation. We have a plaque that we're going to present to Daryl, and again, we certainly hope that sometime soon we'll be able to have a more fitting event where we can bring together some folks that have worked with you, Daryl. And again, on behalf of the Health Foundation and the community by extension, we do want to take this event to acknowledge your years of service. So we can't handshake here, but
No.
I'll provide this to you, and thanks again for all your contributions over the number of years.
Well, thank you very much. Very nice, and I really want to thank Jeff for stepping up. You know, for most of the time that I was chair, I was largely retired, and it's a big commitment. And Jeff, of course, is a partner in the premier law firm, and there's a plug for you
Oh, yeah.
in Lloydminster. And for him to take this on, I really appreciate it. Yeah, I'm about the same age as Myron Strilchuk that you imagined, so I think I was getting close to my best beyond date, so it's great it's great to or best before date, I should say. It's great to have Jeff coming on, and thank you so much for this, Jeff. Appreciate it.
Oh, thank you, Daryl.
It's good to have somebody to pass the torch to, isn't it?
Absolutely, yeah.
Now, before I let you two guys out of here, we still have, you know, I feel the enormity of putting on or talking for 12 hours, but we still have a guy, as you can see on the TV screen, running after 100 kilometers. I've been getting everybody who walks in this room to give him some words of encouragement as he is, you know, an hour and a half away from the finish line. It's coming closer, but reminder that every step he takes, every kilometer he goes, is an additional $200. $200. That's where we've got to today. So if you could give him, guys, just a quick encouragement to keep Mikey running.
Go, Mikey, go.
Your inspiration, Mike, although there are some of us out here that are feeling inadequate because of your accomplishments today, we do appreciate coming here and just being amazing. You know, Kevin Govender was out back, and he had said the world record was 160 or something.
154. And you know what he told me? Mikey told me at the start of the day, no, we're not going to try for it. I haven't trained for this, he said. I haven't trained on a treadmill. But the fact that he's still, like, bouncing around, I bet it's wandering in his mind, like, I wonder if I could have got there at how good I feel.
So he's claiming that he's doing this without training?
Yeah, well, we should. That is a very good point. Very good point.
Yeah,
I should also point out Shar
Knorr.
Thank you. Had stopped in to do some little physio on him to adjust him so that he could keep running.
Wow.
Right. That was back in, like, I don't know, 3 o'clock a couple hours ago. Right. Like, so it's taken a toll on his body. But in saying all that, there he is. trooping on, and we're closing in on the finish line. I got to get an updated total here so I can know where we're at. We're trying to push for 300,000, and I appreciate anyone who's watching, viewing this, listening, donating, companies that are supporting it, just everybody. Huge support from our entire community, and thanks, guys, for stopping in and letting me be a part of an award ceremony, a little passing of the torch. That was pretty cool. So we're going to throw to Corey Cross, followed by Clark MacArthur, two former NHLers from Lloydminster.
Okay.
Joined now by former NHLer Corey Cross, who spent 13 seasons in the NHL playing for Tampa Bay, Toronto, New York, Detroit, Pittsburgh, and, of course, your Edmonton Oilers. So first off, Corey, thanks for hopping on.
It's always good to see you, and always fun to be on. So
Where are you calling in from?
I'm just in my truck. I just dropped the kids off at school, and my dog is waiting in the back very quietly right now. She might start barking, so this is her daily walk. So she's waiting there patiently.
Well, if she's anything like our dogs, they hear the word walk and they're foaming at the mouth, and they know that they know the schedule. So I'm throwing you off. So we'll try and
she might pipe in here.
Well, I appreciate you hopping on. One of the first things I wanted to ask you about, Corey, was I had Scott Hartnell on earlier, and we talked a lot about the Holtby MacArthur Hartnell Celebrity Golf Classic in Lloyd, and he mentioned following your guys' footsteps in the Cross Redden Celebrity Golf Classic. It raised a lot of money for Lloyd. Can we just talk maybe a little bit about that? Some fond memories from your guys' time in Lloyd raising money for the community?
Yeah, well, it was an amazing time. A guy named John Dow did an amazing job those years of organizing the tournament, and all the local guys that would come to the tournament, and it got a name for itself, and everybody that was coming was just having a blast and looking forward to the next year. So every year was easier and easier to get guys to come, and we had Randy Bachman and Tom Cochran come, and those guys, they were just blown away by the whole event, and obviously the local people just supporting it. I mean, I couldn't believe the auction money that was going for some of the items that we had, and it just showed the support that Lloydminster has for their local charities and the things that go around in the city.
Well, and I like to a feather in your guys' cap, and by you guys I mean you and Wade and Scott and Clark and Braden, everybody. Like when I send out the text for this specific event, the Radiothon here, I like to let viewers know that like all you guys like immediately was like, yeah man, like, and that's pretty cool from this side of it, that you guys are so willing to help support what we're doing here. I mean, obviously today all the money's going to the hospital, continuing care, like such vital parts of our community. I mean, why is that important to you? Why were you like, oh yeah, man?
Well, I don't know, the hospital is one of those things I was thinking about. I'm like, everybody starts their life in a hospital and everybody kind of finishes in the hospital. So it's a pretty integral part of the community. It's the pillar of the community, really. And my mom being a nurse, she worked in hospitals when she was younger, and then worked at a clinic in Lloyd for years and years. And so always had a soft spot for that. And whenever we were playing, whatever city we were playing in, we'd always be visiting hospitals and seeing kids, and obviously again, it's just such an integral part of the community. So anytime you can support it, I think that's why the guys are all willing to jump in.
Well, I've been asking for the boys if they got a fun story they can share about maybe or a personal story. It doesn't, I say fun, I always think funny, but I mean, Scotty always does such a good job. He was talking about hitting on the nurse when he has a concussion, right? Like only the way Scott.
There's a shocker.
Well, I'm wondering if you have maybe a memorable moment where a healthcare helped you when maybe you were hurt or what have you. Maybe a time you went in to visit kids in your career. Like I know the NHL partners up with different initiatives so well, but whether it's an injury or maybe just helping out with kids, could you share a story maybe about your time and how it impacted with the healthcare system?
Well, yeah, I mean, I don't relate. I don't think I was in any hospital when I was hurt. Just like I had a lot of injuries, but never had to go to the hospital. But yeah, just seeing sick kids. You know, one of my close neighbors, he had brain cancer. Oh, there goes my dog. He had brain cancer 5 years ago, and you know, it was an integral part of our family and our friends, and now he's completely healed. He's back playing hockey. He's back at school, and he's doing great. And you know, a girl named Kaylee Cousins, who grew up in Elk Point, she had cancer in Edmonton, and or Martin Smith organized me and George Larocque to go and see her and raise her spirits, and now she's doing well. So just great stories like that you know, that relate. So
I appreciate you sharing. I'll let you get to walking your dog, but before I let you do that, I've been twisting everybody's arm on. We got Mikey Dubs running 12 hours. Every kilometer he runs raises a bit more money for today. Would you be willing to donate a dollar amount per kilometer? And after it's all said and done, you know, hopefully he runs 100K, and you can just multiply that by 100 and
is he in Hawaii or what? Where is he running?
he's running on a treadmill like a room and a half behind me by himself, isolated away.
Oh my God. I couldn't run for 10 minutes on a treadmill. That's amazing. That's awesome. You know what? I'll throw in $250. How about that?
Okay. All right. A donation of 250. Well, I really appreciate that. I know we all appreciate that, Corey. I appreciate your time, and just all the best, and stay safe.
Have fun with the Radiothon. It's a great cause.
Thank you.
What do you think, Rezi? What do you think? Hey? No comment.
Have a great day, Corey.
Okay. We'll see you later. See you soon.
We're joined now by former NHLer Clark MacArthur, who spent 11 seasons in the NHL playing for Buffalo, Atlanta, Toronto, and of course the Ottawa Senators. So first off, thanks for joining me today, Clark. It means a lot you hopping back on for this 12-hour gauntlet I'm laying down today.
No problem, Sean. Thanks for having me, buddy.
So how is Florida?
I'm in Rochester now.
You're in Rochester now?
Yeah, my wife, more than me probably, wanted to move back here and try it for a year. Her family lives here, so we're on the test run right now this year. It's not looking like it's gonna last that long though. Yeah.
How's the weather change from Florida to Rochester?
It's good. It's great here for 5 months, and then once the golf cuts out, it gets a little tougher. Just trying to figure out how to fill your days now. So we got another kid on the way though in January. So
hey, congratulations!
Boy. Yeah, thanks. We're having another boy, so that'll keep us busy to get us through the winter, and then hopefully move back to the palm trees.
Back to golfing with Jordan.
Yeah, that'd be good.
Well, I wanted to ask you. You know, I've been sharing this story over and over again today, but you were part of the Hartnell MacArthur Holtby Celebrity Golf Classic here in Lloydminster that raised a ton of money. In a 3-year span, it raised just shy of $400,000, and in 2015, it was a part of an $800,000 improvement to the maternity ward in Lloydminster. And I've been saying how our last child had a little bit of complications, and we used every piece of equipment that went towards. And so, I just wanted to put a feather in your cap for, you know, being a part of those and coming back and supporting Lloydminster. Do you remember anything of those golf tournaments? Could you share a memory or two?
Yeah, I always enjoyed coming there after the season. You know, obviously Scotty was a big name for that, and then we added Holtby a couple years into it. Probably one of the things that stands out is the amount of money people would spend. The oil and gas people, and the amount that they'd put back into the community was impressive. We'd have different players from Toronto or Philly come in, and you know, when you're having a beer after, it was always like, wow, we go to a lot of charity things, and can't believe they just raised $250,000 a night in Lloydminster, Alberta. You know, so that was pretty cool. you know, obviously having the Trailer Park Boys and Tom Cochran and, you know, different things like that were probably stand out the most. You have to give props to Wade Redden and Corey Cross, who got it started. And I used to go as a junior, and it was always such a fun golf tournament. And they were such good professionals and put on a good show. So it was always nice to be able to keep that thing going.
Yeah, it had a long history there. It was like a decade of you know, it started with Cross and Redden, and then it just kind of kept following suit, and it raised a lot of money. It was a big event here in town, and like I say, hats off to you guys for coming back, because, you know, I don't think the Sean Newman Celebrity Golf Classic has the same ring as what you guys bring in. So, you know, playing in the NHL for the career you had, Clark, I've been asking if there's some stories you could share about whether it's visiting hospitals or how healthcare professionals, you know, touched your guys' lives, or maybe how you interacted with it, as today we're raising money for the Lloydminster Hospital and continuing care.
I think, you know, every year at Christmas, we go to the Make-A-Wish Children's Hospitals, and those are tough to deal with. You know, you go in and you, not that you didn't want to be there, but you never, you know, you don't really see kids in that state, and you don't want to see them in that kind of state. You come in with your jersey on, and, you know, they throw a smile on, and they got tubes hooked up to them. And so that was always, I think that meant a lot to a lot of the guys that, you know, those are things you go there and you really interact with the kids. You're not, you know, you do so many charity things, and that kid one really touches home with a lot of players and people. So I think that meant the most to me probably throughout my career. You have to pause this if you want to keep talking about this. I need a little breather here.
No, that's fair, man. I don't think you'd be human if you went into places like that and didn't get touched, and like see, you know, how tough things can get for families and kids and just human beings, right? Like there's some people that are dealing with some pretty tough stuff. So I think it's pretty human to get emotional about such things.
Yeah. So I think especially when you start having your own kids, you know, and you see that they're healthy, and, you know, you thank God for that, and you're fortunate. And, you know, and then you see the kids that, you know, they don't get dealt the same hand, and it just doesn't seem fair. So
I appreciate you sharing, Clark. Before I let you go, I've been twisting a lot of arms today on trying to get some money raised. Obviously, that's what we're doing. I know you've been texting with Hartnell about how much he was putting into this. I was curious. We got Mikey Dubs running 12 hours. Are you interested in donating whatever amount per kilometer and spurring him on to run a little bit more and raise a little bit of money today?
Sure. What was the top dollar then?
Well, so Quick Dick McDick has donated $10. He's the lone individual. He's got the highest bid right now at 10 per K.
Okay. I'll do 11. I'll go up from that.
All right. I love it.
Yeah.
No, I really appreciate that. We all appreciate that over here, and we wish you the best over in Rochester, and stay safe, and look forward to the next time you're back here.
Okay, Sean, have me anytime, buddy. Appreciate it.
Thank you.
Have a good Christmas.
Merry Christmas to you and yours as well. Well, folks, we are cruising along here. We got an hour and, what are we calling that, 16 minutes left. It is the double power hour with PSM Lawyers and Red Bicycle Communications. It's tripling. So if you donate $10 right now, it turns into 30, etc. You kind of get the thing. I got a special lady hopping on here, very short, excited. She's been talking to me on a different thing. I had a text. I got to give a shout out to Justin Agarwal here from the U13 girls hockey team. They're donated $100, and I got Heather Clagus who just. So thanks, Heather. Before I come to you, here's something cool. Okay, so Justin Agarwal texted me and said, just made a $100 donation on behalf of our U13 girls hockey team, the girls' money. If you give a quick shout out to the challenge, the other two U13, they're challenging the other two U13 teams in town to match their $100 donation, and that was the girls that did it themselves, which is pretty cool.
That is pretty cool. Good for them for taking the initiative.
Now, I am joined by Heather Clagus. It's nice to have you in here and not be yelling across the phone. Now I can yell across this at you.
Yeah, stop ignoring my calls. Gee, Sean.
I feel bad. It's like
I'm
it's like-
kidding. I'm kidding.
no, I know, but it's like you call, I miss it. You call again, I miss it. The goat calls, I miss it. I'm like, I don't know what to do with this.
As long as you're treating us equally, then, you know.
That's right. That's right. No preferential treatment here. How's Heather doing?
Good, good. How are you doing? Busy day, hey?
Busy day.
Yeah.
Besides forgetting a couple names where I just can't it's just like it's sitting there, but I can't get the brain.
Right
to
on the
function.
tip of your tongue?
Yeah, absolutely.
Yeah.
Besides that, I mean, it's been a great day. Like over $200,000. Mikey, over 100 kilometers.
That's amazing.
The only thing there'll be a cherry on the top, Mikey, if you're listening, is I made a bet with the brothers at like the 8 o'clock hour.
Mhm.
And I gave him the high. I said 115. And if he closes in on that, I don't have to buy a bottle of scotch for the group. And so
Is that how that works?
that's how that works. And the more he runs, the further he gets away from my oldest brother, Jay, who had a low number. I think Jay's already buying it anyways. So I'm pretty pumped.
So way to go, Mikey.
That's right. Yeah, he's bailing me out is what he's doing. But it's been, I talk about the emotion of what's going on today. And in the beginning, you're wow, I can't believe what has happened in the first hour and a half, and the donations just coming in, and 50,000 being donated, and just the shock of that kind of slowly wears off to the point where we got thousands of dollars being donated every hour, and it's become the normal, which is odd. And I don't mean to say that but it's so high intensity emotion. It's hard to comprehend that in a 12-hour span because it's moving so fast.
And it's just proved once again how incredible this community is.
Well,
I know we've seen it in the past, but a day like this where you can say, okay, we've hit our target. Now let's go higher. And you know the community is still going to come out and support and give $10, give $100. If they can give $1,000, that's what they're going to do. It's just amazing that they rally behind it. Not just the cause, but the people behind it too, like the doctors and the nurses and everybody in the healthcare system that is really going above and beyond. So it's incredible to see that community support.
You asked how I was doing. You, ma'am, put in the longest shift out of any radio host that I talked to today, and now you're here, closing out the day with me. You put in a shift. How are you doing today? Or is this just another day in the park for you?
A day like this is so invigorating and exciting, and as you see people come in with their donations, you just get this energy, and you feel it building, and you want to stay. You want to be a part of it. You want to come down and be like, get me in on this. I love the energy. I love the excitement. You can feel the community rallying, and you just really want to be a part of it.
Now, I now that we're closing in on the 6 o'clock hour and only an hour left, that's hard. It's almost hard to believe because it takes so long to get, as you know, it takes so long to prepare for one of these, and nobody, unless you've been a part of something like this or other events, how much groundwork goes into laying this down. And then it's almost like, boom, it's like Christmas morning as a kid. All of a sudden it's here, and you're so excited, and boom, it's gone again. Have you paid it? I assume you've been watching a little bit. I know you've been busy, so I don't mean to put you on the spot, but I've been curious. Has there been a guest that you've enjoyed?
There have been a number of interesting guests, like, for example, Rosemary Falk. I enjoyed hearing from her. And also when Laura Lee Marin was in, and she brought the information from the Lloydminster Mental
Project
Health
Sunrise.
website. Yes, that website is wonderful. And I really hope that more people take advantage of it being there, because there's so many great resources in it and so many helpful ideas that I'm really glad that she brought that forward, because I hope more people can become aware of it and make use of it. And it's so great that it was built right here.
Well, I put you on the spot because I go, I hope, people have been watching. Obviously they have been. I keep tallying up the number as we go along here, and there's been 66. You're 66. You're the 66th interview today. You're Mario Lemieux.
Yes.
And so there's so many different people to choose from that have impacted today. I started off the day with Paul Zordrager, the VP of Thermal at Husky. And
What a way to start.
What a way to start, right?
Yeah.
That's a way you start an event, 2 minutes in. Yeah, but I mean, the list goes on. Jodie Carrington was a character.
Yes.
And
that's
I know
for sure.
a lot of teachers and women alike know exactly who she is.
Mhm.
And my wife had some choice words for me last night when I was researching and dolling things up. I'm like, all right, well, this is. She's like, you have no idea what you're in for. You're gonna enjoy that. And I tell you what, she was.
You didn't know
colorful.
what you were in for, did
I
you?
didn't. I kind of had an idea, but like, it's a whole different experience when you get to interact with somebody like that. Like that was pretty cool. That supercharged me, and you get to sit across from people all the time. I assume you're identical to me. Every time a new face comes in, it's a little bump of energy. And it's a little bump of energy. So 66, that number is pretty cool because I'm going to close in on 70 here, and I actually didn't think that was going to happen. That's a lot.
And it's always great to talk to different people because
Oh.
you learn something new. You get a different perspective.
My brain almost hurts now on how much information has come through and how many different
Overload?
stories and how it just reaffirms how important the hospital is to this community and continuing care and how much it impacts every single person's life, no matter their walk of life.
I think everybody has been to the hospital at some point, whether it be visiting somebody or needing the services there. And the team at the hospital and the team at other places here in the city, they really do a fantastic job. And I want to mention Pioneer Lodge and House because they have been painting the window there for the different seasons. They painted it for Halloween, and I drove by today. The Christmas decorations are out. They have painted the window with this beautiful winter scene. So it's those little things, too, that are really thoughtful and just show how much people care.
You know, I hadn't really thought about it, and I really hope Pioneer Lodge is tuned in because my Aunt Jeannie is in Pioneer Lodge, and hello to you if you are tuned in. But I should have been giving shout-outs to you folks all day long. Jeez.
You got it in now. That's the main thing.
Yeah, absolutely. I hope they've tuned in, and that is a cool nod to the staff. They're trying to make things, a little positive, a little lighthearted, going with the seasons. I like that.
It certainly has been challenging, so even those little things can provide a huge boost.
Now, a big chunk of this day has been, I honestly can't get over how quiet it is in here. And I don't have people yelling at you. Can tell we're getting into the last hours, and that people can't see this. You can see this. You can see how busy the schedule is, and then it hits you, and everything just falls right off. So now, if
That's
you're
a lot of pressure.
That's right. That's right. Now, I forget where I was going. What was I talking about? Now you've got me. You've got me. I don't know.
Now I've got you on a different train of thought.
The big part of this, it took until hour 11 for that to finally happen, folks, for me to lose my train of thought. A big chunk of this has been Mikey Dubs running, and he's over 100 kilometers. I can't wait to hear what the final number is. What do you think of 100 kilometers on a treadmill and raising probably roughly $20,000 doing that?
I think that is, it's something I can't even wrap my head around. That many kilometers in one day, and he isn't done yet? That I can't wrap my head around, but it is just quite a feat to take on physically, but mentally too, because I'm not a great runner. Every now and then I try to run. But when I do, I know that half of it is mental. Half of it is going, you can do it, Heather. You can do a few more steps, right? So half the battle is mental too. So good for him. That is just, it's a feat.
Now, you guys have been checking in with me all day long. You did a lot of them. You got to listen to me talk right at the start. You can probably see, you can probably hear the excitement and oh, there he's getting tired. What was it about this event that made it a no-brainer for 95.9 to hop on?
It is all about the community and the healthcare team right now because of the year it's been. They really deserve some recognition because these people, they might be your sister, they might be your sister-in-law, maybe they're your mother, but they are everyday heroes because they take care of their family, but then they go to the hospital, they go to work, and they take care of other people, and they have to take all these extra steps because of the year it is, because of COVID-19. And they're willing to do that and still show up every single day and give it their all. So they truly are heroes. So if we can support them, and this is how we do it, then we are just so thrilled to be able to support them in any way. And just to say thank you. Thank you for all the extra work that you're doing and will continue to do, I'm sure.
Yeah, absolutely. Well, I won't hold you up any longer. I've stolen 10, 15 minutes of your day. I appreciate you coming down. I'm not sure where I'm going from this. That's the crazy thing, folks. We've had such a schedule like just pages of like trying to stay
And
on
some
top
big
of it.
names
Top-
like Braden Holpe, Scott Hartnell.
Well, you talk about the hockey side of it.
Yes.
Braden Holpe, new Vancouver Canucks goalie. That
Mhm.
sounds strange to say. Wade Redden called in, donated $11 per kilometer. Match Clark MacArthur, who donated $11 per kilometer. Scott Hartnell called in first thing this morning. Corey Cross from his truck about to walk the dog, and you can just tell it means, for the hockey side of it, first off, it just means so much for those guys to be invited back in, you know, wherever they're at, right? Clark being in Rochester,
Mhm.
Wade and Corey in Kelowna, just those guys being invited back in. Tanner Novlin was another one
Yes.
at LA.
Yeah.
And you could just see the gratitude of like thinking of him and trying to help raise money for our community. Obviously, they grew up here. They understand what a special community is, and to help raise awareness to what's going on today, that was super cool. Other names, though, absolutely. Dr. Jodie Carrington was fun. Ron McLean has been a guy that I've admired since I was a kid, just in his
Yeah.
ability to sit across from somebody and his wealth of knowledge and his ability to communicate. And those two in particular, Rod Peterson, does the Rod Peterson show, former
Mhm.
voice of the Riders, him calling in. I mean, the list, as I go along here, you're absolutely right. There's been some absolute names that have called in, and then just all of our community coming in and supporting this has been great.
We do have a wonderful community, and it's so neat too that you've been able to connect with so many different people through technology. And I also really love how some of this is to help make sure that people who maybe haven't been able to make those connections will be able to get some equipment so that they can make those connections. Because for some people, it's really easy. You just pick up your phone and FaceTime. But other people, they don't have that ability. So if we're able to help make that possible so that they can reach out and reconnect with people, that's so important, especially right now.
Absolutely. I'm going to lay some numbers on. You know, one of the things I wish I could have done better, and I'm a self-critic, right? Like, what can we do better next time, right? And there's been so much support. It's been hard to keep up. And I know we talk about it on this side a little bit when we get a couple of minutes of downtime, which hasn't been a lot. When we do, like, you know, we want to make sure that everybody is recognized. So here's some numbers for you, okay? Pin Page donated 10 grand. Agland donated 15 grand. Lloydminster Co-op donated 5 grand. PV Mart 2,500. Condro Electric 5 grand. Roswell Homes 2,500. Rapex 1,000. Michelle's Charles Gustafson 1,000. Rubtest Family 1,200. Allmore Group 3,000. CNRL donated 16,000. Redhead Equipment donated 1,200. Farm Credit Canada donated 500. Lloyd Mall donated 1,000. Anonymous Medical Professionals donated 2,500, and Fountain Tire matched it at 2,500.
Wow.
McCaw Funeral Home 5,000. Bioclean Disaster Services 2,500. Violet Eyes Optometrist 5 grand. Like, am I like it's enough to, when I say the emotion, I don't know how to deal with it. I can't.
It starts to overwhelm you, doesn't it?
It absolutely
you start
does,
to tear
and
up.
I'm still going.
Yeah.
Right.
Yeah.
Simply Smile donation of 1,000. Wild Rose Pumps 1,000. Skyline Refrigeration 250. Sheepskin Loft. Thank you. 1,400. Can Do 250. Quick Pick Waste Disposal 1,000. LNL 1,000. First Truck Center 1,000. Windsor Plywood 1,000. Knights of Columbus 5,000. PSM Lawyers and Red Bicycle each 2,500. ADR Mediators 5,000. Border City Obstetrics, I hope I'm saying that right, 2,000. And I know off the top of my head that come to mind, Arby's 5 grand. I don't know.
That's a lot of great people, isn't it?
And that's just the businesses.
Yeah.
Look at all the names going across the bottom of the screen.
I've seen them. It's so great.
And you know, one of the things, and I can address this, one of the things we found out along this as we update names is one of the problems we've encountered is there's so many names that we actually have to continue to take names off. So if somebody donated at 7 this morning, they may be going, where's my number? Where am I at? Well, the problem is that we have to continually update it because the system, it's got too many names. So I do all the businesses, but then I should probably sit here and give you the
list of
200,
names?
the 500 names that have donated because it's just, it's unbelievable the amount of people that have reached out and continue to support this.
And that also shows how every dollar counts.
Every dollar.
If you can only donate $1 this year, the Lloydminster Region Health Foundation would greatly appreciate that support.
So, a funny note on that. I'm glad you brought that up. What are we at? We're at 100. So, a lady donated 15 cents. And you go, well, what's 15 cents to Mikey Dubs? Well, at 100K, it's 15 bucks.
Ah.
And if he makes 120, it's 20 bucks.
See, it adds up.
And that started out with 15 cents. Now, I've been told we're at $224,000 in.
Wow.
And what time are we at? We are at 6. I'm getting the update. This is how my days. This is where we've got to. Now they're adding filler. Jason Whiting's coming in here at some point. I've been bugging him all day. He's like, on whether he's going to sit across from me. We'll use it when we need filler. We'll use it when we need filler. Well, I guess we're getting to the point where we need filler.
He just got the call.
Bottom of the totem pole.
May I say that you're both wearing similar shirts too? Did you plan that?
Maybe. Well, I appreciate you hopping on. Really do. Thanks again, and just you do a wonderful job on the radio, and thanks for dealing with this prima donna all day on the phone and getting the word out for what we were doing.
Well, I'm happy to help. And I just wanted to share with you while I was here, there is somebody in our healthcare system here in Lloydminster who looks very similar to me. I have actually been mistaken for her when I go to the grocery store. That's a photo of me standing next to her. Her name is Melissa.
And you know who that is, yes.
Yeah.
Melissa Mann.
Yeah. And
Melissa Wright, sorry. And
That's correct.
And her brothers started out at about 740. So they were on Merv and Morg Mann, who have won Allen Cups here in Lloydminster for the Border Kings. And they started out with a $200 bet. And Morg, you should have taken the under as he took the over. So if Mikey got over 90 kilometers, Morg had to pay the $200, and if he was under 90 kilometers, Merv had. And it was I wish I could bring that back up because it's pretty cool to watch them go 90K, right? Like now we talk about 100 and it's no big deal.
Exactly.
But at the start of the day, 90K, they're going.
That's a big
No,
challenge.
I'll take the under, right? And so Morg is going to eat it. So Morg actually has a 200. And sorry, Melissa Wright,
Yes.
that's cool. Yeah, she took. What they told me in that interview was that their mom was a nurse, and when she retired, Melissa took her stall, her locker.
Wow.
And it's been in the family now for I don't want to date anyone, but 30 years or what have you. Yeah. So it's been a really cool story. That's very cool.
And I can just say that more than once I have been stopped, and the person has said to me, "Thank you so much for taking good care of my dad, my uncle, my relative." And I've said, "I'm sure they receive very great care, but it wasn't me who helped them out." And they're convinced that I am Melissa. So I know that our healthcare team does a great job.
That's a cool story.
Yeah.
Right? You get to see what our, because they're essentially telling you exactly what's going on and how much of an impact. Yeah. And I mean, they're mistaking the person, but it doesn't matter. The message is pretty clear.
The emotion is there. The heartfelt thank you is there. So our team at the healthcare system, they're doing a great job.
Awesome. Well, thanks again for coming in and sticking on with me and lagging it out here for a few extra minutes. I appreciate that.
But Mikey, you're doing a fantastic job. This is the home stretch now. One foot in front of the other. Just keep going. You're going to get there. I can't wait to see just how far he runs.
All I can think of is Dory from I Must Have Kids. Is just keep swimming, just keep
running,
swimming.
just keep running, just keep running.
Thanks for coming in, Heather.
Thanks a lot, John.
You bet. Okay, folks, well, here we go. We are at 6:05. I think they got to wipe down, the chair and get it ready to go. And then they're laughing at my word choice. They've obviously been sitting in this room too long. I got to give a shout out. I plan to do it at the end, but I better remind myself to do it right now. I've teased Brant Wheeler an awful lot through this, and the cleaning staff. They've done it. It's been Brant Wheeler, and now we got Michelle Myers in here and Stephanie Monroe, all coming in, cleaning everything down so that we can have this feel of a podcast and a back and forth. Paul Forges, who's been doing the excellent video work, and Jason Whiting sitting right beside him. The two of them, some of the words, guys, that I've heard today has been seamless. They make it seem seamless to what we're doing on this side. And I can't commend the team around me enough, whether it has been trying to force feed me some food when I forget to think about eating anything. Michelle is always walking by, Randy Noble, just the staff. They've been excellent. Paul Forges and Jason Whiting, again, they've made it seamless. They've made, we've had our hiccups, don't get me wrong, but they've been small in the grand scale or grand scheme of things. And that is not this guy. That is the team working behind the camera, behind the scenes, and they for sure don't get enough love on an event like this because, they make what we do doable. And I am now being thrown a curveball. No, I'm not. Where are you at? Where are you at? Here we go. Come on now. Carrie. No, I don't know how to say your last name. Is it Mace?
Yes.
Good thing. I was about to say Mossy, and I was like,
Yeah,
that
most
doesn't make
people
any
do.
sense. From Pure Vibes. I skipped over you on the schedule.
Pure Revival.
Pure Revival.
Yeah. You've been talking. It's a long day for you.
It is.
Are you
It is.
keeping up with Mike?
I'm trying to, I'm glad you bring up Mike because I'm really, really trying to. What was it, 3 nights ago we set up the treadmill?
Yeah.
Doesn't that seem like a lifetime ago?
Yes, I had no sleep last night, worried that thing wouldn't work for him today.
Well,
But
it's standing up to the test of time right now.
it's slick.
Yeah.
Yeah.
Why, we'll talk about Mikey for a quick second here. When he called and said, hey, I need a treadmill with this up, down, I don't know.
Yes, a decline on it.
Thank you,
Yes.
thank you. I
and
can't-
a cushioning.
Sure. Why is that so important, first off? And then 2, why did you go absolutely?
Well, for one, absolutely, because it's Mike, who's a true friend of mine. He's helped me in my running journey and some things over the last year, so this is the least we could do for him. I felt bad for my husband who got tailgated into this, lifting the treadmill from our basement into the garage just so you guys could come and heave it over here. But secondly, the decline is nice, especially when you're putting on these kind of miles on your legs. To have a little bit of decline go downhill, it's just takes some pressure off the joints. Same with that cushioning, just a little easier on the joints, especially when you're doing this kind of mileage.
When you're doing over 100 kilometers.
Yeah.
Yeah.
And you want a motor that's going to last.
Yeah.
So not all treadmills are built the same.
Well, isn't that on everything in life, right?
Yes.
That's true across anything.
Yes.
I go back to that night. I shout out to Colby Mann, Jordan Schneider, and Scott Yanoda, 3 guys who I called, and we all came over, and we made it, 2 of us could have probably done it. But to have 4 of us there lifting it in, putting it where you guys need it, getting it all set up. At the time, I've been saying this, for probably since he hit 100K and since we hit over $200,000, right?
Crazy.
Crazy.
Yeah.
The words that I've used today, well, I've got a whole bunch of word choice now because everybody's having fun with me with the word unbelievable. So astonishing, right? Like it's crazy to think how far we've come from that night because that wasn't that long ago. We set it up, and we're like, yep, this will be interesting. Yep, sure. And here we are. He's still running. He can hear us. He's crushing it out. He's helping me out with a bet with the brothers. He's getting me closer to 115, which is perfect. What is it about this Lloyd community that is just so special? You get to see it. We're all seeing it right now. But maybe we could talk a little bit about that for 2 minutes.
Absolutely. I know I'm involved with the Lloydminster Runners and getting some of those programs out there in the community. And I can speak only on the running part of it. And I can't believe in the last 3 years, I honestly thought I was the only runner in town. And
Wow.
in the last 3 years, with Lloydminster runners. We built up a community of Coach to 5K people coming out.
Which is such I commend that program because I think it's such a cool idea because all of us, I've heard it today, probably, I think you're 67. I got to update this, 67. And out of the 67, there's probably been 30 of them say, man, I don't even know if I could run 3K, right? And that's what the sorry, I can't even spit it out now, is all about.
Yeah, the Coach to 5K.
Thank you.
Well, it just brought a community of people together to help support one another, no matter if you're a runner like Mikey, who's crushing miles left and right, or if you're a runner who isn't sure you even want to run, but you want to do it safely, maybe get some education in doing it, because a lot of people hurt themselves in the first few kilometers of running and then drop off the wagon and don't want to run anymore. So that's what that community is about. And since that community is built up, oh my goodness, well, I ended up doing a race earlier this spring in March, and I was supposed to be in Boston and feeling that environment at the Boston Marathon. That didn't happen for me because of COVID. And man, coming out in Lloydminster, ran from Kitscotty to Lloydminster. By the time I hit Lloydminster, I had 14K to burn. Mike was my pace bunny. He led the way. He pushed all the crosswalk lights for me and was stopping traffic for me to cross. And I could not believe the number of people that came out and sat along the courseway and cheering me on. The people that were spread throughout Bud Miller, were spread throughout Messam Lake area, were spread throughout 36th Street. There were people driving out of town and stopping kind of south of the airport. They created the Scream Tunnel for me. It just brought me to tears. I could have not had that experience in Boston. It was amazing, and it was some people I had no clue who they were, and others, they're part of our running community, and I've known them for a few years at least. But
there's been a lot of negative things that have come with COVID. I don't think anybody can argue that. But there's been some beautiful things, and that's one of the things you just talked about. I mean, this event, maybe this would have happened the exact same way. I have no idea. But chances are we wouldn't have thought like this. We wouldn't have had, the idea thrown to do something like this. And now look at it. It has become just a force of its own today. And I think everyone in Lloyd, all businesses, all people who donated, people who just tuned in, people who continue to send Mikey messages, people who continue to blow up my phone about, the word unbelievable. I think it's, I don't get me wrong. I wish I wasn't saying unbelievable that much. But it's cool to know people are paying attention to what's going on today. And then on top of that, just speaking with their checkbook today, it has been unbelievable. And I know as a business, you understand that this has been, a difficult time. And maybe we could just chat briefly about running a business through the middle of a pandemic.
Yeah, we were shut down for 2 months in the spring, had a busy clinic, successful clinic, and with no control, swiped right out of my hands, thinking, is this even going to be worth anything? Are my people going to be able to go back to work? We had no idea when we'd go back to work. And then even to just a couple days ago with the Alberta making their announcement and shutting down massage therapy had us fearful again. We were a little more confident on the Saskatchewan side of things, and oh, am I glad we're working today. And another positive thing out of COVID, it sure makes us appreciate our work environments, our, the smaller things in life. So, yeah, we're very thankful we get to work today, and we know that can turn around tomorrow. So, yeah.
Before I let you go, I have two things. One is if you want to share a health care or somebody how the hospital, doctors, nurses, etc., has impacted your life. And then, before I kick you out of here, we, of course, have to encourage Mikey to keep going because I just keep thinking every K is an extra $200. Every K is an extra $200, and it's amazing what he's doing, and I just don't want him to stop just yet, Mike. So
we're officially in the last hour here.
Yeah, we're closing in on it. So if you have a quick story about I won't hold you to the time. We have as much time as we need, even though they're waving signs at us. But in saying that, if you have something that you want to share about healthcare, by all means.
Yeah, certainly. I have my grandparents all living. They're in their mid-90s, and I have my 2 grandmothers in a long-term care facility. It's been really hard on them. This spring I was able to go visit, but it was through the window, and we talked on the phone through the window. My one grandma just couldn't understand it. And then later on in the summer, I got approval to go and do an outdoor gazebo conversation with them, fully masked. They couldn't hear, they weren't understanding who was talking, it was very confusing for them. That was a difficult visit, just that environment. So I've taken advantage of FaceTiming more so. I'm loving that option. They've actually caught on to it now. They kind of figure out that they don't have to pick up the phone to talk to me over FaceTime. So to see iPads in those facilities and the support within the facilities, we used to have family that would go in and take care of their everyday needs, such as combing their hair and clipping their fingernails and such. Well, we don't have those family members going in anymore. It's all on the staff. So I love seeing that the Health Foundation is seeing that the long-term care needs a little focus, especially through these times. My heart goes out to that area for sure.
Before I let you go, Mikey Dubs, still running it, still giving it. If you got a few words for him to push him on to the finish line, I know he'd appreciate it.
Well, let me get my pom-pom out. Come on, Mike, you got it. Let's go, buddy.
It's a little delayed, so he's probably going to see it here.
He'll get it.
And then we overlooking, smiling. I know he...
There he goes.
He enjoys the little things. He'll come by me when he's on his way to a pee, and he enjoys all the little messages, right? I can imagine as a guy who's going through what he's going through probably in his body right now, every little bit helps.
Well, one thing I want to share with Mike, something my grandmothers probably would tell him, is when you feel those aches and pains, disown your body. Those aren't your legs, Mike. Those aren't your legs right now. Disown them. You got young, spunky legs. They're vibrant, they're youthful, they're bouncy. Those are your legs, not these ones right now.
Awesome. Well, thanks again for hopping in.
Thank you, Sean.
Okay, well, that is Carrie Mace from Pure Revival. Got to get that right on the second go-around, don't I? We got a few more guests coming in here in the next, what are we at, 40 minutes, folks? We're a quarter after 6, so we got a few more people rolling through here. I want to remind everybody, we got till 7 o'clock. Excuse me. We got till 7 o'clock. Let's push this thing as hard as we can go. I know we hit 200, but it's all staying in our community. Let's hit 300. The last update I had was 224, I think. Let's get as close to we can. Let's try and hit 250. And let's just keep pushing the pace here. Mikey appreciates your support. I certainly appreciate it. I love seeing all the names just continue to scroll across the bottom. My team, Michelle Myers, right now cleaning everything up, making it seamless on this end. Yes, as I sit here and do nothing. I always love this shot. You know, Brad gets all embarrassed about this shot. This shot shows me sitting here doing nothing. You're doing an amazing job, Michelle.
Thank you.
You know, and she probably doesn't get enough credit. I've been harassing her all day long. We are now going to be joined by Jill Kelly,
Hi.
Red Bicycle. How you doing?
Good, how are you?
Fantastic.
Thanks for having me.
Yeah, absolutely. Well, what can you tell me today?
Okay, I've been watching this all day, on and off. And I just want to say, Sarah came in here, Sarah Rucka from Home Hardware, did a fantastic job. Came in here and told the story about how there was a person whose water broke at Timber Cafe, and I
Yes.
remember thinking, oh my gosh, that's so funny. And then how she delivered food, and I was like, oh yeah, and I was kind of cooking at the same time, and I think, wait a second, that's
was
me.
you?
That was me. I'm the
Oh,
one.
speaking
who,
of Home Hardware, sorry to cut that off. They just donated $5,000.
Yeah, they're trying to smite my spot here.
Wow.
Yeah, that's awesome. They do good, those guys.
Wow. Let's not downplay Red Bicycle's donation to this. You had the $2,500 power hour. You know, once
Yeah.
upon a time, we were updating everything. And as you've seen this thing go along,
Yeah, how far we've come, hey? You've done good. From a little iPad to this whole production.
well, this whole production isn't me. This whole production is all them. I'm just sitting here doing what I
Here's
always
the
do.
face. Just make it look good.
Well, I appreciate you saying that. I'm not so sure if that's the truth. I appreciate you humoring me on that, but
Yeah. Well, it might be nice if you could get a cap or something, but
I
hey,
know.
you do you.
Everybody seems to be worried. I wish Paul could just zoom in and show my toothless smile.
It's a big smile.
Yeah,
You
I
can
gotta
see
be
it.
honest, folks. I'm not concerned about it. Other people are concerned about it. I could give two craps. If Jodie Carrington was on, we'd use a different word. But
I
I'm
saw
not
that
too worried
one.
about it. I'm not too worried about it. No, it's been a fun day. I know it feels like I'm probably starting to sound like I'm wrapping up. I mean, we got 40 minutes to go. I want to keep pushing the pace.
Yeah.
And that's why you're here to bring some energy, Jill. So let's talk a little bit about why Red Bicycle hops on board with these events, and not only these events, but just our community, and how they support these.
Oh, it's a no-brainer. Like to be a part of something of this magnitude for something that like healthcare that impacts everybody, literally everybody. Whether you have a broken arm, you have a delivery, you've gotten a wreck, you know somebody who has, like it impacts everybody. So to be a part of healthcare in such a way like this, it's a no-brainer. Of course, we're going to be a part of it.
Yeah. How was now that my brain is
kicking back
lagging.
in?
It's lagging. So now it's coming like through that. I feel like when Sarah Rurik is talking about you, and you're like, oh, that's interesting. And the brain just is slowly comprehending what's been said to me.
Yeah.
So your water broke in Home Hardware, and then you rushed off to have
Dean.
Dean.
Yeah, my 6-month-old baby boy. Yeah, so actually I was pulling up for a coffee date with Sarah at Timber Cafe. Pulling up, and I was so pregnant, but I wasn't. I was 4 weeks early delivering Dean, so that's quite a lot of time. So
Yes.
I pulled up, parked, and I got out of the vehicle, and I was like, did I just pee my pants? It's not, like, labor never even clued into me because I was 4 weeks away. So I was like, oh my God, this is so embarrassing. I peed my pants. So I went in, because I didn't want to just not show up to my date, went in to Timber Cafe, which in retrospect probably should have just texted her, and said, look, I'll be right back. I just have to use your washroom really quickly. And she's like, yeah, okay, sure. So I go to use the washroom and check, and I was like, is this pee? Or no, it wasn't pee. So I was like, okay. So then I went to her, and I was like, and she's on the phone. I said, oh, just take your time. Just wait here. I'm just waiting politely. And then I was like, I have to go. And then she just wrapped up, and I was like, I'm so sorry. I don't mean to be rude. I have to leave. I'm cutting our little coffee date short. I'm so sorry. And she's like, oh, yeah, okay. Is everything okay? I'm like, yeah, no, fine. I think I'm in labor. And she's like, what? So, yeah, I strategically walked out of there, not going on the sidewalk at all. I'm sure all their employees were looking at me being like, is she trying to steal something? Because I was just walking so funny. And I was trying to walk on the grass the whole time. And then when I was on the sidewalk and the pavement, I kept looking back to see if I was like leaving a trail. I wasn't. It was fine. But it was more in my head. And yeah, so then Sarah kindly came to the hospital. It was COVID, so she could only go in so far. And gave my husband and I some treats because we, again, having a baby 4 weeks early, had some complications. Dean's lungs weren't fully developed, that kind of stuff. He's fine now. Had a little bit of jaundice. And so during the peak of COVID where they're like, yeah, you're in and out 24 hours, like, let's get you going. We were there for 4.5 days. So the hospital staff was unreal, and any chance that we have to give back, like, why wouldn't you? So it's a no-brainer.
Well, you speak to my heart. That's a great.
Mm-hmm.
I mean, it's comical to look at now. I'm sure it was not comical then. I love how you waited for her to get off the phone, and you just weren't like, it's probably time to go. I'm having a baby, right? Like, I mean.
Well, it was my second one. So I was like, usually it takes a little bit longer. Like with Lauren, my water broke and I had to be induced. But Dean came much faster, I always hear the second one or third one goes a little bit faster, so I should have known, but I didn't. I didn't clue in.
You want a funny story about our first?
Yeah, always.
Okay, so my wife, Melissa, shout out to Melissa. She probably did not tune into much of this because she's probably annoyed at me talking this much. But on our first, I was working out towards Elk Point, and she called me. And I forget how many weeks early we were. We were a couple weeks early, so we were, we were starting to get within range, but not. Shay was premature, and she called me, and she kept losing her breath, and I'm like, "Honey, you okay?" She, yeah, I'm just having Braxton Hicks or whatever, and I'm like, "Are you sure? Like, you sure you don't want me to turn around?" This is at like 8 a.m. No, I'm. And then she'd lose it again, and I'm like, "Are you sure? Like, just." And it's your first. I don't know. She's telling me she's okay. She's waiting on the phone and not saying what's really going on, right? So then she calls me at noon. She still hadn't gone into town. And we're out on the farm at this time.
Yeah.
And she calls me. I think the baby's coming. I'm going to drive myself into town. And I'm like yelling at the phone. And Deidre Mann can laugh at this. I called Deidre and I was like, listen, Mel is having a child right now. I need you to drive out and get her because I think she's going to try driving to town. And if she does that, I'm worried she's going to swerve into the ditch and all these things. So shout out to Deidre Mann. I almost missed the birth of our first child because I was out in La La Land because I was like, oh yeah, she's fine, just Braxton Hicks, not a big deal, duh. And ended up getting there, and the hospital staff, once again, the maternity ward.
They're unreal.
Unbelievable.
Yeah.
Unbelievable.
If I'm, I don't know, for whatever reason, not in this community when I have my next kid, I will be driving back to have my baby here. I mean, don't get me wrong, I'm not leaving. I love Lloyd. It's such an amazing thing where we can all come together like this and just, especially in times where it's so challenging, people are trying to not only compete against the giants of the corporation world, like the Amazons, etc.
Yep.
But now we're competing when we're being told to move on, being told to move online, being told to stay at home, and now we're still trying to shop local more and support our community and at the same time healthcare.
Yeah.
Yeah.
Well, and that's what's so moving about today.
Mm-hmm.
Like I've been saying, I don't know, I might have a good cry after all this is done, and I mean that in like the most positive sense. It's just like
it's a release.
Yeah, it's a release.
Mm-hmm.
I've been those make me chuckle,
yeah.
Like that.
Got your face on it 2 minutes.
I like when they get, you're in trouble when they get to Chatty Cathy stage.
Yeah.
Right? That one.
See, yeah, we got it now.
Yeah, that's right. But it has just been overwhelming. I think is maybe my new word here as we charge towards the 7 o'clock hour. I'm sure Mikey would probably. I mean, he's overwhelmed for different reasons. He's continuing to run, but the amount of support this today has received, and the amount of texts coming in, you see the phone lighting up. It just doesn't stop. And Mikey, all these different messages. It's really, really moving to be a part of.
Oh,
and you coming in and talking and sitting across me, it's a lot of fun. Now, before I get anywhere else, he's got about 30 minutes to go. So I need.
Oh, he's going to keep going though. Like just because this is done doesn't mean Mikey's done.
Oh.
Right?
I don't know, Mikey.
Right, Mike? You're staying.
Well, I don't know. Mikey's delayed, so he's going to hear that, and we'll wait and see if he turns and hears it or not.
Wait and see if he falls off the treadmill, just being like, "No way, I'm done."
Well, a funny thing is not a funny thing. A joke we had running early was, what happens if while he's on screen like this, he flies off and smacks the wall? He's like, "Well, I get up and I keep running," and I'm like,
"You got to keep."
I guess
those
that'll be
kilometers
comedic
going.
relief. Yeah. Well, the cool thing is that hasn't happened. He's over 100K. We've specifically not talked. I plan on talking to him right before the end of this because I want to kind of be surprised because we left. He hit 100 a while back.
Yeah.
So I'm curious where he gets to.
Sorry, for the people who are trying to get us off air. But before I go, I have to tell you, my husband and Mikey worked together at Bar Engineering a couple years back here, and Ron was watching at home, and he goes, why is Mike running? And I was like, man, this guy is raising so much money from just even $1 a kilometer. Like, it's ridiculous. And Ron goes, well, how many kilometers is he at? And I said, oh, I'm sure it's over 100 now. And he goes, well, I'll donate to that. So he goes, well, I'll give him $1. And I said, oh, $1? That's it? And I was like, fine, $2. So, Mike, you keep it going, because Ron's going to get you $2 every K you're going. So there's hopefully another little motivator for you to run overnight, too.
Sounds good. Well, thanks for hopping on here, and
thanks for having
everything
me.
you do, and just sharing your story, and really cool to sit across from you.
Yeah, you too. We'll keep in touch, I'm sure. And Sarah, just so you know, I fully expect that Dean gets a job for life at Home Hardware, because, I mean, he was pretty well born there. So, thanks, guys.
Thank you. Well, we'll have the staff back in to clean it one more time. We got, well, a couple more times. Who am I kidding? I got Jason Whiting coming up. He's been one of the men behind the camera. I'd like to throw out to the two boys back there. We should get Paul on too, just to talk a little bit about running some of the stuff. I know, and that I'm trying to speed it up. These show 10-minute spots. We're going to tighten it up, because I think we would like to. Time is against us, folks. Time is against us. Keep donating. Mikey's running. Keep donating. Brad?
Bradley. He's our fundraising chairperson on the foundation board.
Oh, come on. New schedule coming at me. All right, Brad Lake. Man, well, I guess we'll do our best to get everybody on. That's what we're going to do. That's what we're here for. So, Mr. Brad Lake, I'm joined by how's Brad doing? I could use a good dad right now.
You could.
Yeah,
there you go.
Absolutely.
There you go. So, no, what you guys have done today is absolutely fabulous. It is amazing. So,
well, you are on the board?
I am the fundraising chairman.
Okay.
So, yep.
So, when you first got pitched this idea, were you like, oh, yeah, that'll work? Or what were your thoughts on what we were about to pull off?
Well, I'm even still shocked last year, because I hate to date myself. I didn't even know what Facebook Live was. I didn't know how you could pull off a radiothon not on a radio, Sean. So even last year, the 54,000 was still miraculous. So then this year, when they're going 200,000, I'm going, okay, well, sure, why not? 2020 has been such a
haven't you heard
great
that?
year.
It's 300,000, folks. There's 250. I don't know what we're at. We're at 224 a while back. So keep pushing. I want 250. 200 is a thing of the past. We want 250.
So, have you ever taken auctioneering? Because, man, oh man, right there, you're taking bids just like that. You're calling out bids. I love it.
Have you ever, the auctioneers put me to shame. They are a talented bunch.
Well, you know what?
Hey, Travis Bygroves know what I'm talking about.
He does.
Yeah.
He does. So,
Yeah.
so no, Sean, I just, as from the board, I wanted to come on and just to thank you for taking this time, doing all the prep work of all the interviews and getting everybody lined up. You've said it before. People that have been on here said it before. Lloydminster and surrounding area are unbelievable.
There you go for the drinkers. I haven't said it in a while if they're still playing.
It's every time an event goes on in Lloydminster, I don't care if it's gala, I don't care if it is 4-H, I don't care if it's Big Brothers, Big Sisters. Lloydminster and surrounding area come through time and time again. Today is no different, and obviously we know what 2020 has done to all our families and all our frontline workers. So to be able to put an event on like this, you get a guy like Mikey Dubs, amazing what he's able to do. You look at what you and your support team have done today for 12 full hours. But we shouldn't be surprised with Lloydminster and surrounding area putting up that kind of numbers. It's
No,
amazing.
We probably shouldn't be, but it still astounds me.
You know, it's amazing when you have this kind of support, and the healthcare workers in this community, they're not very many of them. You know, when you think about the surrounding areas that we cover and how much, you know, we have a catchment area of about 75,000 that utilize our health systems. So with our frontline workers and the people behind the scenes and the people at the long-term care facilities and heck, you know, the people that are cleaning the parking lots for the ambulance to get to and from, you know, it's amazing what they do every day.
It's a team effort. I think I steal Jodie Carrington. I mean, I'm stealing a lot of Dr. Jodie Carrington words today. Be better together.
Absolutely.
I have a note here. You're the manager of Agland.
I am the service manager there. Yes.
Okay. Well, maybe you can speak a little bit. I mean, Agland put up a hefty chunk of dough today. $15,000.
That was early this morning. Yep. I think you interviewed Cam K.
I did.
Yes. So.
But just wearing the same hat, your thoughts on that, on working there and that coming from that side of things.
Yeah. I've been an employee of Agland for 22 years.
22 years.
And same thing, they have definitely been a pillar in the community. They try to, you know, obviously we cover a large area with our farming, our agriculture, our oil field, our residential areas. You know, we try to do what we can to keep the farmers going, but at the same time, we like to give back when we can. Many businesses get touched and hit up on donations. Agland and their ownership group has definitely put the Health Foundation in the forefront for the simple fact every one of their employees, every one of their employees' families, every one of their customers can benefit from good local health care. So that's why it was an easy thing for them to donate today, knowing that it is going to be going to the community, and everybody they serve and every employee they have will benefit from the hospital and surrounding area.
Yeah, it's really cool.
Yeah.
I appreciate you hopping on. Before I let you go, the dude's still running. He's over 100K. A few words for him here as we close in on 7 o'clock to keep him moving.
It is unbelievable what one little person can do for a community, put a community together, put them on the map. Now, I have, since the last Radiothon, there's one thing I've done. I have listened to every one of your podcasts.
Every one of them?
I have. I just made it my note down. I got to know more about our local community. So right now, Larry Saunders, I'm just at that point, but I did listen to Mikey Dubs, and Mikey Dubs, I don't want to screw it up. He's got a saying, and you got to help me out. His catchphrase is like, don't quit, or why not today, or there's
oh man.
And I've been thinking about it. And
Mikey, I'm stumbling here. What is Mikey's catchphrase? No excuses.
No excuses.
Sorry,
right
Mike. I apologize, Mike. He's gonna tune into that. I should know that.
So
that shows where my brain's at.
I hate to tell him this, but no excuses, and everybody in Lloydminster
You hearing that,
can
Mike?
learn from him.
No excuses.
No
with 20
excuses.
minutes to go, buddy. Get moving.
He would be so upset with himself if he doesn't pull through on this.
That's awesome. You realize you're the first person to come on here and use his own slogan, for him, against him, whatever we want to
It's
say.
for him. It is
for him.
no, you know, and I've seen, since your podcast, I've seen his posts of the icicles coming
Yeah.
off his chin and his beard. He's basically in the Sahara Desert right now. He is running so hot, you know.
That's awesome. I appreciate you saying that to him. That's got to get him going. That gets me going. No excuses.
No excuses.
Awesome.
So-
Thank you, Brad, for hopping on and doing this. And Merry Christmas. Happy New Year.
Merry
happy
Christmas
holidays.
to you as well, and thank you very much, everybody that has been involved in today, from people organizing to people donating. And there's still time. There's still time. To,
Yeah,
you know,
absolutely. There's still time, and the staff is still going hard.
Yeah.
You know, we talk about how much we shine a light on myself and Mikey,
Yeah.
specifically because we're in front of the camera, but the guys behind.
So
the
how about we
staff
do one
taking
thing?
Numbers.
You've got donations going per kilometer for Mikey.
You betcha.
I'm gonna go out $1 for every person you interview today, and a challenge goes out to everybody for the next 20 minutes to throw it out there. A dollar for everybody you've interviewed today.
You're saying you want to don't, just so I got this clear. I'm like closing in on 70 people.
Perfect. $1 a person that you've interviewed. So $70, I'll donate. Make sure everybody else.
Well, that means let's get them rolling.
Come on, let's roll.
All right, I got to kick you out.
I'm out the
I
door.
want 71. I want Jason Whiting in here as quick as we can go.
Take
Thanks,
care.
Brad. So now, you've heard it. I guess the number of people I've had roll through here is now going to raise some money. That's pretty cool. No excuses, baby. That's awesome that it took until 6:41 by my clock that somebody used no excuses on Mikey Dubs. If you don't know what the heck we're talking about, on social media, that is Mikey's thing. Every time he's running, it's no excuses, right? Just ran a cool 18K. I'm out here getting after it. What do you think, Jason? No excuses.
None whatsoever. It is absolutely amazing what he is doing, and I'm just so, this whole day has been just fun to see it. I won't lie, I did step away for a little bit, but I am back to see this final few hours of this thing, and just from start to finish, it has been just an awesome day, and I just, congrats to yourself for getting so close to the finish line here. We're almost there, and Mikey for all that he's doing back there on that treadmill, and this whole team. It's just been absolutely amazing.
You were here the first night when we, about a week ago, I think it was, when we kind of did like the walkthrough.
A little dress rehearsal.
And I know we could all kind of feel like what it was going to be.
There's my man, Mikey, right there.
Me and my wife love that man. Captured our moment. Love him. Just saying it real quick.
So many different things we can talk about, and one of them is probably just the simple fact that Mikey is such a lovable guy that you can't help but just love the guy. And when he asks, hey, or when you hear that he's going to be doing something like this, and your first instinct is just to step up and just help in whatever way. I have been around that guy for a long time. I have been, I feel like I'm his official photographer. When he's out, when he needs a photo for something that he's some run that he's doing, or this event, or it's his wedding. I'm there and just love being around him and all that. So just have to give a little pump of his tires this last little leg here. Mikey, you're awesome. Keep up the good work.
Yeah, that's cool. A thing coming up that we should talk about quickly is the Parade of Lights. Kurt Price was down here earlier. That's something going on that'll be really cool for our community. Maybe we could talk about that just briefly.
That's a good one to talk about, yes.
Just so people know.
Thursday, Parade of Lights is in Lloydminster. It is going to look a little bit different than any other years. It's not actually a parade, but you will parade yourself around all the floats and all the lights and the sounds of the Parade of Lights. Just a little bit different, but it's the intent is still the same. Provide this amazing opportunity for our community by going and checking it out. And at the same time, hey, maybe drop a donation, provide a little something to the Regional Health Foundation. Any of the funds goes to the Regional Health Foundation through that Parade of Lights as well. And so if you can't make it down, or maybe it will be cold on Thursday, you have the opportunity to watch it live through Facebook with myself and Kurt Price, bringing it to you live, and we'll be there. We're only doing an hour though, and that's it. So none of this 12 hours stuff. And but hey, we will be outside, so we will have to dress up.
No, that's cool. I think I've talked about this a lot. I feel like I'm rehashing the same thing, but it's anytime you can do good things for Lloyd, and especially we've talked a lot. We had a lot of different people come on and talk about mental health right now with it being Christmas season, but us not getting to have the same Christmas season as we normally would.
Yeah, some things look different. There's no question. We're challenged in some ways that we're used to when it looks at when you look at Christmas in past years. The whole intent is still the same, though. There's a lot of things about Christmas that just will never change, and there's always the same. The true meaning behind Christmas, all that stuff is still there. We just have to go about it a little bit different way.
I just watched The Grinch, and we had to explain to the kids why the Christmas isn't all about toys and presents and everything else. It was a pretty cool little moment, and it reminds yourself that it isn't all about that, and it's about the little things, and the little things can be very simply done at times and mean an awful lot to
Absolutely,
people.
100%. And like you're saying, this is this stuff that the community is doing. It's it's so much easier when you know that the community is giving back in the way it is. You know, this event here today is that much more fun and enjoyable to participate in 12 hours when you know that we're bringing in money for our hospital and for all the health workers and all that. It just makes it that much more easier because you know that the community is going to step up and they're going to, and we saw it 5 minutes into the 7 o'clock, that first hour. 5 minutes after 7, boom.
Boom, there it is.
Yeah.
Well, before I kick you out of here, because you now get the treatment of the signs.
I know, I see it. Can we get one? Paul, can you pass me one of those signs? Just so our viewers online can see it, and this is what we've been waving at everybody here. It's either 1 minute, 2 minutes, or wrap up, chatty. So
I've only got that, well, a handful of times today, so it hasn't been too bad. But final words for Mikey Dubs as he closes out. We got about 15, 20 minutes to go before he's done. Just some words to keep him going.
Absolutely. Mikey, you're just, you're so awesome. Keep doing what you're doing. You're an inspiration to so many of us. You've made it look so easy. We're into the last hour, and it looks like you're barely breaking a sweat. And you run past here to go to the washroom and back. Like, you know, you don't need to do that, but here you are just putting in this tremendous effort. So good job, Mikey, and keep her going.
Thanks for being on, Jay, and being a part of this and lending some of your brain power to it, because it's always nice having a different perspective that has been a part of events and just bolster the lineup, so to speak, and make it go off without a hitch.
Absolutely, my pleasure.
Cool. Well, we got a couple more guests, and now that Brad Lake has challenged me to interview more people because he's going to donate how many people I interview, Michelle is backing, cleaning frantically as we get everyone's favorite cleaning guy in the studio. I can't wait.
Can you believe I don't have to clean for myself?
No.
How cool is that? Michelle's doing it for me.
Am I getting Malcolm Radke here at some point? Is He's next. Okay. When Malcolm comes, tell him to bring a cup. Yeah, well, I tell you what. Do you want some of this, Brant? Okay. We'll leave it until Malcolm comes. All right. Now, everybody's favorite cleaning guy. I tell you what, I think that was more of a hit than anything I said. Other than unbelievable.
You know, Sean, my first job when I was in high school, you won't believe this. I was a janitor.
Were you really?
So I'm just going back to my roots, buddy. This is where I started.
It looked too easy for you. Hey, you knew you had the right.
I've done this before.
Well, what do you think of this, sir?
Let me tell you, I got something for you.
You got something for me,
I got something for you. Current actual total.
Okay.
$267,000.
Wow.
$267,350.
$267,000.
Okay, and now you know what you need to do? Find out from Mikey how many kilometers he's ran. We have $223.25 per kilometer, and he's over 100, right?
Yeah.
So
That's
we're
20,
over
we're
20
$20,000
grand there.
Yeah.
We're closing in on 300, buddy.
We're closing in. You hear that, people? With
So-
like a little bit of time left. Mikey, how many K you at? Tell Mike we need to know how many K.
How many?
Hand signals.
Yeah.
He told me he was gunning.
One.
He's going to leave it right till the end.
He's got to be over 120.
Yeah, well, he was telling me 120 is 121 was his goal.
Really?
So
Unreal.
You do the math. What does 121 equate to, Brant, real quick?
Yeah. 121 times 223. That's $27,000, Sean.
And what's 27,000 plus 167?
267.
267.
280. 294.
294.
So
we're within like I have a hard time almost believing that.
We're gonna make her.
We
got 12 minutes.
We're like $6,000-ish away from $300,000. I'm getting the head nod on that. It's crazy. I've been kind of rolling with 224 for so long that I thought, well, man, if we make 250, we're doing good. Now here, you're all just leaving it for the last push. Here we are. The last push.
There was a little huddle out back there. Yeah, they were going to keep this number from you for a bit.
Wow.
And so I'm the lucky guy that got to bring it in.
That's
for you.
pretty cool. That is unbelievable. You know, I got a text from Aaron Foster. I had a cool little thing coming from Justin Agarwal. U13 girls had donated a bit of their money, Brent.
Yeah.
And I got a text from Aaron Foster, and he said, "Hey, Newman, we're working on matching Agarwal's donation with the U13 female, 2 different teams, and I'm expecting a shout-out better than Agarwal's, and we are now at $400 and growing." And another $2,500 from Misty K. And a shout-out to the U13 girls hockey teams. Those ladies all challenging each other. That's at least $500 they've brought in.
Oh, yeah. Incredible. Incredible. How many times have you said unbelievable today? I'm trying to change it up for you here. I'll say incredible.
So
you say unbelievable?
So I got a list. Here's the new word, cockeyed. I'm going a little cockeyed here, trying to keep up to this.
I bet you and Mikey are both going cockeyed.
It's yeah. There's some guys out there having a little bit of fun. They're probably not paying attention anymore because I've said that word too many times to count. And now it's updated. Aaron Foster telling me it's 450 now for Team 2. So whoever Team 2 is, I'm already getting the sign. I don't want no signs.
10 minutes left.
Okay. Well.
Okay, we got to get Malcolm on.
A couple of quick thoughts from you then, just on today. The fact that we're closing in on $300,000 is preposterous. But here we sit, and what do you got to say for that, Mr. Brant Wheeler?
I don't know if I can beat preposterous. My brain's gone to.
Aztec Safety just got us to $300,000.
Woo! Aztec Safety for $4,000. Wow, and we are now over $300,000.
I'm going to try and hold it together now.
I've been a part of the Lloydminster community for a long time, and it never ceases to amaze me.
No, that's
the golf tournaments we did for years, along with all of the other supporters that we had, were just incredible, right? And I mean, this is. Stop that.
No, I know. Well, I've been saying for the last like 3-4 hours that I've been trying to hold. The emotion has been bottled up because I've been trying to hold it together because, I mean, people got to understand, like when you step in here and you're trying to do a good thing, to get support and do, $50,000 last year was a lot of.
It was.
It was emotional to me, and to see everybody just rallying around it like this.
I think it just shows.
It's just I don't have the words, and that's why Unbelievable keeps coming back around. And
it shows the character in our community.
Yeah,
doesn't
absolutely.
Like there are so many good people in this community, so many people that have done well, and even when they're hurting,
they're still helping. Yeah. Give Mikey a few words before you tear me up anymore.
Okay.
Can
I say one thing first?
Yeah.
My focus here at the Health Foundation is legacy giving, and that word, that to put it simply, it's a gift in a will, and that's my focus here at the foundation. And I had an anonymous fella come up to me just a few hours ago and say that he says, "What do I have to do to give when I'm gone?" Is how he worded it. And gift when I'm gone, or give when I'm gone, is the same thing as a gift in a will, and that's legacy giving, and that is. That's something that's going to keep our foundation going for years to come. And so it was just so exciting to me. He didn't want his name used. He didn't want the dollar value used. But if you're considering supporting the foundation, that's one way that all of us can support the foundation, is by leaving a gift in your will.
That's pretty moving too, isn't it, Brian?
It is. Very much, very much.
I appreciate you sharing that. Now,
You bet.
before I kick you out of here,
Words for
you
Mikey.
got to give words to Mike.
All righty. Mikey, can you hear me? Can you hear me, Mikey? We're pulling for you, buddy. Can't believe you've done over 120K. I was thinking 110 would be amazing.
Well, I'm hoping
And
he's at
what now?
120.
120 something?
Something we're hoping.
Unreal, Mikey. Way to go, Mikey. You have pushed us over the top, so thank you so much.
That's great.
Great stuff.
Great stuff. Thank you, Brent, and thanks for stopping in and just.
You bet.
That's big news. So
Thanks,
if you
thank you so much too, man. 12 hours.
People are still pledging.
You know what? They'll be pledging till I don't know what time tonight. And there might be a few tomorrow.
And there might be a few tomorrow.
It wouldn't surprise me.
You know, it was
That's
cool.
this community.
What was cool about last year is we had the calls start coming into the hospital because the line went out and people were calling at like 7:15, and they're like, well, the guy's trying to donate money to the hospital. What is he talking about? And, you know, it's just been, that's been the way it's gone. Yeah. So it doesn't surprise me. That part doesn't surprise me. Yeah. 300,000 sure does. That's an awful lot of money, and that is, you know, unbelievable.
Unbelievable. Way to go, Lloydminster, and
Absolutely.
way to go, everybody that's been a part of this today. Thank you so much.
Thanks, Brad. Okay, now, could you please clean the seat one more time?
One last shot.
One last shot at you as we carry on.
I have my own cleaning lady this time.
Oh, my goodness gracious, folks. So if you just tuned in and you're wondering where we're at, they did the math. You know, we started out with a goal of $200,000. We hit that at roughly, I don't know, 3:30, 4 o'clock. I can't remember now. My brain's foggy. And so then we said, okay, let's do 300,000. And so then we targeted 300,000, and we just hit that while Brant was sitting here. We had 2 donations. Anybody remember who? I apologize to the companies. Aztec donated $4,000 to push us over, and Misty K. So here's a little short story. I'm joined now in by Malcolm Radke. First off, how's it going? We'll let the screen go to you.
Holy smokes, man. Has speechless been used yet? How many cliche words do we have left here?
Laurel, you left a list for you guys.
Oh, right, yeah.
So, no, speechless has not been used.
Speechless, man.
I poured us a glass of scotch because I've gone 45 days straight of nothing in the system, so to speak, preparing for this because I wanted to make sure that it got everything of me, leading up to it, everything. And I can't find a more fitting way than to sit across from the guy who brought me in on it in the beginning and called me 2 weeks before the last one and said, I got this crazy idea.
Lots of time.
Yeah, lots of time, right? You want to talk for 12 hours and we'll see where it goes? I was like, sure. And, you know, we pulled off 54,000 last year, which, you know, was astonishing, implausible, impossible, improbable, inconceivable. And then you said, let's do it again. And let's bring in a staff and do what we've got going on here. And so that's what we've done. And we started out with the goal of 200,000. And we went screaming by that. We started out with hopefully seeing Mikey Dubs run 90K. And now he's went screaming by 100.
Yep.
And we just, while Brant's sitting in here, hit $300,000. Mikey Dubs is well past 100K. His running alone has brought in 20, I don't know what the number is. You guys know. Let's just try and put that in words for me. I know you're speechless, but let's just see what we can do there.
Well,
and do you want
cheers,
cheers?
Buddy. Cheers.
Yeah.
Hell yeah. That's scotch?
That is scotch.
Beautiful. Beautiful. Is it 7 a.m. or 7 p.m., right? Like,
yeah.
You guys are all bringing the same energy as when you walked in here 12 hours ago, which is amazing. So kudos to Mikey. Like, that guy, I think 7 a.m. tomorrow, he'd still be here if we let him. And same with you. Like, you guys are both crushing it. So first off, thank you both very much. Thank God we could do this event. There wasn't much else happening this year, right? And I don't know if you've panned these fine people, but what a production, you guys. This is amazing. The community it's shocking. It's not surprising for Lloydminster, but it is shocking, the total we got to. And totally overwhelmed and grateful. But there's so many sad stories through all COVID, right? Whether it's the small business guys, whether it's the frontline worker who's, like, as we learned today, you know, those ears get pretty sore pretty quick, those masks on. Or in today's case, those isolated, lonely seniors who not only can they not see their family member, they can't even recognize the care aide that they know and love, right? And they're just in all sorts of confusion and dementia and loneliness, and it's tragic. But one positive out of this is tomorrow we get to pick up the phone and call each of those care homes and talk to the managers and just say, hey, the community was here for you. You know, we said if we had 200 grand, here's the things we would buy. By the way, we have another 100 grand on top of that, right? So yeah, I'm speechless. You know, I don't get emotional, but this is just shocks and chills and yeah, it's an emotional moment. This is amazing, man. So, cheers.
Yeah, well, I just, from humble beginnings, I think,
Yes, sir.
of this event in particular. Just started out as, I don't want to use whimsical, but kind of a whimsical idea. Like, you think we can pull this off? Yeah, sure, I'll talk. Whatever.
A year later, you have Ron McLean on.
Yeah.
Right? So I think it's 7 p.m., give or take. And last year we said, you can interview me whenever you're out of people. And by 10 a.m., it's like my second time through, right? So we made it 7 p.m. and here I am. You did awesome.
We had 2 pre-records last year, and we replayed them how often? And we had to put the iPad up to the computer to watch the computer
That's
play.
right, too.
Think about that.
I forgot about that.
2 minutes to 7 p.m. We're 2 minutes away. I want you to say something before we tick it down, but that guy right there is still running. I really want you to say something through to the camera to him because he gets to hear everything.
Mikey, heck of a job. We were doing some math just quickly here. Shut down the emotional side and go to the logic side. Our muck run makes give or take 20 grand a year, and you have surpassed that on your own, one guy, doing 100% of the workload. So thank you so much for that. Your cash alone is going to pay for a whole lot of furniture and a whole lot of plexiglass and a whole lot of iPads. So thank you. And the other thing I'll mention, Daryl Howell didn't say this. He's a former Husky engineer, so there's a bit of a legacy here.
I did not know that.
Yeah.
I went screaming out of here because you probably went, uh-oh, he left me here. You're manning the ship. Mikey Dubs is at 123 kilometers.
Oh my God.
With, he's running the full 6 minutes, so he's still got 6 minutes. He's got to go to 7:03, so he's going to go a few extra minutes because we talked at about 7:03 and he was just starting up, so he's going to go the extra. He's going to make sure it's the full 12. We're into our final minute of a 7 to 7, a 12-hour stream, and I don't know if I got any more words. Like, this has been emotionally charged almost from the get-go. You're the man, and these are all the people. Paul Forges has been the guy who sat here with me for 12 straight hours. A shout-out goes to Paul. Thanks for everything you've done. You've made us look amazing. Michelle has also been in here. They've been the two.
Yay.
Michelle doesn't get enough credit. Totally
amazing.
There you go. There's the team.
Yeah, that's so cool.
There's the team rocking it from behind. They've just been amazing on what they've done. And
6 feet apart, for sure.
Well, and the thing is they've actually it's what they've done today to make this possible has been unbelievable. And they've made it seamless. I've heard the word seamless used by many people watching, and that is like exactly what it is, right? Like from Ron McLean to Jodie Carrington to Hollywood to Rochester to Olds to wherever people are calling in from in the middle of the hospital here in Lloyd, just boom, and there it is, and we carry on, and boom, and Mikey Dubs running above us right now, and closing in on 125, and I'd just like to point out to my oldest brother Jay, looks like you're buying the next bottle because I got that bet right. I said 115 to the brothers, and he surpassed me. He outdid what I said. So just overall, I think we're now surpassed 7 o'clock. I can't be, you're hearing the claps go on. It's been fun. I appreciate everybody tuning into this for 12 straight hours or whatever you could do. Just awesome. $300,000 reached. The pen toss.
Walk off.
So you want to keep going?
I mean, just till Mike's done.
Should we rattle off more names?
Yeah, please.
So Red Bicycle in general, Michelle, crushing it. You met Jill a little bit earlier. True has been around the social media all dang day. Nice introduction to the foundation. Here's a 14-hour shift. Here you go. Randy was here feeding all those names. Sorry about typos or some names on there that shouldn't have been, but everything was like manually done between Randy and Tambry on the back end. So Tambry's the one who, when you open up the letter and it says thank you very much, she's the one who sent it and did all the database and managed everything properly. So hats off to her. She's seen a lot of funky ideas in her time here, and she always seems to translate it into a way that we can collect into cash. Like, okay, so this Mikey character is running for what, and we're taking plunges for what, and anyways, it ends up cash in the hospital's hands thanks to her. So shout out there. Steph and Brandt, Radiothon's a 12-hour event, but it's more like a 6-week event of asking you and getting Paul in place and of course asking donors.
Well,
so
I mean,
thank you to them.
Just think of for the people who watch, right, and realize we did a lot of pre-records.
Mikey's the last 2 minutes.
Does he want to talk?
He just needs that extra encouragement. He's pushing hard. He's on his last 2 minutes.
Hey, Mikey, man, if you're still listening to this, with 2 minutes to go, I want no excuses out of you. I don't even know why you need any more encouragement at this point, but I'm going to give it to you. You give me every morning I wake up. You make me go, there he is again. 6 in the morning, 18 clay. And then he goes, walks around, and he's just like, nonchalant about it. Hey, man, you're a champ. On top of that, if you get me one more K in 2 minutes, that's $200. Don't you dare forget that.
Yes, sir.
So keep moving, keep moving, keep moving.
That's another iPad for an isolated senior in
That's
your local community,
That's right.
my friend.
That's what it's all about. So, well, let's talk about Mikey. While he's running in front of us and we're sitting here drinking this fine scotch and it's just warming my,
Yes, sir. Delicious.
That guy, it is incredible, Mike, what you're doing, right? 125-ish K, he's at 123.
135, 140,
Right? Yeah, he's just killing it. And look at him still going.
You should compare his stride to 7 a.m. I bet you it's oddly similar. He's just totally in the zone.
I got to give a shout-out to them. I got to give a shout-out to everyone that has been a part of this and donated and pushed it and shared it and everything.
Hey.
Right there. Can I get him?
Hell of a run, fella.
Can I get Mike on? You can just see. I'm gonna commentate here for a second. You can just see he may play off like it ain't a difficult task, but what he's just accomplished is monumental. Now I wish you could hear Malcolm, but I'll have to relay the message.
He's plugging himself in.
Yep. Hey, can you hear me, Mike?
Yeah, dude.
Great job, buddy.
How many K?
124.3.
124.3. How are you feeling, big shooter?
Well, the last 5K I turned it up, and the last K I turned it up to a 320 pace.
Well, man, I don't know how you got anything left, but I'm amazed. Did you see 300 grand? And did you hear that your running pushed us over the top?
Man, I'm honestly crying.
Well, I got to be honest, man. What you've done is incredible.
Yeah, it's been fun. I'm sorry.
No, man, it's all good. It's all good. Brant Wheeler came in here and had me in tears. So I feel the emotion, man. It's been an emotionally charged day.
Yeah, man. And you, sorry, lost for words. Spell that cat. K-A-T.
K-A-T, baby.
No, man, you did this. You sparked our $500 let's reach that. And I think we did it. And God forbid for next year.
We may have surpassed $500 there, Mikey.
Yeah, I think so. But it's for a good cause. That last 2 or 3 clicks, that just as fast as I could run after 12 hours was all I thought about was just Bubba wants an iPad. Bubba wants an iPad. And just hammer on it.
Well, and that's exactly what Malcolm said. He said the last K he ran at a 3-minute pace, essentially. As hard as he could go, because it means an iPad for Bubba.
Amazing.
It's just, once again, thanks, Mike, for doing this. And any thoughts to the people who are still on, watching you, and want to know how you're feeling, doing, thoughts, anything you want to say, here's 20, 30 seconds for you.
I feel super good. All the comments, the texts, the FaceTimes, the Zooms, man, it carried me through. The love from everyone. You know me, I love everybody. And my wife called me at the last stand there and just told me you're the no excuse guy. You better do 12 hours on the nose. Don't shortchange it and push. I feel good. I'm not dead. I feel really okay actually. But I don't know, man. You did so well. You dragged me through it all. and everyone. I don't know, dude. My mind's all over the place at the moment.
Awesome. Well, hey, Mikey, go put your feet up. You've definitely earned it. Or if they suggest stretching or whatever after 120 kilometers, 120, whatever it changed out to be, please do whatever is right. And
Yeah,
just
no kidding.
know that the entire community is behind you, and that was unbelievable to be a part of. One more shot at that word for the day, and just thanks again, Mikey.
No excuses, baby. And I got to thank Paul, Michelle, Sean, Jason, Pure Revival for the treadmill, everyone that donated. The list is so damn big. My roommate Chewy for just pounding through as a crew member, bringing me everything I need, and literally all the smiles in this damn building. It's effing amazing.
Cool, man. Thanks, Mike.
Love you, buddy. 2020. We can say that.
2020 in the books. There you have it, Malcolm.
Did he give shout outs to his folks?
Yes, he did. But we can certainly give another one.
Jason Whiting.
Yep.
Alex was running the phones all day. If you called, it was probably her who took the donation. Rich Dixon was welcoming everybody, keeping everybody safe. You had a whole crew who brought the treadmill in. There was, I don't know, staff, Shonda, lined up donations. Like, there's just so many people. So thank you, everybody. Apologies if I missed you. And, of course, thank you to the community, the amazing donors. You guys rock. Way to kick 2020 out of here.
Yeah, let's get it out of here. And thanks again, everybody, for tuning in. It has been a day to remember. I won't soon forget this. You can hear the clapping going on in the background. Thanks again, guys, and that will do it for us today.